Hi everyone. So I hope you are able to hear me and see me, and just give me a thumbs up if you are able to hear me and see me. Okay. So if you are able to hear me and see me, just give me a quick thumbs up. So let's have a quick look at the radiology questions from today's paper, and how many of you appeared for the paper and how many of you are of you gave the paper. Just quickly let me know what were the questions like, because I see. So what I have seen in the recall so far on my Telegram channel as well on the DAMS Telegram channel is that this paper required some thinking to be done. So although I see many of you are saying paper is easy or tough, I would put it at moderate to tough, and I will give more weightage to students who have attended a regular classroom, because lot of questions the images needed you to think. It was not like a direct spotter was not there, you had to think in the image. And I'm sure if you have attended the classes, the DVT, or if you have attended your predictor series or previous year questions, you would have that easy availability in the answers. But if you had not seen the question, and if you could not think on the question, it was tough. So I would rate the overall difficulty level to be moderate. Okay, although you can see it that many, and I would say that the regular classes or your back to basics were the most important source of the questions, because there were many conceptual questions in the radiology. So let us look at the first image. There was a 70-year-old lady with chronic back pain, and there are two set of recall. One of the students had a recall something similar to this. So I want all of you to look at the image. This is your L5, this is your S1. You can see there is anterior slipping of the vertebra over the another. There is a kind of a step deformity that you see here. Was this the image? Was this the image? Okay. And the second image that I wanted you to see is, second option possible is, if there is no slip, there is no anterior slipping, and you only see break in the pars interarticularis. If you only see break in the pars interarticularis, that will be spondylolysis, or we say Scotty dog with collar. And if there is anterior slipping of the vertebra over another, that is spondylolisthesis. So which one of the image was there in the real exam? Let us see if you can answer. Was there an anterior slipping or not? So when I asked most of the students, and most of the students were of the opinion that there was severe pain mentioned in the question had severe pain, okay, agree, and there was anterior slipping of the vertebra, and the break in the pars interarticularis was not visible. So we believe this is the correct image, this is not the correct image. And the choices were something like this: spondylolisthesis, spondylolysis, spondylosis, spondylitis. The correct answer was spondylolisthesis if there is anterior slipping of the vertebra over another. Okay, and most of the people had the opinion of that the image was spondylolisthesis, and there was a clear cut slipping visible in the image. And if you remember, in the predictor series, in the half an hour of predictor series where I had taken, I had spent 3 minutes on spondylolisthesis, the AP view, the Scotty dog appearance, the beheaded Scotty dog appearance, and Scotty dog with collar. It is one of the most useful questions. One of the choices people are saying was TB spine. Okay, one of the choices TB spine. Okay, so we will keep it as TB spine. Okay, beta, very good. So let's see one more question. Another question that many people had pointed out was that there was a image of IVP. So please confirm. Okay, there was a image of IVP. Okay, now tell me, was this the image? Was this the image? And so what is IVP? IVP is a non-invasive investigation in which we do a routine IV injection to put the dye into your bloodstream, and then the calyceus and the excretory system is visible. So first of all, it is a non-invasive investigation. So these are the choices that they were there. Is it an invasive procedure? No. Is it a percutaneous guided procedure? No. It is an intravenous injection of contrast that is given. Can it diagnose cancer? So for cancer you will need to do a CT scan, and the gold standard would always be a biopsy. So out of these, the single best answer that I feel was it is a non-invasive test and can diagnose PUJ obstruction. And you remember, it is one of the previous year questions that is there in your DAMS PYQ discussions. If there is delayed film of IVP shown, and if the pelvic ileal system is still dilated, if it is the ureter is still not visualized, then you think of a PUJ obstruction. Even after giving diuretic, it is not getting clear. So it is not going to diagnose your bladder cancer. So some of you saying choice of bladder cancer, I agree. So bladder cancer is not, you cannot diagnose bladder cancer on IVP. So are you clear now? So the image shown to you was IVP. Okay, and I hope now you understand the value. If you saw DVT, previous year question, classes, then this paper was very easy. But if you only are looking at a direct hit, the paper was tough. It was not a direct question paper. So the image was YAVP. It is a non-invasive test. Can diagnose PUJ obstruction is correct. It cannot diagnose bladder cancer. It is not percutaneous. And even for stones, some of you are saying stones, I don't agree. Even for stones, we prefer NCCT, we don't. So even for stones, you will prefer NCCT. Remember, this is again a previous NEET PG question. Are you all agreeing? So if most of you are agreeing with this question, we will then, so some patient is saying bladder stone. Even if it says bladder stone, remember we see bladder stones on ultrasound. Urinary tract or ureteric stones on NCCT, we have discussed this already. So far I have discussed one image was spondylolisthesis. There was an anterior slipping of one vertebra over another. Second was IVP. Okay, are you clear? Okay, beta. Then there was a question which probably had a pulsatile mass. Most students had and recall similar to this. Okay, I don't know what was the exact image, but this is what the people were recalling, that this is common carotid artery, internal carotid artery, external carotid artery. And they said, so IVP is a non-invasive test, beta. Kirandeep Kaur and everybody who's saying. Okay, are you clear? Okay, beta. Now try and answer. So most people had an idea that there was a angiographic image showing splaying of the carotid bifurcation. This is where the tumor is. This splaying of the carotid bifurcation is called as the Lier sign. If this was the image and this was the question, then probably we are looking at carotid body tumor. This is one of the questions that we had predicted in our Telegram channel also. If many of you are following me on Telegram, and we did a audio discussion on this. So pulsatile mass, Lier sign visible. Was there any aneurysm? Did they show you any dilatation of the artery, or the arteries were of normal caliber? Is one of the important questions that we need to know. Kya internal carotid artery dilated thi ya nahi thi? So because I am right now only looking at immediate post exam, I am also waiting from the students to help me with the recall, because my answer would depend on your recall. So if this was Lier sign, if this is the same image, if the artery was not dilated, then we will think of carotid body tumor. It is the classic location, classic sign. Lier sign is the sign. And going by the comment, I see most people are saying the vessels were normal in caliber. There was no aneurysm visible. There was only splaying of the arteries visible. Okay. So this is most of the time, the people are saying. Some people are saying that if you could it was compressible. That would lead to some thoughts to be discussed later on. But if we see only the image, this image is carotid body tumor. But if it is like going away on, compression, we'll look at it. So we will look at the history and recreate the question and then see if the answer changes or not. So far the image that I have in the recall was this. So another question that you see in every of my class I had always predicted was 30-year-old male patient, MRI of the brain was shown. There was a dural based enhancing mass. Can you see this mass? Yes, it is attached to the dura, and it has dural tail sign visible. What do you think we are looking at? Is it a meningioma, glioma, ependymoma, or pilocytic astrocytoma? Okay, so the best answer here will be a meningioma. This is not a glioma because it is dural based, dural tail sign. We have discussed this in all our classes. Remember, you remember pilocytic astrocytoma will be seen in the cerebellum and optic pathways. That you can keep in mind for future. And ependymoma will be seen in the fourth ventricle. If you remember from my classes, we've discussed all of this in length. Okay, are you able to answer this? Okay, beta. Was the image okay with you? Okay, some people are saying the question choice had strawberry hemangioma. So we will, look at, confirm with the ENT people what was the question. And so most people are saying it was compressible, strawberry was written in the choices. So we will look at this question again with the ENT team and then come back with you. I'm happy that you could get many questions directly from the DAMS CBT as well. And I'm happy that we could help. So one of the discussions, if you attended the regular class on the back to basics in the MRI section, I told you that now MRI has a lot of role to play to identify adenomyosis. So if this is so, there was an image similar to this in the paper. This is your bladder. This is your bladder. Okay. And I will just mark the endometrial cavity for you. This is your endometrial thickness. Can you see this? I have marked the ET. So posterior to the ET, so it was kind of, the uterus looked a little retroflexed in the image where the people have described. And this was the area that asymmetrically on the posterior myometrium, you could see an area with some cystic spaces, and it was a 30-year-old lady. Some people said 30-year-old lady with lower abdominal discomfort. Okay, so was the age 30 year or more than that? What was the age? Anyone? So this is what we could gather so far. So ET was marked and salt and pepper like appearance was visible. Okay, the lesion was anterior to the ET or posterior. Some are saying anterior. Okay, but mainly the thing was, if you remember from my class, I told you if the junctional zone is involved, if the junctional zone is thickened and you have cystic changes, dark and white changes, probably we are looking at adenomyosis. So people are saying 40 to 44-year-old. Some people are 30, some 40. So can you see, after a single paper, most people are not able to recall. So 33-year-old, okay. So, okay, and you see some people are saying 65. How it is possible that, same question, some people are saying 32, some people are 65. So please read the question carefully. Most people said it was adenomyosis. It was more in asymmetrical, and the junctional zone was hypertrophied. It had black and white cystic changes. 30-odd-year-old female. That was what most people had written in the recall when we had done it. So I believe that one of the reasons that they are showing MRI is because MRI can diagnose adenomyosis. So if you remember in my class, I told you MRI is the investigation of choice. If you remember the regular class, we discussed the uterine anatomy, what is endometrium, what is a junctional zone, what is myometrium, and that is where we thought. So there are multiple variants of this image. The adenomyosis could be there in the anterior. So most people said that the disease was posterior to the ET. So this is what I have marked for you. This is why I have selected this image from the Google search, that because most people said this is how it was. ET was marked and they had shown like this. So I think that it must be adenomyosis, but it is subject to the recall, and because it is little too early into the day. By the time it comes the night, I will have a better recall from all of you. We are still ongoing with the recall process. Next is a image where image similar to this was there in the exam. This is a barium swallow image of the upper esophagus. So you can see there is the upper part of the neck can be seen in the barium, and I want you to see this image. I will help you by marking it. If the question had black arrow marked this area, the black arrow marked, those are your valleculae. If the white arrow was marked, that is your piriform sinus. That is your piriform sinus. Okay. So I want all of you to confirm, look at the image and confirm. So if the upper structures were marked, then that is veliculae. If the bottom structure was marked, then it is piriform sinus. And some of you are saying fibroid. My gut feeling is, why would they show an MRI to show you a fibroid? It is not the standard of care. I believe it would have been adenomyosis. That is what my gut feeling says, because it doesn't make sense to have a MRI like image for a MBBS student to ask you fibroid, because fibroid you can diagnose even on ultrasound. Why would you show MRI? That is my doubt. So if the image was at the white arrow, then we were showing you piriform sinus. It is between the thyroid laminae and the aryepiglottic fold. So always remember, जो ऊपर दिख रहा है वो veliculae, that is between the tongue and the epiglottis, and जो bottom में दिख रहा है, that is the piriform sinus between the thyroid cartilage and the aryepiglottic fold. This is not the thyroid cartilage. Many people thought that this is a plain X-ray. This is a barium image. This is not a plain X-ray, and some people thought this is a plain X-ray and they thought this is a thyroid cartilage calcification. This was piriform sinus. Most people say this is the image, and these were the choices according to most people. And the arrows were also same, black and white, and they said white arrow had to be identified. Okay, what do you think? So what do you think? Was this the question? Let's see. So this is your velicula, this is your piriform sinus. Now are you clear? Okay, so one is velicular, two is piriform sinus. Always remember this. This is one of the commonest question. And next question that we had was a similar question that if you have attended my regular class, you should be able to solve. इसमें क्या था? Patient had stiffness of back, X-ray SI joint was normal, anterior uveitis. So the question had something like this: anterior uveitis है, X-ray पे SI joint normal था, stiffness of back था. Okay, are you able to confirm? Was this the question? Stiffness लिखा था, anterior uveitis था, X-ray normal था. So if now my question is, then if you have anterior uveitis, stiffness of back, we are thinking of ankylosing spondylitis. Okay, and if the X-ray is normal in early stages, if you remember from my class in the ankylosing spondylitis section, I have categorically mentioned अगर X-ray normal होगा तो MRI SI joint करना पड़ेगा. If you remember, we had a at length discussion also. Okay, MRI can pick up sacroiliitis earlier than what a X-ray can pick up, better than a CT, because it can show you bone marrow edema in the ankylosing spondylitis, in the sacroiliitis. So I believe the answer is MRI SI joints, which can help you to show bilateral sacroiliitis. This is the correct answer, and I believe you should keep it in the exam. So even if ankylosing spondylitis was not mentioned, that is what you are suspecting. Okay, that is what you are suspecting based on the image. Okay, are you able to answer? Okay, now there is some controversial images in the paper. So there was a question where the choices were retroperitoneal tumor, gallbladder mass, hepatocellular cancer, RCC. Patient had some flank pain and something similar image was there. Most people said कि सर कुछ cystic सा image था, right side पे दिख रहा था, kidney नहीं दिखाई दे रही थी. Okay, most people had this kind of image. So I am little disturbed by the recall, because it is not easy to just by the recall to get the image. But most people said कि coronal CT था. Okay, दूसरा लोगों ने बोला कि सर किडनी नहीं दिख रही थी और राइट साइड पे लिवर के नीचे दिख रहा था. मोस्ट पीपल सेड इट वाज बिलो द लिवर एंड इट वाज मोर सिस्टिक. ठीक है, मोस्ट पीपल इन द रिकॉल सेड इट थोड़ा लिक्विड लग रहा था, लिवर के नीचे था, and it was more coronal image. So if it is more coronal image, this is your gallbladder. So this looks like the GB cancer or a gallbladder carcinoma on this particular image. But were you able to see the kidney or not? Were you able to see the kidney or not is a very important question that I want to know from you. Kidney दिख रही थी कि नहीं दिख रही थी? बोलो. So अगर kidney दिख रही होती और उसके अंदर से ट्यूमर अराइज कर रहा होगा तो ऐसा दिखेगा. Okay, so then I should be able to see the margins of the tumor with the kidney and मतलब पता चलना चाहिए. So I am not sure what was the image, but if this was the image, this is a gallbladder mass that I have selected. Most people said that they had given a coronal image. Okay, kidney was not seen, mass was below the liver, it was cystic, and so this is your right side, this is your left side. अच्छा ये तो बता दो राइट पे था कि लेफ्ट पे था, अब ये भी बता दो भाई, क्योंकि कोई कहता है लेफ्ट पे था, कोई राइट पे. अब लेफ्ट पे था तो गॉल ब्लैडर नहीं हो सकता ना. सो वाज इट राइट और लेफ्ट? Was it right or left? Anyone? Okay. So, most people had the opinion it was on the right side. So, if it is on the right side, and I am sure the examiner will not be testing you on the side. Gallbladder choice में भी gallbladder भी choice में लिखा है, liver भी choice में लिखा है, बीमारी पक्का right पे होगी. ऐसा भी मत सोचो ना examiner को कि तेरा right left पूछने के लिए थोड़ी खेल रहा है. Do you agree कि नहीं? Most likely the disease was on the right side. It was below the liver. We have to think that most likely it was a gallbladder cancer. This is what I believe based on this. Next image, I don't have the image. It was either Perthes, TB hip, developmental dysplasia of the hip, and SSV. So I am just waiting for the correct image for this image, and I'll talk to Dr. Tushar also, and we'll finalize the question. But something similar to this we had predicted in the predictor series कि अगर flattening of the femoral head दिखेगा तो always think of Perthes. So I don't know, did you see flattening of the femoral head or not? Was it there or not? So that depends on the image. So because I came in little early in the first session, I am not seen the image so far. Okay, right side पे था और 8-year-old patient था, ठीक है, 8-year-old patient था, right side पे था, और कोई कह रहा है SCFE था, कोई कह रहा Perthes. So let us wait for this image. I don't have the exact image. Another question where I don't have the image, but was there was a opacity on the right side in the X-ray in the exam. The horizontal, I just want you to confirm from me, this is the classroom image from your DAMS app. So if you remember this image, and we discussed at length in the class के trachea is usually central, लेकिन थोड़ा सा right पे normally भी हो सकता है, and they had the horizontal fissure was in its normal position. So this is my discussion of consolidation in the regular class. Remember, this is where I discussed consolidation in the regular class. Collapse होगा तो it will be more triangular. This fissure would have been pulled up. तो वो fissure pulled up होता. Most people said कि fissure. Okay, so what were the choices? Consolidation, collapse. और भी कोई choice था बेटा? Abscess, फीवर कफ था, उसे फीवर कफ था, वो भी फीवर कफ भी कंसोलिडेशन की फेवर में जा रहा है बेटा. ओके, और एनी अदर चॉइस? लंग एब्सेस. ओके, लंग एब्सेस भी कह रहे थे. सो इफ यू रिमेंबर फ्रॉम लंग एब्सेस होगा तो बेटा आई टोल्ड यू इट विल बी मोर लाइक अ कैविटी विद अ एयर फ्लूइड लेवल. दिस पर्टिकुलर रिकॉल मोस्ट पीपल सेड दैट दिस वाज ओपेसिटी ऑन द राइट साइड, ट्रेकिया वाज स्लाइटली पुल्ड टुवर्ड्स द राइट, ठीक है, बट द फिशर वाज हॉरिजॉन्टल. So trachea थोड़ा सा right पे तो naturally होता है. So I believe it was consolidation based on what the people have told me. So choices were consolidation, collapse, abscess, and malignancy. So malignancy, to call it malignancy, you need to have rib erosion. अगर rib erosion था, if there was rib erosion, then you would have thought of Pankos tumor. So most people had fever, cough, horizontal fissure in its normal position, slight deviation of trachea to the right. Probably we are looking at right upper lobe consolidation. That is what most people had in the question. Okay, are you clear? Are you able to answer this now? Okay, so this was the recall that I had. So again, emphasizing that this particular recall tells me that it was a thinking paper. It was a thinking question paper, especially in radiology. It was not a like spotter कि cobra head देख लो बता दो, ये देख लो बता, ऐसा नहीं था. सोचना पड़ रहा था कि क्या दिख रहा है. Okay, some people are saying the choice was saying pneumothorax. Okay, and some people are saying air bronchogram दिख रहा था. If air bronchogram was there, fever was there, it's all pointing towards consolidation more and more. Okay, so I feel looking at the questions of radiology, it is more moderate in difficulty, but if you have attended the regular classes on the mobile DAMS app, if you now go back and you attend the lectures, you will find that ये तो सब कुछ वही है जो हमने discussions किया था. but you had to go through the discussions to understand it. ऐसा नहीं था ये फोटो दिखाया वही आ गया, जादू मंत्र थोड़ी कर रहे हैं ना. So we had, I think, a 10 minutes discussion on uterine MRI, discussing on adenomyosis in the class. There was a discussion in the predictor for around spondylolisthesis. We talked about collapse consolidation, upper lobe collapse consolidation, horizontal fissure, trachea. आराम से 15-20 मिनट क्लास में लगाए इन चीजों के ऊपर. सो आई थिंक अगर आपने क्लास किया था तो कर पाओगे. और वैसे ही अगर आपको याद हो, व्हेन वी वर डिस्कसिंग एंकिलोजिंग स्पॉन्डिलाइटिस इन दी क्लास, आई टोल्ड यू कई बार ऐसा होता है एक्सरे नॉर्मल मिलता है, एमआरआई करना पड़ता है. यू रिमेंबर दिस? सो इफ यू अटेंडेड द क्लास यू विल गेट दोस क्लिनिकल टिप्स फ्रॉम द पेपर. दिस वाज द काइंड ऑफ पेपर दैट आई बिलीव इट वाज मोर क्लिनिकल. It had more, you know, say like application in the question. थोड़ा अप्लाई करना पड़ रहा था. It was not like direct. जैसे IVP दिखा के ये नहीं पूछा पहचान क्या है. It was more like which of the following statements about the shown investigation is correct. Okay. So my suggestion and my request to all the future aspirants also will be, don't skip the main classes. Don't go for any shortcut in the beginning of your journey. है ना, थोड़ा concept बनाएंगे, it will always be more easy to solve. So on this note, I will now go back and do further recall, further talk to more students, try to create the correct options for you, and then I will post it on my Telegram channel as well as on my Instagram. I will post it any further changes, and on the DAMS app we will update these questions in the PYQ section. I will now invite Dr. Deepti to. So was there any question on diffuse axonal injury? Okay, some people are saying koi question tha diffuse axonal injury pe. Was there any question on diffuse axonal injury? Okay, one question some people said was there on congenital diaphragmatic hernia. Probably X-ray पे क्या था, left side पे दिख रहा था diaphragmatic defect, and did you see the bowel loops going into the thorax? अगर था तो then that would see congenital diaphragmatic hernia. And this is something that we predict in every paper and every exam. Was there any question on diffuse axonal injury with the patient comatose after head injury? Then we think of shearing injury to the brain and we think of diffuse axonal injury. So I feel the paper is moderate. It is not tough, but it is, and the CT is normal. Yes, CT is normal in usually in a diffuse axonal injury. So I feel if you have attended the classes, you had an edge if you have done the regular classroom, or you have attended the back to basics. This paper was thinking paper, thinking. एक बार सोच लेंगे तो paper तो आसान था. Okay, so I wish you all the best, and I'll invite Dr. Deepti to join for the discussion on obs and gynae session.
हाँ जी एवरीवन, हाँ जी एवरीवन, welcome everyone. So first of all, I would definitely want to ask, how was your paper, right? Before I jump on to obs and gynae. So how was your paper? Perfect. A very good afternoon to everybody. And अब मुझे बताओ, how was obs and gynae? हाँ, कैसा था? How was obs and gynae for everyone? I think almost everything has been from LRR and DVT. I really don't even have to go beyond that. Plus, do you think that doing the marathon, especially the image based, helped you? Yes. So I think 3 or 4 images directly from the marathon session in obs and gynae have come. Yes, was it a good idea? Great. So let's look at let's look at the first question. There was a question on impending rupture. So these are direct notes that we have taught you, especially in LRR and DVT. Everything is covered in that. Yes, so look at this. They had given you these keywords, right? There was fetal bradycardia, yes, maternal tachycardia. The patient was a case of previous cesarean. Then they had given you station -1 and something like that, right? I have always told you it is a game of keywords. This was impending rupture and therefore the management was LSCS. Yes, everyone? So that labor question, previous cesarean, it had these keywords. Okay, so the answer is emergency cesarean. Okay, is that clear? Perfect. Okay, let's go on to the next one. Are you ready? Let's look at the next question. So again, our direct image from the DVT, they had asked you what is the total loading dose of MagSulf. So look at this, loading dose of MagSulf is 4 grams IV plus 10 grams IM. So a total of 14 grams, right? So yes, exactly. The answer is 14 grams with loading dose. Okay, yes, everyone good? Okay, perfect. So this was the second question. Let's look at the third one. Umbilical cord prolapse. Yes, the third question was umbilical cord prolapse. Again, a direct from, this is again an image of your live rapid revision. Look at this. We have to push up the presenting part and do a retrograde filling of the bladder. Even the sequence is what I had given you. Yes, so push the presenting part up and retrograde filling of the bladder. Is that clear to everyone? Yes, exactly. So this is the question on umbilical cord prolapse. The answer was push up the presenting part and retrograde filling of the bladder. Okay, perfect. Chalo, let's go on to the next question. Next question, I even gave this in my predictor series, in the Telegram quizzes, in CBTs, and you all were fighting with me, huh? Shoulder dystocia, the sequence. Yes, so look at this, the sequence. So we are doing McRoberts maneuver. There was one option with McRoberts maneuver as the first, and the last maneuver was Zavanelli, right? So the correct answer, only one was, okay, only one option was, as I said, जिसमें McRoberts first आ रहा था और Zavanelli last आ रहा था, right? So McRoberts, I think then the sequence that they correctly gave you or was, the option was McRoberts सबसे पहले, फिर Rubens, फिर Gaskin, as you can see here, and सबसे last में, yes, Zavanelli. Okay, the last one was Zavanelli. Very good, good job, good job, good job. Are you ready for the next one? Okay, so I've just simply brought the direct images itself. Let's look at this. Yes, so again the same one that I was trying to say. So McRoberts, right? Then in your particular question, the exact option was McRoberts, then it was Rubens, then it was Gaskins, and then it was Zavanelli as the last one. Okay, perfect. Then amniotic band syndrome. Yes, you got a question on amniotic band syndrome directly from your classes. There is no beating around the bush. Okay, every single thing I've brought a direct image exactly that we have taught you exactly in the same way, and I think I'm glad I did the image based session in marathon. Yes, so image based session in the marathon. Jaldi jaldi, okay, jaldi jaldi karte hain. Chalo, theek hai, okay. Then you got a question on sequence of repair of episiotomy, right? Sequence of repair of episiotomy. Look at this, very clearly written: vaginal mucosa, perineal muscles, and end में 6, skin. Okay, so vaginal mucosa, muscles, and skin. Okay, from the recall what I got was, they've told me that this was, let us get the image correctly, right? But yes, as far as the so far recall goes, it is amniotic band syndrome. If we have the correct image or exact image, we will see. This is based on recall. Okay, so mucosa, फिर muscles, फिर skin. Okay, perfect. So the order of repair. ठीक, चलो आगे करें. एक्सटर्नल cephalic version पे एक question था, is it right that during ECV there is fetal distress? Was that the question? Yes, so one of the question was, and I always said ECV पे question आएगा, right? I've been repeatedly saying ECV पे question आएगा. So external cephalic version, okay, there is fetal distress. What are you going to do next? So you have to rotate the baby to the original position. वो शायद option में नहीं था, but yes, you'll have to eventually take her up for. No question. Okay. Perfect. ठीक है. I got one of the recalls as ECV का contraindication. No worries. We will move on to the next one. Okay. Direct question which we also did in NEET PG marathon. ठीक है. नहीं आया था. Fair enough. Relax. Okay. A direct question from your marathon session as well as your LRR and your classes Lofset's maneuver, right? For delivery of extended arms. Okay, so delivery of extended arms, it was an image based question and the answer is Lofset's maneuver. Yes, the answer is Lofset's maneuver. Okay, and it was an IBQ. All right, let's look at the next one. This was also an image based question. Controlled cord traction. Yes, there was a image based question on controlled cord traction. Is that right? Yes, CCT, also called as modified Brand-Andrews maneuver. Okay, so modified Brand-Andrews maneuver. Okay, so this is modified Brand-Andrews or controlled cord traction. Again, we have covered this in the obstetric marathon session as well in the IBQs. Yes, so I clearly did a IBQ based marathon this time, and yes, as I said, you got at least 4 direct questions from there. Okay? Now, let's look at the next one. There was a question where they have asked you about prevention for thrombosis in a patient of cesarean section with a BMI more than 35. Yes, BMI more than 35, prevention for or prophylaxis for thrombosis in a patient undergoing cesarean. I have actually directly taught in the classes that whenever you are talking about thrombosis in pregnancy, the answer is low molecular weight heparin. Okay, so the answer is low molecular weight heparin. Whether you want to give it for prevention or you want to give it for treatment, so enoxaparin or low molecular weight heparin is the answer. Yes. Cesarean section हो रहा है, BMI is more than 35. What are you going to do for prevention? Okay. Chalo, let's look at the next one. So there was a question that there is prolapse. Okay. And what ligament is damaged if there is prolapse? What is the answer? The only correct answer there was McEnroe or cardinal ligaments. I've always very clearly taught that among the ligaments, always the single best answer is cardinal. Okay, the single best answer is cardinal ligament. All right, that is the answer, which is also called as McEnroe ligament, also called as what? Transverse cervical ligament. मैं हमेशा बोलती हूँ that whenever they have to trick you, they will use the different name. So transverse cervical, McEnroe, cardinal, they are all the name of the same ligament. Round ligament is never a main support, beta ji. It is never a main support. Broad ligament was in the options. It is never a support, right? Very, very clearly taught you this. Okay. Yes, even if the patient is postpartum, तो क्या दोगे? Why would you do anything? You're only giving it for prevention. Why would you give warfarin for prevention? The answer remains as low molecular weight heparin. Okay. So what? Even postpartum DVT, even for treatment we give low molecular weight heparin. यहाँ तो prevention की बात हो रही है. Okay. चलो, let's look at this. There was a question which has asked you day 21 to 25 hormonal profile. Yes, especially in DVT I have taught you, and I did say that they will ask you the correct hormones in the different phases. And it has to be a high estrogen and progesterone, whereas a low LH and FSH. I have specially taught these graphs even in DVT, right? So E or P होंगे, सबसे ज़्यादा progesterone होगा, but the most important thing is that the LH and FSH are going to be very low in the luteal phase. All right, is that clear? Yes. So this is the hormonal profile, especially when it comes to, yes, in the second half where they give 21 to 24 or 21 to 25. Okay, is that clear to everyone? Okay, let's look at the next one. The next question you had was on primary ovarian insufficiency, which is the other name for premature ovarian failure. They had given you that the LH and FSH levels are high and the AMH levels are low, right? So high LH, FSH, low AMH, the diagnosis is primary ovarian insufficiency, which is the other name for what? Premature ovarian failure. Okay, let's look at the next one. Very, very important. Indirectly, yes, covered, and Dr. Sumer has covered it in his classes. We've always taught you keywords को इकट्ठा करना है image के साथ. They gave you an image of MRI, but the keyword was heavy bleeding, right? The key was heavy bleeding. They gave you an MRI, and you have to know that the best investigation where you use MRI is adenomyosis. So an indirect one, an application one, we don't really need an MRI for fibroids. I've told you in the class as well, right? So this is going to be the MRI image that you had is adenomyosis. You had to put your brain together that the answer is adenomyosis. That is what you use it for. There was a short history, okay? Chalo, let's look at the next one. Again, a direct question from your DVT. Hydronephrosis, right? So hydronephrosis is stage 3B. Okay, so hydroureter, hydronephrosis, it is going to be stage 3B. Pelvic side wall is going to be stage 3B. It is also a previous question. Yes, chalo, let's look at the next one. The next one was a post-menopausal bleeding patient and endometrial thickness given as 16 mm. Yes, so endometrial thickness given as I think 14 or 16 mm. Patient had post-menopausal bleeding. You had to do, what are you going to do next? The answer is endometrial biopsy. Again, it is directly from your DVT, LRR, notes. We've covered it so many times. The answer is biopsy, not hysterectomy. You had to answer the next step. We have done it even in our Telegram quizzes as a, revision question. Okay, again, directly from your NEET PG marathon, they gave you a ovarian tumor and they used the keywords. I had taught you how to combine the same image with different keywords, right? So if the keyword is, I said, CA125, if the keyword is ascites, if the keyword is omental caking, and very, very clearly written in your DVT, papillary excrescences, right? So papillary excrescences. Then the answer has to be serous cyst adenocarcinoma. Okay, so serous cyst adenocarcinoma. Even if the age was 46, still it is directly given to you. Beyond 45 years of age, any patient who comes to you with irregular bleeding, heavy bleeding, you must do an endometrial biopsy. Okay, so the answer will remain as endometrial biopsy. Okay. Right, so these were quick recall questions. If you feel that there are more, do let me know. So these are like around 20 MCQs. If you know, okay, there was another question. What was the question? Okay, the question was a high blood pressure and what was the history? What was the history? It doesn't matter. Multilocular to serous bhi ho sakte hain. It is a complex mass, solid, cystic. The keyword was CA125. The keyword was what? The keyword was papillary excrescences. Okay. So then the answer remains as serous. Okay. Do let me know when you get more recalls. These are the recalls that I've got so far. Okay, there was a question on NST. What was the question on NST? Yes, two arteries and veins. It is again directly covered in your LRR and DVT. Umbilical cord has two arteries and one vein, and we specially say which one. The left vein is left behind. Okay. So patient, what kind of bleeding? Was she if she was an elderly woman with postmenopausal bleeding, yes, we should take a pap smear. Okay, but I do not have the exact recall, so you should tell me. Okay, somebody is saying AEDF. AEDF, again we have done, the termination has to be done at what time? It has to be done at 32 weeks. We don't go beyond 32 weeks. Okay. Then yes, there was a question on toxoplasmosis and IgG. The keyword was IgG. And 5 years की history है, 5 years पहले toxoplasmosis है, and the keyword is IgG positive. Nothing has to be done. Okay, it is only reassurance. Okay, only reassurance is the answer to that question. Is that clear to everyone? Okay, what was the question on NST? Okay, I agree, there is one acceleration in 20 minutes, but what was it asking you? Was it asking you what do you do next? Then again, directly covered. If it is one acceleration in 20 minutes, I have taught in classes multiple times, the answer is going to be extend the NST for another 20 minutes. Okay, extend NST for another 20 minutes. We need a total of 40 minutes to call it as non-reactive. Okay, all right. Yes, there was a question on presumptive probable signs. So I think Shadwick's was given in the answer there. Is it right? Shadwick's was given in the answer. Yes, the answer is continue up till 40 minutes directly from your class. I'll bring you more images. Especially I tell you, making a case scenario that this is how they will ask you. Okay, what was the question on? Yes, I said Shadwick's was mentioned there, and Shadwick's is a probable sign. Again, I have covered it in marathon session also, LRR also, DVT also. Okay, what was the question? There's another question somebody is saying on crown rump length. What was the question on crown rump length? Okay, irregular cycles, again directly from your class notes. I have specially taught it like this, that in which conditions will you do a first trimester ultrasound, and I make you write 3 things there. The top of the list there is irregular cycles. Another one was LMP not known, and then I said that you have to use crown rump length. Okay, CRL. So irregular cycles, CRL. Were they asking you? Yes, what were they asking you? Were they asking you about CRL? What they asking you, what do you do, or something else about it? Best for gestational age. Yes, the answer is crown rump length. You use CRL as the single best parameter, especially with 2 months amenorrhea. Yes, the answer is CRL. Okay, the answer is CRL. Okay, any other questions that you feel that we haven't covered? Yes, there was a post-hysterectomy specimen. I think the age was 65 years and the uterus otherwise looked normal except the cavity. So most likely, I don't have the image, but the answer is endometrial cancer. Okay, the answer is endometrial cancer. Yes, there was a question on PPH management. What will you do in the labor room? So please remember, उसमें clearly लिखा था medical management has not worked. You are in the labor room. What are you going to do next? What is the answer? Again, direct algorithm from your DVT. The answer is balloon tamponade. Yes, balloon tamponade. Is that clear? Yes, balloon tamponade for that question on 2 months में it will be CRL. Yes, 65 years age था, specimen था, hysterectomy है, but there was no obvious thing in the myometrium or anywhere else except I think the cavity maybe looked a little irregular or a small growth. That is endometrial cancer. Okay. Anything else? Anything else? Okay. What was the question on, was there a question on manual removal of placenta? I didn't get any of this. Okay, what was the question on IFA? So far, I haven't got the recall on iron folic acid. Maybe you gave it to the PSM faculty. I've already covered MagSulf. Okay, it is 14 grams. 14 grams. Okay. Okay, yes, they had asked the loading dose. Okay, loading dose 14 grams. Toxo, I have already told you, reassure. What was the question on HIV? Yes, because it was Toxo 5 years back and the keyword was IgG. So, reassure. IFA, was there a question on IFA tab? I am not sure. I haven't got a question on IFA tab. Okay, the dose we have routinely covered everywhere. I think the PSM teachers have also covered. We have also covered. So, yes, 60, maybe it was not for pregnant women. Was it for a pregnant woman? Okay, what was the question on HIV? 34, I don't know, something. Baby born at 38 weeks, but what was the question on HIV? I haven't got the recall for this. Okay, IFA wala is for 10 to 19 years, so maybe you gave it to the PSM people for the recall. Okay, yes, we've already covered the photo for controlled cord traction. Okay, we have already covered the photo for controlled cord traction. Okay, anything else? Yes, for NST, you have to continue it for 40 minutes. Okay. Okay, somebody's, yes, but what was the HIV question asking you? You're giving me that the baby was delivered at 38 weeks, but what was the question about it? Okay. All right, in the presumptive probable question, I need what all things they had given you. What I remember is, what the students have said is, they've given that the uterus is enlarged and there is Chadwick's sign. Yes, if I am right. So, Chadwick's sign is a sign which is usually considered as a probable sign. Okay. So, till we have a proper recall for that. Okay, anything else? I have already covered the cesarean question. The answer is emergency cesarean because it is impending rupture or maybe frank rupture. So, the answer is emergency cesarean section. Okay. Chalo, are we ready for the next subject? So, till the chat is moving really fast. Oh, all right. I don't know. HIV. Okay, HIV mein they are saying treatment for the baby. So again, primarily a pediatrics or PSM question. That is why probably they did not give the recall to me. So HIV question is, what treatment are you going to give to the baby? Right? So not my domain, and that is why probably students did not give the recall to me about the HIV question. Okay. Cord prolapse already covered. It has to be push up the presenting part and bladder filling. These are all directly from your classes LRR, right? So please remember this. We have actually given you in the order in which you are supposed to do it as well. Okay. Chalo, I think we have surgery next for the recall because all of you want to do a quick recall. Linea nigra is not alone given na, मगर उसके साथ और भी तो चीजें दी हैं, right? So don't just focus on linea nigra, right? There were other keywords also given to you, and that is why probable is going to be a better answer for that question. Okay. Okay, what was the question on amenorrhea and prolactinoma? Anybody amenorrhea and prolactinoma? 170 by 100 and bleeding. What was the age of the patient? Shoulder dystocia we've already covered. Blood stained vaginal discharge. Was she a post-menopausal or an elderly woman? Yes. Was she a post-menopausal or elderly woman? So if she was post-menopausal elderly women with a blood stained discharge, we should definitely take a pap smear. Okay, we should definitely take a pap smear. Uterine prolapse, we already covered. Cardinal ligaments, also called as McEnroe ligaments. Chalo, I think we will start with the next question. Okay. Yes, so postmenopausal elderly women, 68, whatever years, bleed with vaginal discharge, which is blood stain, you definitely should be taking a pap smear. Okay, prolactin level is high. Mechanism I have repeatedly taught every time. High prolactin causes what? A negative feedback on GnRH. Okay, a negative feedback on GnRH, and as a result of which there is suppression of LH and FSH. Okay, LH and FSH. Okay. बायोप्सी डायरेक्टली नहीं करते, बायोप्सी तब करते हैं when there is a visible growth or a visible abnormality on the cervix, then you do a biopsy. All this is even given in your DVT. If you open the respective page on cervical cancer, very clearly given. Postmenopausal bleeding, right? Pap smear is what you do, but yes, if you see a growth or an abnormal cervix, then you can directly take a biopsy. Okay. All right. Done. So should we start with surgery? Beta, agar aap khali linea nigra, you are only recalling one word. I think multiple words were given in that question, so we need a correct recall. Linea nigra was one of the words, but there were other words given in that question as well. Okay. Okay. Chalo, I think we should move ahead with surgery. I have given you almost all the answers, and I hope that you do really well, each one of you. So all the best, and let's just hope that you all come out with flying colors, and we will be waiting for you on the other side for an interview. Okay? All the best everyone, take care. Yes, hydronephrosis, beta hum cover kar chuke hain. I've already listed out these things. Hydronephrosis, hydroureter is 3B. Okay, it is stage 3B. Yes, multiple keywords were given. Okay, chalo. Okay, send me all the options for the question on high blood pressure and bleeding, because some of you are changing age, some of you are changing something else. So I need all 4 options for that question. Okay. Chalo. So we'll now start with surgery recall. Dr. Gaurav is going to come and start with surgery recall. Okay. All the best everyone.
Hi, good afternoon. How was the surgery part today? Okay, so I got some questions, maybe around 20 questions. I guess 8 or 9 were image based. Okay, so not exactly the options I got. So, but let's start the discussion. And if you remember something, or if you remember any other question related to surgery, please let me know. There will be a proper, recall will be done like tomorrow or day after. Okay, so let's see. I guess there was a question on this image-based question, a mannequin, in which a hysterectomy was done on the upper limb, and they asked why this is done. Okay, this was the question. Okay, so this is done for the circumferential full thickness burn over the extremities, or the chest wall, or the abdominal wall. Okay, so this was the question. Okay. Yes. Now there was a question given on the Parkes classification of the perianal fistula, and I guess this suprasphincteric one was marked, and they asked what type of fistula is this as per the Parkes classification. Okay, this was the one, correct? All good? Yes. Now there was a note given for the surgeon's note. Okay, all these things we have discussed so many times in the classes, in the DVT. Okay, so this was the question, surgeon's note. Surgeon's note. Okay. Then there was a question on the breast cancer image. And then breast cancer image, and there was erythema involving more than 1/3 of the skin. Okay, more than 1/3 of the skin, it is inflammatory carcinoma as per the TNM classification, that goes in T4D. Okay, so that will go in T4D. Okay, fistula wale mein kya mark tha? A was marked. So you are saying it was intersphincteric. Okay, so let's say people are saying in this there was, this one was marked. Okay, you are saying this one was marked intersphincteric. Okay, even if the single knot was given and the first was this, I told you in the classes also, if the first one is the double type of half hitch, it is surgeon's knot. Okay, if you are saying even if this was the given, then also the answer is same. Okay. Then there was this question of a image of varicose vein. The patient is having varicose vein for 2 years. Now what complication it can lead to? And I guess in one of the question there was this lipodermatosclerosis and eczema. Is it correct? Is it correct? Okay, even if in case of, see, in the breast cancer lump is there or not there, but if the erythema or the edema involves more than 1/3 of the skin, it is inflammatory carcinoma. Okay, double knot was there, so it was this thing only, surgeon's knot. Okay, so lipodermatosclerosis or eczema. Yes, even if it was not erythema, pudgy orange, then also it is same. Yes, I guess one of the option was sclerotherapy is the best treatment. Sclerotherapy is not the best treatment. Okay, sclerotherapy is not the best treatment. Okay. Then there was this suture image given. I don't know if they, you were saying it was a blue colored suture. Now, blue colored suture is proline. If it is a violet colored can be Vicryl or it can be PDS. Now tell me, what was it? Was it a blue colored suture or a violet colored suture? Okay, what was it? Blue or violet? And they asked that, okay, what is true about this suture? So if it is proline or PDS, it is a monofilament suture. Okay, polydioxanone was written. Polydioxanone was written. If it was written PDS, then also it is a monofilament suture. Okay, polydioxanone was written. PDS written. So if PDS is written, it is a monofilament suture. Monofilament suture. Oh, color was confusing. Okay, doesn't matter. But if they have mentioned polydioxanone, then color does not matter. It is polydioxanone. It is a monofilament suture. Okay, braided is polyfilament. Braided means polyfilament. Polyfilament sutures are like silk, Vicryl. These are the polyfilament suture. Okay. Next, I guess there was a question image based of phimosis. So was it phimosis or was there a like a whitish ring around this? So because if it is a whitish ring around this area, then it is a balanitis xerotica obliterans. If there was no whitish ring, then it will be a phimosis. And what was there in the question? What was there in the question? Color was black, purple, doesn't matter. If they have mentioned polydioxanone, it is a monofilament suture. Whitish ring, Okay, so you are saying there was a whitish ring, then the answer will be balanitis xerotica obliterans. Okay, balanitis xerotica obliterans should be the answer. Yes, meatal stenosis can be seen in both phimosis as well as BXO. Okay. Paraphimosis, this is not paraphimosis. Paraphimosis may the glans will be visible and there will be obstructing ring at the corona. Okay, thickened skin, it will be BXO. Now this question I guess sir also had discussed. There was a pulsatile mass in the neck, CT angiography was given, Liar sign, this is carotid body tumor. Carotid body tumor. Okay, carotid body tumor. Stenosis was in the option. If they have mentioned or if the image shows whitish ring, then it is BXO. Then it is, yes, but that white ring is hard only. That is hard only. Now there was a chest X-ray of congenital diaphragmatic hernia. We all know that most common type is the Bosdalek one, and you can see the bowel loops in the left side of hemithorax. Left side of hemithorax. Okay, so that is congenital diaphragmatic hernia. Okay. See, compressibility can be seen in carotid body tumor also and cystic hygroma also. Okay, but cystic hygroma will not give any changes on the angiography. And I guess there was a angiography image was given and splaying of the carotid vessel was there. Okay, so yes, a carotid body tumor although is a firm tumor, but at times it can decrease in size. Okay, compression, was there a CT or angiography image was given? If the pulsatile is given, if the angio is given, it will be a carotid body tumor. It will be a carotid body tumor. Cystic hygroma is also reducible, but that has nothing to do with the carotid vessels. That has nothing to do with the carotid vessels. Okay. Then I don't know out of these two which type of image was given. See, if the image is showing only this black color thing, there was no infection anywhere, then it will be a dry gangrene. But if the image showed that there is some kind of pus collection, then it will be a wet gangrene. So because wet gangrene is when there is super added infection. So now you tell me what was given, whether it was a dry gangrene or whether it was a wet gangrene. Okay, the black was not there. It was not black. It was a wet gangrene picture. Okay, wet. Okay, so mostly everyone is saying it was a wet gangrene. So most likely something like this image was given. A kind of spreading infection. So yes, wet gangrene is correct. Okay, anything which is spreading. Then there was one question on the Strasberg classification of the bile duct injury, and I guess exactly this image was given or something related to this, but everyone is saying that it was a type 1, type A Strasberg injury. Was this a image? Carotid aneurysm, see in carotid aneurysm on the angiography the swelling is arising directly from the carotid vessel. If it is sitting between the carotid, it will be a carotid body tumor. Okay, so you are saying it was a upper limb picture, not the lower limb. Okay, was there a toe image or a upper limb image? Hand tha, and it was, what color was given? Type C. Type C is when there is, type C injury is in that this aberrant sectoral duct was injured. Okay, so in type C, this is type C. Aberrant sectoral duct is injured. Okay, so you are saying it was upper limb and there was no gangrene given. Okay, so if it was a upper limb picture and there was no gangrene, if it is appearing, you know, either pale or blue, then it will be Raynaud's. Then it will be Raynaud's. Okay. So this was type A Strasbourg. Then this IVP image was given. I guess Sumer sir has already discussed that it is a non-invasive investigation for PUJ obstruction. Non-invasive investigation for PUJ obstruction. Then I guess there was an image of this dermoid cyst or the angular dermoid or the sequestration dermoid. So what was the question asked on this image? Anybody remembers? What was the question asked on this image? This swelling, very typical area. What was the image? I mean, what was the question on this dermoid cyst or the angular dermoid? Okay, so what was the image? I mean, what was the question asked on this dermoid cyst? Was there a question like this? Dermoid, yes. Okay, you are saying tenosynovitis. Let's see whether it was tenosynovitis. Maybe Ortho sir will discuss. Yes. Okay, only diagnosis dermoid cyst. Then there was a question on achalasia cardia. I don't know whether the barium image was given or not. Whether the barium image was given or not. But they asked what is the best investigation. High resolution manometry is the best investigation for achalasia cardia. Okay, that is the investigation of choice, high resolution manometry. Yes, gradually increasing since birth, it will be a dermoid cyst. It will be a dermoid cyst. Okay, so achalasia cardia, manometry was in the option. Yes, yes. Okay, good. Now, this question, there is some confusion. Abdominal trauma, vitals were unstable, there was peritonitis also. They asked what is the next step. CT is out of the question. DPL although can be done, but majority of the people they don't do DPL these days. Okay. Okay, you are saying that this is given. Barium image was given. Barium image was given. Okay, given. Abdominal trauma question. If you remember, no fast option. Okay, fast was not there. That's why I had like question mark. So fast was not in the option. CT, DPL, exploratory laparotomy. You are saying abdominal ultrasound. Abdominal ultrasound. No fast was given, abdominal ultrasound is written. See, fast is a very focused type of investigation. Ultrasound is, I mean, a fast is a type of ultrasound, but it is very focused. So in this case, if it was written abdominal ultrasound, then I don't think this is the correct answer. The correct answer will be exploratory laparotomy. Exploratory laparotomy. Okay, laparotomy was given, that should be the answer. Fast, if they write fast, fast is the better answer, but ultrasound is, I mean, ultrasound means you will see each and every organ and the patient does not have that much time. Okay, exploratory laparotomy or immediate laparotomy, whatever they have mentioned in the laparotomy, that was the correct answer. Now there is a question, I guess pathology people will also discuss. There was a neck swelling with amyloid stroma on histology, so that will be medullary thyroid cancer. History of stab was given, okay, fine. Even if history of stab is given, the answer remains same. Medullary thyroid cancer. Yes, stab injury, hypotension, peritonitis, fine. Fast not given, go for surgery. Medullary thyroid cancer. Medullary thyroid cancer. Okay, medullary thyroid cancer. Then there was a question in which there was a clinical scenario of pheochromocytoma was given and they asked which drug is used for the pre-op preparation. Okay, so we all know, we have, so many times we have discussed this, it will be phenoxybenzamine. Phenoxybenzamine. Yes, synaptophysin positive or all these like pathology people will also discuss phenoxybenzamine. Okay, then there is a question of patient with painless jaundice, there is history of weight loss and there is palpable gallbladder. Answer should be carcinoma head of pancreas. This is known as Courvoisier's law. So many times this has been discussed in the class. Courvoisier's law. Okay, carcinoma head of pancreas or periampullary cancer. I am sure both are not there because carcinoma head of pancreas is a type of periampullary cancer. Is a type of periampullary cancer. Okay. Then there was a question given on landmarks to identify the facial nerve. Now, sir, tell me two things: whether it was a image-based question. Was it a image-based question of the facial nerve landmarks to identify? Palpable gallbladder, you go with this thing only. Palpable gall, if it is soft, it cannot be palpable. Okay, so it has to be a palpable gallbladder because of the over distension. Gallbladder cancer, may the gallbladder can be palpable, but that is at a very late stage. Okay, so okay, you are saying there was a cadaveric image. There was a cadaveric image, and they asked the landmarks to identify facial nerve. Anybody, like, if you are sure that what pointer was there on which exact structure, whether it was a posterior belly of digastric, whether it is Conley's pointer, what was that? What was that given? Okay, somebody is saying no such question on the identification of facial nerve. Okay, if you are saying no such question, let's keep this question in our query that it was not there, then okay, fine. Yes, so was this a question? Structure damaged in the submandibular gland surgery. Was these two different question, or there was only one question on which they have asked the structure? Whether it was submandibular one wala or it was the parotid wala. Submandibular, you are saying submandibular. So see, these are the structures which can get damaged in the submandibular gland surgery: lingual nerve, hypoglossal nerve, marginal mandibular branch of facial, and facial artery and vein. Out of these, which structure was given? Okay, so Mirza is saying these were two different questions. Okay, facial artery was given. Somebody is saying the question, the marker was on facial artery. Was this given in the question? Facial artery? Because marginal mandibular branch, so it will come the moment you give the incision in the fascia only. So if the fascia was not there, if the gland was shown, then the marginal mandibular branch of facial nerve cannot be the answer. Okay, so majority of the people are saying it was a facial artery. Let's see, this is the first thing we are doing. Then we'll look more into the recalls and other thing, and we'll come with the proper answer. Was this a question that there is a patient with RTA, vitals were stable, no CT abnormality, but still the patient died within 2 hours? So what is the likely diagnosis? Okay, so it has to be diffuse axonal injury, because in diffuse axonal injury you will not see any CT abnormality. Okay, so if this question was there, then the answer should be diffuse axonal injury. Okay, was there a question like this, that during laparoscopic surgery there is sudden bleeding? Was there a question like this, that during the laparoscopic surgery there was sudden bleeding? Anything related to, I mean, any question like this? Any question like this? Okay, any question like this? Postpartum findings, diffuse axonal injury was there in the question. Okay, yes, diffuse axonal injury we have discussed. Any question on like this laparoscopic surgery? Okay, no question. Okay, any other question you remember? Any other question related to surgery if you remember? Any other question? Structure behind the epiploic foramen. If IVC, somebody was saying IVC, although anatomy sir will discuss, he might have the options. But if you are saying epiploic foramen posteriorly, yes, the IVC is there. IVC goes posterior, in the posterior boundary of that epiploic foramen. Okay. Okay, so that is fat embolism. This author sir, Tushar sir will discuss. He is the next ones to discuss. Okay, so this is so far the questions we have collected. We'll keep looking for more, and we'll come with a proper recall after we know more questions and the proper answers and the options. Okay, so thank you very much, and I wish you all the very best, and God bless you all. You have done good enough, and I'm sure all of you will get a very good rank and your desired branch in the PG. Thank you very much.
Hello everyone, how are you guys? So hopefully everything was fine. Yes. So I got some questions from the students. कुछ तो recall आ गए हैं, बाकी आप लोगों के साथ मिलके कर लेते हैं. हाँ जी, how was everything? All right, करें start? ओके, तो एक तो क्वेश्चन ये है आप लोगों का, राइट? आई गॉट दिस. ये तो सब लोगों ने एकदम डायरेक्ट स्ट्रेट फॉरवर्ड क्वेश्चन. PDA, persistent ductus arteriosus. I told you when I taught you this topic. ये आप पूछो इनमें से इंपॉर्टेंट क्या है, फोर्थ एंड सिक्स्थ आर्च. आप पूछो कि सबसे इंपॉर्टेंट क्या है, सिक्स्थ आर्च, लेफ्ट साइड डिस्टल पार्ट, दैट मेक्स द persistent ductus arteriosus. Left sixth pharyngeal arch artery only on the distal side, it will be making the ductus arteriosus. I think ये तो आप सब लोगों ने सब एकदम से लगा के कराया होगा, राइट? ऑलराइट. इसके अलावा एक क्वेश्चन आपका ऐसा आया था, वाज इट मार्किंग गिवन ऑन दिस इमेज? बेसिकली आई गॉट द रिकॉल की एंटीरियर एंड पोस्टीरियर बेली ऑफ द डायगेस्ट्रिक पे क्वेश्चन था. Posterior belly of digastric will be supplied by the facial nerve. It is a derivative of the second pharyngeal arch. But the anterior belly will be supplied by this nerve we can see in the diagram. This is the nerve to mylohyoid, which will be also supplying the anterior belly of the digastric, right? So basically, among these options, we'll mark this. ऐसे क्वेश्चन था या चेंज था कुछ इसमें? बिकॉज दिस इज लाइक वी आर गेटिंग द क्वेश्चंस एंड विल मेक द फाइनल रिकॉल. ये तो सारा अभी आप लोगों ने बताया, सो ये रफ वर्क करा है. यस, कैन यू टेल बेटा, इसमें ये ऐसे ही था या कुछ चेंजेस थे? उसके अलावा व्हाट रिकॉल आई गॉट, लेट मी टेल यू. एक क्वेश्चन है हमारा, एंटीरियर एंड पोस्टीरियर बेली ऑफ द डायगेस्ट्रिक. यस, ये क्वेश्चन था. आप क्विकली बताते जाएं इन द चैट बॉक्स. क्विकली कीप ऑन कंफर्मिंग बेटा. सेम क्वेश्चन बट कैडेवरिक इमेज. ओके ओके. आंसर सर्वाइकलिस भी ऑप्शन में था. ऑल राइट. ओके, सेम क्वेश्चन था, कैडेवरिक इमेज में था. साइल चेंज द इमेज. ओके, नाउ नेक्स्ट, एपिप्लोइक फोरामेन पोस्टीरियर इंजरी हुआ. दीज वर द ऑप्शंस व्हिच हैव बीन गिवन बाय the students, and as we know, behind the epiploic foramen we have the IVC, we have the right suprarenal gland, we have the T12 vertebra. So answer will be IVC in this. Okay, all right. अच्छा, सेम ही था लेकिन A and B and B नहीं था. ओके बेटा. और एक क्वेश्चन था, lateral cutaneous nerve of thigh, right? lateral cutaneous nerve of thigh, right? इसमें L2 L3 is the root value. Okay, ये क्वेश्चन हम डिस्कस कर चुके हैं. एक क्वेश्चन, समथिंग वाज रिलेटेड टू सबमैंडिबुलर ग्लैंड. आई थिंक ये सर्जरी में डिस्कस हुआ है आप लोग का, राइट? द नर्व रिलेटेड टू सबमैंडिबुलर ग्लैंड, इज इट डिस्कस्ड इन द सर्जरी? Image of the plexus was given. Okay, all right. ओके, वहां हो चुका है ना, ठीक है. और उसके बाद एक क्वेश्चन ये आया था बेटा, इवर्शन में व्हाट विल बी द इंजरी? इन केस ऑफ इवर्शन व्हाट विल बी द इंजरी? देन आंसर विल बी deltoid ligament. ट्राइसेप्स पे पूछा है तो ट्राइसेप्स इज कमिंग फ्रॉम द इंफ्राग्लिनोइड ट्यूबरकल बेटा, नॉट सुप्राग्लिनोइड. इसको नोट कर लेते हैं. नंबर 10 क्वेश्चन यू आर आस्किंग कि ट्राइसेप्स का लैटरल हेड सॉरी लॉन्ग हेड का, लेटर हेड तो ह्यूमरस पे ही आ जाएगा सीधे above the like spiral groove. Long head of the triceps, it comes from the infraglenoid tubercle, right? This question was there. सुप्राग्लिनॉइड पे तो लॉन्ग हेड ऑफ बाइसेप्स होता है बेटा, इंफ्राग्लिनॉइड ट्यूबरकल पे होता है ये. ऑल राइट, नाउ दिस क्वेश्चन वाज देयर, 10th नर्व नोड प्रेजेंट इन विच ऑफ द कॉलम. जो ऑप्शन स्टूडेंट्स ने बताए हैं उन ऑप्शंस में से GSE कॉलम विल बी द आंसर, बिकॉज GSE कॉलम इज हैविंग 3rd 4th 6th एंड 12th. इसमें 10th नर्व नहीं होता, राइट? And what was the question for the jugular foramen? I got the everted foot में answer will be deltoid ligament. Deltoid ligament will be, you see, the medial ligament is called as deltoid ligament, है ना? और वो eversion पे तो medial side में stretch आता है. This is the question where I told you the trick also. I told you अगर eversion पे question आएगा तो आप quickly answer लगा सकते हो. Why? Because you can see that all three choices will be having fibular word in that. Only one word which will not be having fibular will be the answer, and the deltoid ligament is a medial ligament. Okay. Winging of scapula पे भी question था. Nerve passing through the jugular foramen. Okay, nerve passing through this foramen except. Okay, all except type question था ये. Okay. जनरल सोमेटिक एफरेंट होता है बेटा 10th नर्व में. GSA में मेजरली वी कंसीडर द फेस, राइट? मेजरली वी कंसीडर द फेस दैट ट्राइजेमिनल नर्व, बट जो GSA का पोर्शन हमारा यहां से लेके आता है ना, सोमेटिक सेंसेशन, ऑरिकुलर ब्रांच ऑफ द वेगस, ऑरिकुलर ब्रांच ऑफ द वेगस होता है ना वहां पे, दैट इज 10th नर्व, उसमें इन्वॉल्व होता है. बट GSE विल बी द बेटर आंसर. GVE तो डेफिनेट है उसमें, इसमें कोई डाउट नहीं है. Okay, jugular foramen 9th 10th 11th will pass, we know. GSA was option, so okay, I'll see which one was not there. GSA was there. SVE was there or not there? But 10th nerve will be like GSE will be the answer, beta. Okay, 9th 10th 11th 12th यहाँ पे option थे. 9th 10th 11th 12th option थे, तो 12th nerve is the answer because 12th nerve will not be passing from here. Now there was one question where ureter histology was given. Was it ureter? Students have described कि ureter था. आप बताओ बेटा ureter है? GSC था ही नहीं. कुछ बच्चे कह रहे हैं था, कुछ बच्चे कह रहे नहीं था. अब बेसिकली जिसने नहीं लगाया GSC वो बोल रहे कि नहीं था. बेटा देखो क्वेश्चन तो यू हैव ऑलरेडी मार्क्ड, राइट? सो नाउ एनीवे योर रिस्पॉन्सेज हैव बीन, यू सी, इट हैज बीन लॉक्ड एंड यू गाइज आर गोइंग टू रॉक, एंड आई डेफिनेटली प्रे टू गॉड फॉर यू गाइज ग्रैंड सक्सेस, है ना? बट अभी हम रिकॉल कर रहे हैं तो यहाँ पे थोड़ा सा बायस नहीं होना है. आपने जो लगाया उस पर नहीं ज़्यादा सोचना कि हमने क्या लगाया है. Transitional epithelium was seen, all right, and students are telling that this was ureter, although few more recalled as you are saying. What are the other options? GB was there, trachea, ureter. GB, ureter, trachea. Ureter was not given, but transitional epithelium was given. Yes, but you have to identify ना बेटा कि क्या है वो. GSC था ना बेटा, GSC था, that should be the answer as most of the students have recalled. पहला ही ऑप्शन था, करेक्ट. तो फिर वही आंसर है. मैं कह रहा हूँ ना कई बार हम बायस हो जाते हैं, बट कोई बात नहीं बेटा. चलो अब जो बायसनेस से हमें थोड़ा बाहर निकलना है. Pain felt in the shoulder after hyperextension of the hand while exercise. What were the options and all? Trachea, GB, ureter, and all. What was the fourth? Duodenum. Okay. The fourth was duodenum. इनमें से अगर आप कह रहे हो कि ट्रांजिशनल एपिथेलियम था तो यूरेटर ही बनेगा ना बेटा फिर आंसर. Okay. So these were the all recall which I have got. अभी तक ये क्वेश्चन है, मैं क्विकली एक बार आपको बता देता हूँ. सो क्वेश्चन जो थे इसके, इफ यू गेट टू नो सम अदर क्वेश्चन एंड सबमेंडिबल ग्लैंड के लिए यू प्लीज टेल मी. यहाँ इसमें सिर्फ रिकॉल में आया कि सबमेंडिबल ग्लैंड चॉइसेस क्या थी नहीं पता. ऐसा इमेज था, मतलब ऐसा तो नहीं था ऑफ कोर्स. आई मीन the nerve was shown in the intraoperative, some part was given, right? It was kind of surgery question maybe. But what was the exact question? Can you please tell? And also can you please tell कि उसमें क्या options थे? सबमैंडिबुलर ग्लैंड लिफ्टेड था. ओके. मार्जिनल मैंडिबुलर नर्व एक ऑप्शन है. फेशियल आर्टरी है. हाइपोग्लोसल नर्व है. Can you see, was it like this, like gland के just नीचे we have the hypoglossal nerve? Was this relationship was there in your image? Not of, it was not this image, of course I understand. But my question is, ऐसा अगर similar type अगर आपने gland देखा है, उसके just नीचे nerve ऐसा कुछ relationship था? अगर ऐसा कुछ relationship था तो फिर 12th nerve should be the answer, but I am not sure. मुझे थोड़ा सा इस पे और information चाहिए, then I will make the final. Okay? All right. Anterior belly of the digastric was marked over there. Yes, all right. जस्ट नीचे था तो फिर जस्ट नीचे तो यही नर्व है, हाइपोग्लोसल ही है ना बेटा. इफ यू से जस्ट नीचे नर्व है, आई टोल्ड यू, ये हमने कई बार पढ़ी है ये वाली इमेज, यू रिमेंबर. Lingual nerve and hypoglossal nerve will be definitely affected here, and hypoglossal nerve is just below it. All right, chalo. All right. So that was all, dear friends. Okay. So that was all which I got from you guys, and then I will prepare the final recall. These were all the questions: anterior and posterior digastric, epiploic foramen, lateral cutaneous nerve of thigh, submandibular gland. इस पे I will find the options, but as of now it looks like hypoglossal. And then persistent ductus arteriosus, eversion injury. Then the 10th nerve which is not present in answer most likely is GSE. Ureter histology, I got the responses, I got all the options also. Jugular foramen, 12th nerve is the answer. Triceps long head infraglenoid tubercle. All right. Thank you so much. All the very best. God bless you all.
Hello, good evening. Good evening. Hope you, all people wrote the exam. Now you are little tired mood also, some excited mood also. Whatever it may be, don't worry. Just it's a recall. I got first-hand information what you people gave. Just I'm going to reflect. So one question: 7-year-old girl child came with her mother with complaints of perianal itching and history of worm around anus. Microscopy, same image. Great. I used to tell in my class, yeah. Anal pruritus, appendicitis, auto-infection, and barrel-shaped kidney or barrel-shaped eggs. Micro is good. Hi boss. Great. I love you. Finally all correct in micro. Great. That is the news. What about audio? Audio is okay. Audio is okay. Just I'll check. Micro is good. Yes, audio is good. Come on. So same image, that's important because you people gave the same image. Same kidney shape eggs. It is nothing but no second choice. Enterobius vermicularis. Today I got only one choices, but I will make all the things. Final version on the way. It is just a trailer. Main movie is waiting for you. All previous year question. And if I am correct actually, this is the first question of PYQ I have started this year. This year when I am discussing PYQ, first question was Enterobius vermicularis. You remember? Great. Next is cavitation in lung, budding yeast cells in macrophages. SDA agar, microscopy shown in the image. See the microscopy, same image. It is having tuberculate conidia. And budding yeast in macrophage. Always think of histoplasma capsulatum. This is also directly from notes. Histoplasma capsulatum. See? Hey, don't worry. Wait for 1 or 2 minutes. Only few questions. Don't worry. Okay. Next is fungi causing lung infection, dichotomous branching. I don't know the image is there or not. This is called dichotomous V-shaped branching. Septotyphae, V-shaped branching. Almost same image. Thank you. Is aspergillus. This is image based question or not? A maximum 15 minutes, 10 minutes I'll finish it up. Don't worry. Don't say go fast. Because I get some information from you, my dear kids. This is aspergillus. Dichotomous branching, aspergillus, septotyphae. Great. No image. Great. Leave it. Brain specimen was giving 3 questions from meningitis. A bleeding vessel, petechial hemorrhage with rash and hypotension, causative agent. So I don't know, all questions are mixed actually. I'm separating it. Bleeding vessel, petechial hemorrhage, Neisseria meningitidis. Got it? Audio very clear because I'm hearing the audio. Vesicular lesions around the mouth, trigeminal neuralgia, intranuclear inclusion bodies. Always think of herpes simplex virus 1. Trigeminal neuralgia, that is the point, key point. Herpes simplex 1. Herpes simplex 2 goes to sacral ganglia. Varicella zoster virus, you can get dorsal root ganglia. Make it easy. Herpes, great. Abscess, gram positive filamentous bacteria, modified acid fast stain. Over. Gram positive filamentous modified acid fast stain. One and only, always think of nocardia. Great. Always think of nocardia. Got it? Right. Next is yes, nocardia is there. That is the answer. Multinucleated giant cells. I can add. Zank smear. You can think of herpes. Multinucleated giant cells. Herpes. Nocardia. Great. Next is conjunctival suffusion. Wherever the word conjunctival suffusion comes, past 3 years we are getting the question. Okay, see the notes. I the same point I have mentioned here. Non-ectric phase of leptospirosis. Leptospira, otherwise called Weil's bacteria. It's called Weil's disease. What's your answer? Whether it is leptospira or Weil's disease. Yes, Zeal-Nielsen strain positive. Yes, that is called modified acid fast stain, my dear. Zeal-Nielsen strain positive. Weil's disease positive. You're right. I'll get the other option soon. Don't worry. So people are happy. Micro is little severe subject this time. And a patient with clinical condition shown the image, septate IV with flower shape along with lymphatic involvement, where there is the discharge sinus granules. You can think of mycetoma. You can get septate IV. mycetoma, you can get septate hyphae. Yeah, shame cert also, correct, exactly. Okay, septate hyphae. This was I taught in app regular. Okay, right. So what's the answer? Not arthrospore, not pseudohyphae. Okay, it produces septate hyphae, flower like conidia, where you can see sporothrix. Septate hyphae, I can go for the answer. I will check it. Next is a test to identify organism syndromic approach. Multiple diseases syndrome. A syndrome is made up of multiple. Go for multiplex PCR. If we want to go for increased specificity, nested PCR, the same question they asked last year also. Last year also the same question came. Multiple organisms, multiplex PCR. One organism, multiple characters, nested PCR. Flower also may be right. Actually, I'll get the exact options, my dear. Don't be panic. I am wrong. You are not wrong. We'll get the exact question. It may be vary. See, one controversy question is there. I'm coming. Don't worry. Abortive with malignant pustule, McFadden reaction. What else you want? Half sleep, you can answer. It is Bacillus anthracis. Abortive with malignant pustule, McFadden reaction. Agent is anything any meningitis, multiplex, multiple organisms you want to diagnose, multiplex PCR. That's all. A child came with bloody diarrhea after consumption of milk, gram negative rods. That's the one clue. See, staph aureus and Clostridium perfringens, gram positive. Remove this. Vibrio paramegaly associated with seafood. Dairy, poultry, always think of Campylobacter jejuni. I thought this time they asked GBS, but anyway they asked question in Campylobacter jejuni. My prediction, Guillain-Barré syndrome. Okay, but Campylobacter jejuni, great. Cervical lymphadenopathy with squamous cell carcinoma. If they mention base of tongue, I can go for human papilloma virus. If the base of tongue is not there, because I got two from two kids. Kids are helping me like anything. I named them Abhishek, Nikita. Many kids are helping. Okay. Human papilloma virus in case of tongue is present. If tongue is not there, then Epstein-Barr virus. I will get back you with clarity. Yes, Shubham Ghosh mentioned base of tongue. Base of tongue means you can go for human papilloma virus. Possibilities are more. I'll get the full question because there are 50% it is dancing. Somebody mentioned no base, medical assemble base, no base. Yeah, that is the problem. Base of tongue is present or not. I will confirm with other sources also, other kits also. Then I will decide. Don't be panic now. First hand information. Patient with leg swelling, biopsy shows, microfilariae image. What is the reason for his edema? Leg swelling due to lymphatic obstruction. It is called elephantiasis. Elephantiasis, lymphatic obstruction. Ulcer was present. See, ulcer present, lateral border, base of tongue given, lateral tongue given. Okay, everybody is giving one option. You directly put it in the group. I will discuss with some other kids. I'll get back you. It's a first hand information. Just 1 hour, 2 hours after exam. Okay, we prepared. We put PPT, we made all the options like everything ready. We people are working like you only. Yes, my dear. A female with chronic meningitis, what test you are going to see? Chronic meningitis and among the options, terminal complement deficiency. See this in the DVT. Complement deficiency leads to toxoplasma as well as Neisseria infection. I don't know what other clues. Some satellite. Yes, you just put it in the group, my dear. Micromagics group will put. I will mix it. I'll get all the ingredients. I'll put nice biryani for you. I'll prepare. Don't worry. Tomorrow I'll come with full options. Don't worry. Oral hair liquid is the hint. Oh my god. Who is that? Asmit Anand. OHL is there, then go for EBV. If everybody accepting OHL is present, then I can go for EBV. Okay, right. Female with chronic meningitis, choose the test. Terminal. Nikita, I will not leave you. Oh my god, Prithviraj. Great. Group A beta hemolytic streptococci attachment with. See, attachment mainly with M protein. If M protein is not there, next is cell wall. You see my notes. First I'll put cell wall. Main is shape, support, attachment. Cell wall is made up of teichoic acid. Gram positive cell wall is made up of teichoic acid, lipoteichoic acid. Whatever the option. Squamous cell carcinoma was mentioned. Repeated gonococcal dissemination, C5b to C9. Manush Ravi, 100% microstriated, DVD Zindabad. Oh my god, thank you. Thanks for your words. Okay, anyway, our hard work is not wasted. Good. One or two questions. Meningitis prophylaxis they asked. Remember, RCC is the prophylaxis. Rifampicin, ciprofloxacin, ceftriaxone, rifampicin, ceftriaxone. Capsule is antiphagocytic, my dears. Capsule is antiphagocytic. Slim layer attachment with medical device, not with this thing. Don't worry. Meningitis, rifampicin. Is there any? What are the other choices? Mysore dosa, sir. Doxycycline is there? Not. Amoxicillin is one option. No. Okay, then you can go for rifampicin. If ceftriaxone, ciprofloxacin not there, rifampicin is the good choice. But if these people are present, we need to think any other clues. Doxy is not the drug. Azithro is not the drug. Don't worry. Okay. A female patient came with toxoplasma infection 4 years before. What will you do now? I got two options. Continue pregnancy because it's a post infection. She is protected with IgG. Unless otherwise, if she's symptomatic, no need to do the test also. You can continue her pregnancy. I don't know about other two choices. Ciprofloxacin is there means it's tough choice to you because ciprofloxacin also we can give because India like country single dose of single drug of rifampicin may cause resistance to tuberculosis. I need to check because I got one word, sir. Prophylaxis, meningitis, rifampicin. That's all. What about other choices? I will get the other choices, then I will get the best one. Don't worry. IgG positive. Great. Positive means protection. This is protection. Let her continue the pregnancy. Ciplox was there. Okay. No Cipro. See, within 5 minutes we get a controversy. Somebody says no Cipro, somebody says Cipro present. So aram se you can think no Cipro was there in other question. Cipro was there in other question. Good. That's all, my dears. Now I got 17 questions for you. Okay. Still something is pending. Some overlapping will be there. Some mosquito lying on this thing. Water flat. It is a PSM question. But the mosquito is Aedes mosquito. If they ask about Zika virus, dengue virus, it's a micro question. Same mosquito. What is where it lives? How the life cycle? Then it goes to PSM. Don't worry. Some overlapping will be there. Don't worry. So I completed 17 questions till now. Till 3 to 4 questions on the way. Kids are ready to give. So 20 question, 10% from microbiology, 100% strike rate. Okay. If anybody become the topper, getting good seat, don't forget microbiology is your savior. Okay. Thank you very much. God bless you. Okay. Thank you.
Okay. My answer. Okay, sir. Okay, sir. Fine, sir. Fine. Okay. So, good evening to all. My dear friends, can I please share your experience? How was the Mughal session today? I think all the questions were easy. Yeah, fantastic evening. I think most of the questions are very simple and straight from class notes. I think. What's your opinion, doctor? Yeah, good. Yes, good evening. Good evening. Happy. Yes, good. Bentralizumab, good. Okay, good. I think most of them are very easy question. I think I have some question from students side. I just go through the questions. Okay, please. Okay, a 6-year-old child with fever and seizure. What will best drug of choice for this case? Answer will be your diazepam. Rectal diazepam is the drug of choice for our so-called febrile seizure. I think very simple. Okay, so what we discussed in the classroom, the rectal diazepam is the drug of choice for febrile, whereas intravenous lorazepam drug of choice for status epilepticus. Okay, so the first question I think very simple. They given about diazepam, valproate, ferritin. One more option I given 8,000 is given. I think. Okay, all right. So for the question 1, the right answer will be your diazepam. Yes, question 1 over. Now question number 2. Look here. Amidurine inhibiting which phase? This was our favorite topic and a very wonderful topic. We know amidurine is a class 3 drug. Class 3 drug mean potassium blocker acting on blocking the efflux of potassium acting on phase 3. Okay. So amidurine, even though it's a multi-ion chain blocker, it's maximally blocking potassium, primarily potassium blocker, also having sodium chain blocking property, calcium blocking property, and beta blocking property. And this is class 3. So, okay, phase 3. Very good. Second question also good. Very good. Now, coming to the third question. This was discussed in classroom. And preferred drug for prophylaxis. Come on. This year in anti-arrhythmic. So, 3 questions. Fantastic questions. Okay. Preferred drug for prophylaxis PSVT. What answer you made? Again, IV adenosine or verapamil, IV amidurine, and one more option given. Can I get what option? I want to get one more option. Can you please tell? So here the preferred answer will be going for, say, normally for prophylaxis to prevent recurrence, we go for oral verapamil. So answer for a question, oral verapamil. If they asking drug of choice for acute attack of SVT mean, go for adenosine. If the question is acute, what mean go for IV adenosine? Whereas asking prophylaxis, I think can I clarify? They're asking about prophylaxis or for acute. Can you please just type one? Okay. So CCB. Okay. Good. So question, I think they ask about prophylaxis, am I right? They ask about prophylaxis, am I right? Yes. Prophylaxis. Prophylaxis mean go for oral verapamil. That's best answer. For acute only we go for intravenous. For prophylaxis oral. Okay. So answer go for this one. And then fourth question, I think about the rhythm. This question came or not, I don't know, but somebody posted a question. ATL fibrillation patient, in this patient, what is useful for reversal of rhythm? Can you please answer? What option given? Rhythm reversal. Okay, prophylaxis, okay. Everybody, okay, for this question, easy or so one. Okay. We will write full question with the proper options and we post one more time. Okay, now I just recalling the questions. So now the third question asked about atrial fibrillation patient. Rhythm reversal, this was asked, no. So here this was discussed in classroom. In 8 cases, for rate controller, we go for option the mnemonic BCD, beta blocker, CC like verapamil, LTS, D for digoxin. Whereas for rhythm reversal, class 3 drug like amidurine and dofetilide, ibuprofen. So for rhythm reversal, we go for class 3 drug, the so-called amidurine, dofetilide, ibuprofen, and vernicalin. So here the answers based on question only. Okay, the rate control mean only these are the rate control drug. Am I right? Yeah. And thiazide diuretic causing dash effect on calcium. This is a question. I don't know what exact options are given. I think questions were integrated question, but should post only stem of the question, not the proper option, not this. So I think Tyson based the question asked. The answers they're going to ask calcium reabsorption. Tyson asking calcium reabsorption. Loop directly causing calcium loss, whereas Tyson causing calcium reabsorption. This was one question, all right? Yeah, right. So in anti-Arabic 3 question, in CNS every 4 question, fourth question, now fifth question over, right? Mechanics has asked. So thiazide causes thiazide related question on calcium. Thiazide causing calcium reabsorption, thereby preventing calciuria, thereby preventing kidney stone formation, useful for preventing. Why thiazide? Why thiazide decreasing stones? Because thiazide decreases calcium excretion. Thiazide causing calcium reabsorption, preventing calciuria, thereby prevents. Okay, thiazide causes calcium reabsorption. Yes, good. Right. Now, patient with HIV and TB. What drug do we start first? I think they ask her. Can you please see, doctor? You please post all the complete question in our DAMS official Telegram channel. From there, I will guide the question and I will make complete notes and will give a PDF or video discussion for you. So now just we run through what are the questions. Okay. Whenever asking TB and HIV, what are TB? First, we have to start treatment for what? Do not delay. Actually, when first you have treatment for TB, because when you start treatment for HIV, they're going to risk of immune reconstitution, inflammatory syndrome going to occur. So, I think whether they're given any CD4 count, doctor, if they're not given CD4 count, actually CD4 count less than 50 mean just within 2 weeks you can start ART. When the count is more than 50 mean, wait for 8 days. I think they are given CD4 count less than 150, less than 150. Actually, less than 150 mean 2 to 8 weeks gaps most important. Okay. Other than meningitis, here definitely 8 weeks. So depending upon the count, normally first we give treatment for ART, and then first we go for TB treatment, and then we go for ART. Okay. This question is controversial. Okay, they given see from 150 to 80 something. Okay. Normally the guidelines is when CD4 count less than 50 mean start treatment for HIV within 2 weeks. When more than 50 mean go for wait for 8 weeks. This was guideline. But anyway, I'll get exact option and I'll post you. Find this. I normally give 2 to 4 weeks gaps for your question. I think the answer 2 weeks gap. Okay. And CKD with anemia. This question came, but exact options nobody posting. Somebody putting erythropoietin, somebody dolopoietin. What was the exact option? The answer for the question we having epoietin and dolopoietin. What the question? They're asking about CKD with the anemia. The best is go for erythropoietin. We go for erythropoietin preparation. Here we have epoietin and dolopoietin. What option given? Poietin. Poietin. This was the our typing only poietin. What poietin? Yes, epoietin, dolopoietin. Okay, actually the erythropoietin preparations are epoietin and dolopoietin, but I just want no complete option for this. If you go for mean long acting mean better go for darbepoetin alpha. That's the best answer. And this is I think very favorite question. Benralizumab targeting against what? The options I'm not able to get, but still this question came. Yes. Okay. Thank you, Bhaskar. Best faculty. Okay. It's not time to discuss all these things. Now, benralizumab, it is the IL-5 receptor blocker. In the class we discussed, we have 3 IL-5 blocker useful for treatment of asthma. One is pepolizumab, resilizumab, and benralizumab. Here, benralizumab is IL-5 receptor blocker. Remaining thing IL-5 blocker. This was we discussed in class. Okay, so it's an IL-5 blocker. Yeah, strike 100% strike rate. Good, fantastic, good. And then Onaprasan. I think this is a question regarding prokinetic activity. Lower is sphincter spasm, I remember you, sir, in this question. Yeah, thank you, Soumya. Thank you for your compliments. This is what boosting the faculty to teach nicely. Okay, okay. People like you giving boost for us to teach properly. Thank you, ma'am. So there's one question regarding lower is for sphincter spasm. I think prokinetic. I think the option one person and metacloprid something. So the answer the question. One person is the potassium competitive acid pump blocker drug of choice for 50 health. Whereas the I think ask about GRD, gas to the different diseases. So procainamine in the option I think go for metaclopramide. It's a D2 blocker with 5-HT4 agonism with 5-3 antagonism. That's I think is the best answer. Okay. So this your voice audible in the classroom. Wow, while writing test my voice. That what? So when we teach, the voice should go and should depending on brain that going to easily cross the blood-brain barrier. That's what my aim in the classroom. Anyway, thank you for a compliment. It's good. Now, metaclopramide is primarily a D2 blocker with the 5-HT4 agonism and 5-HT antagonism. That's the best program I think in your option. Okay, and then and this, I think there's one more question regarding anti-TB drug. I think resistant INH, I'm not able to get full question. If I get the full question, I'll post it definitely. Okay. So question regarding anti-TB drug with is resistant something what I should do like this. So this question, I'm not getting full question. If I get, I'll post you definitely. Okay. And then there's one question regarding petrol case mechanism action. Yes, it came or not? Is a drug for gouty arthritis. It's acting as a recombinant form of uric acid. Uric acid are group of enzymes going to activate, going to cause rapid metabolism of uric acid that will be useful for hyperuricemia. In case of severe acute hyperuricemia, like tumor-like syndrome, we go for RAS uric acid and petrotic acid. These are useful for severe hyperuricemia called recombinant uric acid analog. Yes, this question came, no? Resistant, then okay. From resistant, then what is the first line given for? Okay. Yeah. I'll verify the question and tell you. Okay. So it's a recombinant uric acid analog going to cause rapid metabolism of uric acid that will be useful for hyperuricemia. Okay. Then next question. Very interesting question for ANS. Pheochromocytoma preoperative hypertension control. What this is the stem of the question. I think proper question will get and post you. So main question here options I don't know, but the best answer. Anybody want to answer? Uh, yeah, Meenakshi is very good option. Hydrolyze is going to hydrolyze uric acid. Okay, it's not going to transporter. You're going to hydrolyze. Okay, very good. Hydrolyze is good. Now look here. For pheochromocytoma, option we go for surgery. But before that, what is the best controller? Here answer phenoxybenzone, drug of choice. In classroom, I just mentioned very important. It's a non-selective, irreversible alpha blocker. The fantastic drug to control hypertension due to pheochromocytoma. Okay, and it's a very important area. So I discuss properly. I think it's easy for you. Okay. Claudine also the best drug for treatment in this case will be go for phenoxybenzone. Good, all are good. Suman, Amita, all fantastic mark. You're going to get a very good rank. May God bless you. Good. Yeka. So pre-operative go for phenoxybenzone. My dear friends who are attending this YouTube channel, please post in my Telegram channel or in WhatsApp number complete question and complete option doctor. Good lack of time are rushing because other faculties are waiting to discuss all the things. So please, can you please post all the questions? It's a humble request, okay? And then there's one question regarding anti-retroviral pregnancy. I don't know what is the exact question. Somebody told some anti-retroviral pregnancy, what is safe or which is unsafe, or how to proceed in the normal section or cesarean. What question I'm not able to get. So please post this question. Okay. And then very another in diabetes chapter, definitely two questions come every year. This is one question. And this very interesting question. Okay. And which is the important anti-diabetes useful for heart failure? Okay. It is AGL2 blocker like DAPA, EMPA, and sotagliflozin. I think they asked about empagliflozin. Yes, good. This was very important in my classroom. So DAPA, EMPA, and sotagliflozin are anti-diabetic drug. Comes under AGL2 blocker. Very, very fantastic drug for treatment of heart failure. Okay, so that is the question. 34-week mother with HIV, baby delivered 88 weeks. What the okay. I'll verify the question. Okay. So here the answers your EMPA and SOTA. I think option given EMPA reversing. I think everybody will say good. And then another interesting question they asked: a schizophrenia patient and haloperidol was responding well for the last 2 years. Now presented with orofacial dyskinesia, choreiform peak-like movements, and possibly abnormal movement disorder. What can be the proper diagnosis and treatment? Can answer the question? This is another favorite question. I think myself and Dr. Sachin both we discussed the question. Anyway, haloperidol, a typical drug blocking D2. That too when taken for 2 years, chronic therapy. On chronic therapy, they cause one type is called what? Tardive dyskinesia. Tardive means delay in the answer. Dyskinesia. Abnormal movement disorder. Okay. Orofacial movement. This article we repeatedly discussing in our DVT, in LRR, and also in previous also. So, in case of tardive dyskinesia, look here. Abnormal, late onset, abnormal peri-oral movements. This is what our basic. If we go and read our back to basic, if you see all the question what asked today is from basic and our class workbook. So I think this year is very cakewalk for you. It's good. Anyway, answer is going for valbenazine. Tardive dyskinesia because of valbenazine. Okay, and this is from anesthesia part. Anyway, which following does not has histamine property? Cis atracurium, a derivative atracurium least risk of having histamine property. So no risk of bronchospasm, no risk of hypotension. Okay, so this one. Mostly when class notes. Divya, very good ma, very good ma. Many hyperthermia treatment. Drug choice dandolin, everybody knows, but what exact question, what option I have to get? Anyway, the drug of choice for many hyperthermia, dandolin. So, actually, dandolin is a drug of choice for neuroleptic syndrome as well as drug of choice for migraine hyperthermia. It's a direct anti-histamine acting on ryanodine receptor, blocking the release of calcium from ryanodine. Okay. There's no sister option. Which one cost? Okay. Which one cost? Okay. Then least means cystathionine. Which one cost means it's not answer. Yes. Okay. Now see, I will modify the question. I want to modify the question. Okay. Will cost. Okay. And come on. Female with the oral lesion burning after taking spicy food. I think it can be pharmacology or psychiatry, even dermatology question because there's a lichenoid drug reaction in the mouth. So, which drug causing oral lesion burning after taking spicy food? The answer for it, I think beta blocker because beta blocker also reported. Now, next option lithium can be, but this I have to verify. Anyway, here the answer I go for beta blocker. Beta blocker, lichen planus lesion, because we know in pharmacology this may cause, but lithium also doubt. I verify and tell you. Anyway, answer I go for option D. Because there's one line in Harrison somewhere I discussed, studied a drug like beta blocker, antimalarial, NSAID are known cause for causing lichenoid like eruptions. Okay. And this and all the posted, but exact question not getting hyperpigmentation caused by ACT is what they want to say. I don't understand. This headlines. And then this what I told TB the Resident Doctors. I'll get the question. This I think all faculty discussed meningeal prophylaxis. Best chance go for rifampicin. Here, best is go for rifampicin. Meningeal prophylaxis. Best is go for rifampicin. If ceftriax option not given, next best is go for rifampicin. Okay. And I think one more question regarding migraine prophylaxis asked. I don't know what exactly. I think family history of heart attack problem, but they want to give prophylaxis. What the best? I think. Any idea about this? Is photo was there with the question migraine. Okay, that's not the buccal. No, not buccal ulcer. Gokulon is not buccal ulcer. Okay, somewhat like our options. Family history. Women with migraine and family history of CVD for. I mean, if they have coronary artery heart disease, for them best to go for propranolol because propranolol useful prophylaxis. That's a wonderful drug for CH patient. I think that means Sumatriptan only for acute migraine. They ask you for prophylaxis for patient with coronary artery heart disease and prophylaxis mean I think better option go for this one. Family history given CAD. Family history of coronary artery heart disease with migraine prophylaxis mean I think we go for propranolol. Propranolol wonderful drug for severe disease as well as wonderful drug for prophylaxis migraine. That's best option. No. No, Deepak Kumar, the patient was on somatotron, but no relief, no problem. Patient, they ask you only prophylactic therapy. That means somatotron will not come under prophylaxis, only for acute attack. Okay, only acute. So, I think best to go for propranolol. I have tried to get other options also. If the question come migraine with the family history of chronic artery disease, best drug for prophylaxis go for this one. Asthma question, I think bendralism is an interleukin 5 receptor antagonist. Okay, I think I had got almost a 20 to 21 question. Out of this, most of question about 20 question only from our class notes only. Okay, so I think this year NEET PG conversation is wonderful, very simple. May God bless you and kindly post all your question when you record with option to me so that I can prepare a good video for you and repost it. Okay, so ergometin, smartphone, propranolol. Okay, that's your prophylaxis. Oh, another question asthma. Okay, other than Bendalism, one more question asthma. Okay, Thyroid question was thyroid control stone because of inhibiting calcium excretion. Okay, so I'll verify. One more question asthma. I'll check and verify. Okay, thank you for giving great opportunity to recap all the questions. Thank you very much. Thank you very much. Okay, the full detailed question with options will post after some time. Okay, thank you very much, ma. Thank you very much.
Anji, good evening everyone. Good evening, good evening. Am I audible? सुनाई दे रहा है सबको? Good evening Shrey, good evening Dr. Reddy, good evening Priyanka. I hope you all got your exam done very well. मजा आया सबको एग्जाम में? Arvind, hello, Satyajit, physics. Yes. SWT का deltoid ligament से question आया था. Nice. Rohit Raman, Percy, Spondylolisthesis, yes. Spondylolisthesis was there, but it was has already been discussed in radiology. Okay, so what all questions were there? एक बार देख लेते हैं थोड़ा सा. Hi Akshay. I think I'm pronouncing it right. So अभी देख लेते हैं एक बार क्या क्या क्वेश्चन आए थे. So one question which was very clear that came in the exam was fat embolism syndrome, है ना? ये क्वेश्चन वो तो क्लियरली है कि fat embolism syndrome का क्वेश्चन आया है. Everybody is saying कि क्वेश्चन आया. So what else? ऑडियो विजुअल क्लियर है? Is the audio visual clear? Alright, so one question was on fat embolism syndrome. एक क्वेश्चन जो है वो इस पे आया था fat embolism syndrome पे. Then we had one more question. ठीक है, there was one more question on people were telling about Paget's disease. ठीक है, एक क्वेश्चन इस people बता रहे थे कि Paget's के ऊपर आया है क्वेश्चन. और एक क्वेश्चन और क्या आया था? Meralgia parasitica. There is one more question. Meralgia parasitica. Alright, so there was one more question, Meralgia parasitica. Now there is one more question which was either on fourth question was somebody saying Percy, somebody saying TB, somebody saying SCFT. तो सब लोग अलग अलग बात बोल रहे हैं कि कोई बोल रहा उस पे आया था, कोई बोल रहा उस पे आया था. तो वो क्लैरिटी नहीं है कि किस पे आया था. ठीक है, so one thing is clear that there is no clarity on that. अच्छा, एक क्वेश्चन जो है वो आया था पीरियड्स के ऊपर जो आया था वो दैट वाज अबाउट प्रोग्रेसिव. जो पीरियड्स वाला क्वेश्चन था दैट वाज अबाउट प्रोग्रेसिव एनलार्जमेंट ऑफ द हैट साइज. दैट क्वेश्चन वाज प्रोग्रेसिव एनलार्जमेंट ऑफ द हैट साइज. सो दैट वाज बेसिकली पीरियड्स. ठीक है, नेक्स्ट इसके बाद जो एक क्वेश्चन आया था कंपार्टमेंट सिंड्रोम पे क्वेश्चन था. दिस क्वेश्चन वाज ऑन कंपार्टमेंट सिंड्रोम that somebody had a tibial shaft fracture and वो passive stretching करी तो उसकी वजह से पेन हो गया. So there was one question on that. So ये कुछ basic questions थे जो हमने देखे थे. फिर शॉर्ट में उसका आंसर था ऑफ कोर्स कंपार्टमेंट सिंड्रोम का. देन ये क्वेश्चन ऐसे आया था परचीज वाला कि 8-year-old बॉय पेनलेस लिम्ब और एक एक्सरे दिया हुआ था. So I think ये क्वेश्चन उससे रिलेटेड था. Many people were messaging that उसमें acetabulum was damaged. If acetabulum is damaged, it is going towards tuberculosis. ठीक है, if acetabulum is damaged, it is going towards tuberculosis. Yeah, TB, Perthes, TDS, SCFE, TB, उसमें उस तरफ जाएंगे. अब there was one question about biochemical levels of calcium, phosphate and all. वो कोई, can anybody tell me what was that? What was that question? Any other question on that? नहीं. अच्छा, periods वाले के अंदर you were saying that ALP level were mentioned around 900. ठीक. Anything else? So anything else apart from this that you think you got? Fat embolism हो गया, heart size वाला हो गया, meralgia parasitica हो गया. Any other question that you think you got? Okay, it was painless. ठीक ठीक है. चलिए आई थिंक सो इन टोटलिटी जो क्वेश्चन बने हैं वो एक मलेरिया पैरासिटिका कंफर्म है, फैट एम्बोलिज्म सिंड्रोम कंफर्म है, पेजेस डिजीज इज कंफर्म, परचीज इज कंफर्म. ओके, दैट वाज पीरियड्स ओनली. गौरव नथानी, थैंक यू भाई. ठीक है, ALP एलिवेटेड, टेस्ट इज नॉर्मल. ठीक है, वो एक क्वेश्चन हो गया. एक टिबियल शाफ्ट फ्रैक्चर और पैसिव डॉर्सिफ्लेक्शन पे पेन हो रहा था, सो दैट क्वेश्चन वाज डन. ओके, Shivani, if it is possible, then Shivani, Rohit, एक बार can you DM me also on Instagram or Telegram? Can you DM me also, so that will be helpful to me. ठीक है, so technically we have recalled 5 questions. 6th question was an X-ray question on spondylolisthesis, which has already been discussed in radiology. Tenosynovitis का क्या question था? What was that question on tenosynovitis, if anybody can tell? What was that question on tenosynovitis, if you can tell? Okay, one question was on Angst-Pond investigation of choice for sacroiliitis. One question was on Angst-Pond. What is the investigation of choice for sacroiliitis? Huh? What was that question? What was that question of Angst-Pond where they had asked investigation of choice for sacroiliitis? Can you specify? Okay, 8 questions. Synovial fluid rhomboid crystal with birefringence. Okay, any other question apart from that? Okay, Ghazal is saying not tenosynovitis. Okay, but gain. Shivani, what was that image-based question? Okay, image-based question, dry gangrene, wet gangrene, tenosynovitis, Raynaud's phenomenon. Okay, okay. Image was given. Image was given, and options were dry gangrene, wet gangrene, tenosynovitis. Okay. Okay, okay, okay. ठीक है, ठीक है, ठीक.
Hi guys. Good evening. So, pathology recall session. So we are having all 3 faculties of pathology from DAMS. Hi guys. I'm there, Dr. Sanjeev Chitragar, Dr. Shagun is there, and Dr. Gaurav is also there. So what we will do is we will take turn by turn, few questions each one of us, and please keep giving us the options if the recall is correct or not, etc. And I felt there were definitely many questions from pathology. Questions were easy, slightly tricky, I would say. Acha, first question. Let me take first question now. Good evening. Good evening. First question. Was this the question? Please just look at this. Histopathological examination, lymph node in a 50-year patient, or I don't know whether the age was given or not. Neoplastic cell positive for CD10 and BCL2. यही दो option थे ना? CD10 positive, was it positive or no? Please just confirm this question. CD10 positive, BCL2. If CD10 positive, BCL2 positive, then this is a follicular lymphoma, right? Yeah. CD20 also, even if they have given positive, yeah. Options were not there. Okay. Options were not there. Okay. CD2, 2 and 5 in the option. Okay. Translocation 2, 5 was there. Okay. What were the option? Yes. Age given. Okay. 50-year. Age was 50-year. Elderly. They should have given some elderly patient. BCL2 positive tha. Okay. So answer to this will be translocation 1418. Diagnosis kya bana hamara ye? Diagnosis, what is your diagnosis in this? Yeah, what is your diagnosis in this? Follicular lymphoma, isn't it? Yeah, so this was a follicular lymphoma. So the diagnosis is follicular translocation 1418.
Ben.
That is your.
Their centroblasts and centrocytes are mentioned, sir.
Acha, centrocytes and centroblasts were mentioned. Okay,
Yeah, that-
so centrocytes, centroblasts were present. That is also that was mentioned there. Okay, so answer to this question becomes okay. So please just keep adding. We will keep adding whatever was there. One option was cyclin D1. Okay, option mein. Okay, ठीक है. Next question. Let me look at this next question now. Look at, I know you all are in a hurry. ठीक है, आज ही exam खत्म हुआ है आप लोगों का. So you want to all go and relax. Let me do quickly. Bone marrow from a patient with recurrent infection is as follows. Was the image given? या डिस्क्रिप्शन था? बताओ मुझे प्लीज. Somebody tell me. Image was given with multiple or rod or blast with multiple or rod? What was there? And options were whatever options were there. Translocation 1517. That will be the correct answers, right? So this is your acute promyelocytic leukemia. ये तो बार बार हमने बहुत बार डिस्कस किया. In fact, all these questions we discussed them in the class, and in fact both questions I had given in one of the. If you have solved last year GTs, you would have done both these questions.
Sir, इसमें bleeding history was given.
Okay, bleeding history was given. Okay, perfect. Actually, हमारे GT वाले question में exactly same thing was there. Bleeding was there. DIC वाला like history. Okay, so recurrent infection, bleeding भी था. ठीक है. Next, let me. ठीक है. Bleeding history was given. ठीक है.
Blast
Next,
more than
ये वाला
25%
question.
was mentioned, sir. Blast more than 25%.
Blast were 25%. Okay, yeah, we will mention that as well. Okay, guys. Okay. So चलो next question, question number 3. ये देख लो एक बार पूरा recall check कर लेना please. Patient was diagnosed of depleted factor 9. ये दिया था ना? Yes. Yes, depleted factor 9. The disease got corrected with injection of vitamin K. I hope this was given. Was this the history? Please look at this. Was this the history? Vitamin K depletion was given. Factor 9 depletion was given, and that corrected with vitamin K was given. Which of the following could be the etiology? Hepatitis, कौन सा hepatitis दिया था मुझे पता नहीं है, but it is not. See, if it was a liver disease which will lead to vitamin K deficiency, no, liver disease does not lead to vitamin K deficiency. If liver disease is there, vitamin K dependent factors will not be synthesized. अगर आप vitamin K देते हो तब भी नहीं synthesize होगा. Okay. Okay, classical hemophilia was in the option. Okay, classical hemophilia तो बिल्कुल गलत है because that is factor 8 deficiency. Pernicious anemia, instead of atrophic gastritis, it was pernicious anemia. Okay. Okay, pernicious anemia. So answer to this question is bile duct obstruction. देखो, it is not hepatitis. Hepatitis A was given. Whichever hepatitis, it is not. It will not get corrected with vitamin K because liver has to still synthesize the vitamin K dependent factors. It will not get corrected. So I would have been expecting vitamin K deficiency K etiology. So what are vitamin K deficiency etiology? Just understand logic, simple concept logic. What is the logic behind this? Vitamin K is synthesized by gut bacteria, isn't it? So I'm looking for any gut bacteria depletion like any oral antibiotic, abuse of oral antibiotic. That is one. अच्छा, वो नहीं है. Vitamin K is a fat soluble vitamin. Fat soluble vitamin. So if there is a fat malabsorption, so I'm looking for some pancreatitis or a pancreas deficiency, or even maybe bile duct obstruction. Bile duct obstruction will lead to fat malabsorption, and all the dependent, all the fat soluble vitamin will also get malabsorbed. ठीक है? Yeah, that is the logic behind this question. That was the logic behind this question. Okay. Next, a patient underwent ileal resection. This was there, and following which he developed anemia. And please tell me, hemoglobin 9, MCV 110. I mean, it was more than 102. Some people don't remember it exactly, but definitely it was more. Most likely etiology. So was it iron deficiency, B12 deficiency, folic acid deficiency, sideroblastic? Were options like this? Yes. Yeah. So this is B12 deficiency or a megaloblastic anemia, whatever was given in the option, right? Okay, so this was a B12 deficiency anemia then. Okay, so that was your B12 deficiency anemia. Okay, next question. Let me look at next question. What was there in the next question here? Okay, So next question check karte hain. Next question. A child presented with jaundice, fatigue, splenomegaly, MCHCs increased. Father also had a similar history, right? So this was the history given. Father has a similar history. What is the most likely diagnosis? Father has a similar history and child is having, you are thinking autosomal dominant condition, isn't it? Thalassemia, autosomal recessive, sickle cell anemia, autosomal recessive, not the answer. G6PD deficiency anemia, X-linked recessive, not the answer. Answer will be hereditary spherocytosis for this. Answer will be hereditary spherocytosis for this, right? Okay. Next. I hope I am all audible and clear here because let me look at the next question then. What was the next question? Sorry. Which of the following uses caspases in its action? This was the simplest one, by the way, guys. So apoptosis and
Sir,
pyroptosis. Yes.
sir,
Yes, Shagun?
पिछले question में autoimmune hemolytic anemia was one of the options.
Okay. Autoimmune hemolytic anemia was not G6PD then, I guess, right?
Yes.
Yeah. Instead of this, it'll be AIHA. Okay. Chalo. So next one, let me look at the next one. Which of the following uses caspases? Okay. So answer apoptosis and pyroptosis. ये होगा. ठीक है. Because pyroptosis, caspase 1 and 11 are involved. Apoptosis, caspase 8, 9, 10, 3 are involved. Necrosis, necroptosis do not involve caspases, right? Okay. 16-year-old mild jaundice.
Yes.
It will still not make a difference. Acha, ye question. Next question. Please try to recall it correctly because I want to just make sure. Histopathological examination of a tumor shows cells positive for synaptophysin TTF1, and there is abundant pink acellular material deposited in the tumor. Was this the question? Was this the question? So there is abundant. MCHC is also increased in hereditary spherocytosis. Correct. Right? Was this the question?
I think they're out synaptophysin chromogranin, if I'm not wrong.
तीनों थे.
अच्छा
तीनों.
अच्छा chromogranin, synaptophysin
And
and
TTF1.
TTF1. ठीक है. And options, please, options. Okay, directly amyloid ही दिया था. Okay, option क्या क्या था? No option of small cell carcinoma. Okay. Okay, no option of small cell carcinoma. Amyloid was mentioned. Okay, pink acellular material के बदले में there is amyloid deposited. ठीक है. डायरेक्टली अमाइलॉइड ही मेंशन किया था.
चारों सारे थायराइड कैंसर के ही ऑप्शन थे. पैपिलरी,
अच्छा,
फॉलिकुलर.
चारों थायराइड के ऑप्शन थे क्या? ओके, ठीक है. तब तो पीटीसी एमटीसी ठीक है.
फॉलिकुलर एंड अनडिफरेंशिएटेड.
हाँ, ठीक है. एनाप्लास्टिक. ठीक है. सो आंसर इज मेडुलरी थायराइड कार्सिनोमा बिकॉज ऑफ व्हाट? Amyloid deposition. So, and also chromogranin synaptophysin positive. Neuroendocrine markers. Neuroendocrine markers.
Vinayak, you are continuously saying it should be undifferentiated carcinoma. क्यों?
नहीं.
Why it should be undifferentiated, right?
नहीं, undifferentiated नहीं है.
अगर आ गया.
See, TTF1 अगर पॉजिटिव है, it is a thyroid origin or lung origin. ठीक है. Synapto and chromogranin are positive. That will be neuroendocrine. More important, अगर ये दिया भी नहीं होता, सिर्फ amyloid material दिया होता, that is more than enough for me to make a diagnosis of medullary thyroid. There are only two.
Lesion was rapidly growing and undifferentiated swelling was written. ऐसे नहीं लिख, undifferentiated swelling gross में कैसे पता लगती है? कोई डाउट है इसके अंदर?
अच्छा, rapidly growing undifferentiated swelling. अच्छा, नहीं, grossly तो undifferentiated नहीं बोल सकते हैं.
There are two questions on thyroid according to them. One was clinical, where there was right rapidly growing lesion. One was on medullary carcinoma thyroid. Is that right, guys? There are two questions on thyroid.
There were two questions. Were there two questions? देखो, if they have given synaptophysin, chromogranin, TTF1, amyloid, इनमें से कुछ भी दिया होगा TTF1 छोड़ के, synaptophysin, chromogranin positive, then also it makes MTC. Amyloid is there, that is also making MTC. Okay. So if it was undifferentiated, these should be negative. Okay, next one. Just look at this question. Child presents with severe infection, decreased B and T cells, and decreased adenosine deaminase, ADA. है ना? Which of the following is diagnosis? Answer is SCID. ADA deficiency, SCID. Right?
Okay, guys. Okay, one question only.
Okay, thyroid was only one question, then it is MTC. It is not anaplastic. ठीक है. Just look at, okay, pattern of inheritance was given. This was from mother to all children, father to no. So this was a mitochondrial. Mitochondrial was given. Yeah. So in this, I think most of you ended up ruling it out. Williams syndrome, achondroplasia, Prader-Willi syndrome, and Kearns-Sayre syndrome. So yeah, option A in this, right?
NK cells be decreased.
Okay.
And D George, one of the option of this question.
Option was
sir.
D George in that. Okay, ठीक है. Add कर लेते हैं. ठीक है, इसमें D George option था. ठीक है. ठीक है.
Yes, same DVT Shagun ma'am.
चलो नेक्स्ट ये वाला क्वेश्चन था. प्लीज जस्ट रिकलेक्ट दिस. इन अ प्रोटीन which has 109 amino acid, there is a frame shift mutation in the 4th nucleotide. Somebody gave me this. Please tell me, was this a question? Oh, 900 amino acid. Okay, so there were 900 amino acid. 900 amino acids were there. There is a frame shift mutation in the 4th nucleotide. Was this given? Viscot was not in the option. Okay, ठीक है. So we will change the option. Okay, was this question there? Please tell me 900 amino acid. There is a frame shift mutation at 4th nucleotide. है ना? And option, please help me with options now. So, I am very in gray area with option. No change in the protein, no disease. This was there in the option. Mutation in 4th. Yeah, okay. 900, 4th position. Okay, 4th nucleotide नहीं था, 4th position. ठीक है. चलो. ठीक है, 4th position. Okay, on mRNA था. ठीक है. One option was protein will get coded, nothing about the disease. mRNA. अच्छा सिंपल है, फ्रेम शिफ्ट म्यूटेशन हो गया तो क्या हो जाएगा, राइट? पार्शियल लॉस ऑफ फंक्शन, ऑल्टर्ड प्रोटीन. ओ ओके. कंप्लीट लॉस ऑफ बायोलॉजिकल फंक्शन, पार्शियल फंक्शन. देखो सिंपल है, इफ देयर इज अ फ्रेम शिफ्ट म्यूटेशन, देन देयर विल बी व्हाट? लॉस ऑफ ओरिजिनल प्रोटीन का फंक्शन एंड गेन ऑफ एबनॉर्मल प्रोटीन का फंक्शन, राइट? Partial protein change will not happen. Not frame shift, they had not mentioned frame shift. Oh, okay. So 4th nucleotide को क्या किया उन्होंने? क्या बोला था? 4th nucleotide has been replaced. What was given? 4th nucleotide has been replaced or what? Yes. 4th nucleotide is what? In the coding sequence, what has happened to the 4th nucleotide? What they had given? Frame shift was mentioned. That's what I am telling you. So frame shift occurred at 4th nucleotide. That is what people said. Yeah, if there is frame shift mutation, there will be, yes, complete loss of the protein. Why? Original protein will not be produced. 4th amino acid is only different. All other amino acids will be what? Different. So if it is happening in 4th, then complete change in protein. So that is why loss of function of original protein and there will be a gain of function of new protein. Frame shift was mentioned. So then definitely there will be what? Abnormal protein and disease or complete loss of function, original protein. So that will be the correct answer. Complete biological loss. Yes, that will be the answer. Yeah, that will be the correct answer. Complete biological loss of this. That will be the answer in this. Okay? Yeah. So there will be loss of protein, complete loss of function or loss of protein, biological loss of protein. Okay? Yeah, that will be the correct answer. Answer will be option D then. Okay. Okay, chalo, next one. Cut section of a testicular tumor is gray white, homogeneous, without hemorrhage or necrosis. So इसमें बताओ मुझे option क्या क्या थे? Answer is seminoma, by the way. So they had given homogeneous. They had written without hemorrhage and necrosis, or what was it?
Sir, histopathological image was given, if I'm not wrong.
In this image
Please
was
correct
given.
me if I'm wrong, guys. Seminoma की वो थी सर, histopathological image थी, नहीं मैम?
मुझे भी बताया था, फ्राइडे वाली इमेज थी.
Guys, please confirm.
Yes, please tell me, in this image was there or no?
Given, sir. It was given.
अच्छा, image was given, ना? ठीक है.
Microscopic.
माइक्रोस्कोपी या ग्रॉस इमेज था?
माइक्रोस्कोपी सर,
Microscopy, sir.
लाइन
That
लिखी हुई थी विदाउट ग्रेवाइट विदाउट नेक्रोसिस, बट इमेज वाज गिवन माइक्रोस्कोपिक इमेज, फाइब्रस
अच्छा अच्छा
सेप्टा
ठीक,
विद फ्राइडे अपीयरेंस दिया हुआ था सर।
HP
ओके
was
ठीक है,
given.
हाँ जी मैम।
ओके 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 ठीक है ठीक है। सो आंसर वाज सेमिनोमा। ओके ओके ठीक है। अच्छा नेक्स्ट क्वेश्चन, इसको एक बार देख लेना। हिस्टोलॉजिकल एग्जामिनेशन ऑफ लंग इज एज फॉलोज, व्हिच ऑफ द फॉलोइंग इज नॉट द ईटियोलॉजी? आई होप दिस वाज द करेक्ट क्वेश्चन, नॉट द ईटियोलॉजी। ये थोड़ा सा कंफ्यूजन सबको कर रहा है, नॉट द ईटियोलॉजी, दिस वाज देयर। And there was an image. What people told me that there was lung, there was pink material, or some people said hemosiderin-laden macrophages. And option में देख लो, right sided heart failure, pulmonary venous obstruction, protein losing enteropathy, congestion. Full of blue cells were there. Microscopic image was there. ठीक है, mentioned 40-year-old. Okay, 40-year-old mentioned था. Pink froth. Okay, pink froth was also given. Okay,
गाइस
no image.
हेमोसिडेन-लेडन
Okay, it was
मैक्रोफेजेस दिया
mentioned
हुआ
there is
था,
pink.
दे रोट हेमोसिडेन-लेडन मैक्रोफेजेस, इमेज दी गई थी सर,
अच्छा
थ्योरी में लिखा हुआ था हेमोसिडेन-लेडन
हाँ
मैक्रोफेजेस।
theory में
ठीक है
theory में लिखा
अच्छा
हुआ था.
ओके ठीक है, तब तो ठीक है। लंग शोज पिंक फ्रॉथी मटेरियल,
मतलब पल्मोनरी एडेमा की पिक्चर दी हुई थी क्लिनिकल।
हाँ बस, राइट
Microscopic
दिस
image.
शगुन मैम यू वर राइट,
इमेज
देयर
वाज नॉट गिवन
वॉल्यूम
ना।
ओवरलोड तो था ऑप्शन में।
हाँ ऑप्शन में क्या क्या थे बताओ मुझे।
हार्ट फेलियर सर, हार्ट फेलियर सेल मेंशन्ड है।
हार्ट फेलियर राइट साइडेड था, लेफ्ट वाला था, पर मतलब वही है
नहीं
वो
सर,
दे
हार्ट फेलियर
हिमो,
सेल्स मेंशन्ड है, देयर सिंह हार्ट फेलियर सेल्स।
ओ दैट वाज आल्सो मेंशन्ड, हेमोसिडेन लेडन मैक्रोफेजेस। ओके, हार्ट फेलियर सेल्स,
नो इमेज एंड सर क्लिनिकल पिक्चर ऑफ हार्ट फेलियर।
ओके ठीक है। सो देन व्हाट वाज नॉट, फ्लूइड ओवरलोड वाज देयर। ओके
Volume overload.
ओके, कंजेशन के बदले में फ्लूइड ओवरलोड। अब हार्ट फेलियर कौन सा था?
सर ऑप्शन 3 है, राइट हार्ट फेलियर, प्रोटीन लूजिंग एंटेरोपैथी, वॉल्यूम ओवरलोड। थ्री तो एवरीबॉडी हैज कंफर्म्ड सर,
अच्छा
राइट हार्ट
तो
फेलियर, प्रोटीन लूजिंग एंटेरोपैथी, वॉल्यूम ओवरलोड। तो अभी तो थोड़ा सा कंफ्यूजिंग हो गया।
अच्छा देन सी इन दिस राइट साइडेड फेलियर कैन नॉट बी द आंसर, सिंपल है। क्योंकि ना अगर हार्ट फेलियर सेल मेंशन्ड है तो देन इट इज डेफिनेटली लेफ्ट साइडेड फेलियर इफ इट इज देयर। राइट साइडेड फेलियर विल नॉट कॉज एनी पैथोलॉजी इन द हार्ट। ओके, राइट फेलियर वाज देयर, देन प्रोटीन एंट्रोपैथी वाज देयर, टेंडर हेपेटोमेगाली भी थी। ओके, pulmonary venous obstruction, volume overload, protein.
There was history of raised JVP with hemosiderin-laden macrophages.
Then it
Frothy
will be left.
sputum.
नहीं तो दैट इज ओके।
मैच नहीं कराना एक दूसरे से।
हाँ नहीं मतलब देन इट विल बी अ लेफ्ट साइडेड फेलियर, सो सेकेंडरी राइट साइडेड फेलियर भी हो जाता है कंजेशन होके ना।
ओके
सो लेफ्ट साइडेड फेलियर से कंजेशन होके लंग्स में कंजेशन, कंजेशन लंग्स में हो गया तो अल्टीमेटली राइट वेंट्रिकल में भी कंजेशन हो जाता है, एक्सेप्ट पूछा था। ओके, सो दीज वर द 4 ऑप्शंस। ओके, pulmonary venous obstruction, protein losing enteropathy, then fluid overload, no heart failure cell. See, in this simple, right-sided heart failure cannot cause pulmonary edema, whether it is with hemosiderin-laden macrophages or without hemosiderin-laden macrophages. It will not be causing. Right-sided heart failure doesn't cause pulmonary edema. ठीक है? Yeah, even yeah. So
गाइस
that
उल्टा
cannot
तो
be the
नहीं था,
answer.
that they wrote a clinical picture of right heart failure, JVP increase है,
JVP was
myelopathy, which
elevated.
one is not seen, ऑप्शन में hemosyderin-laden macrophages हो, ऐसा तो नहीं था। इट्स
नहीं,
अदर
हाँ
नहीं.
तो वो हो सकता है।
नहीं ना, पर वो बच्चे सब कह रहे हैं ना मैम कि hemosyderin तो क्वेश्चन में था,
हाँ नहीं तो
तो
क्वेश्चन
क्लिनिकल
में
पिक्चर ये दे रहे हैं राइट हार्ट फेलियर की, और ये बोल रहे हैं hemosyderin-laden macrophages, कटे जा
But
रहे हैं
they're
सब।
saying कि hemosiderin-laden macrophages was written in the question itself.
हाँ,
हाँ
Option
तो
नहीं
इफ
था, question में था.
hemocysteine
वो बस
macrophages
मैं
is in the question,
लिंक
then it
करने की
has to
कोशिश
be
कर रहा
left
था
sided
मैम।
heart failure,
Yes.
then it cannot be right sided heart failure, simple.
Hmm.
Even if there
एब्सेंट
is
ए वेव।
increase in JVP also,
Hmm.
okay, hemocysteine laden macrophages, then increase JVP.
सर आई एम टेलिंग यू जेवीपी वाज अ डिफरेंट क्वेश्चन सर,
अच्छा
ये मुझे ये दे आर मिक्सिंग टू क्वेश्चंस, इफ आई एम नॉट रॉन्ग दे आर मिक्सिंग टू अदर क्वेश्चन, वन वाज फ्रॉम मेडिसिन जहां पे जेवीपी रेस था, एब्सेंट ए वेव दे रखी थी, दे आर लिंकिंग
अच्छा
विद दिस क्वेश्चन।
चलो
नहीं तो so this we will leave it. Basically answer will be right sided heart failure. So
Guys,
no
do
matter what,
DM
it will
all
not
of
cause
us
pulmonary edema.
in
Simple है.
case you recall this exact question, because you are mixing two questions which is not allowing us to come to a right option.
Okay, next question. 13-year girl presents with photosensitive skin lesions, multiple skin carcinomas. Which of the following abnormality is likely to be seen? Right? Yeah. So mismatch repair, nucleotide repair, homologous recombination repair. यही option थे. Yeah. So okay. So two different question. Okay. So just leave that now. Another one, if you can recall, please tell me. Was this the question now? Answer
Surya,
is
yes, protein losing
nucleotide
enteropathy.
repair. Nucleotide
Protein losing
excision repair.
enteropathy, Surya, it can cause edema, right? So इसलिए we have to rule out that condition.
See, pulmonary edema cannot be caused by right-sided heart failure. That is simple. If they have given pulmonary edema, there is a pink frothy fluid and hemocytin-laden macrophages in the lung. This cannot be caused by right-sided heart failure. It is as simple as that. Okay, DNA mismatch. Okay, mismatch repair. Okay, that is already there. DNA mismatch.
Ma'am were right. BCC on the face.
Okay, they had given BCC on the face rather than okay. Lesion and BCC. Okay, ठीक है. ठीक है. Yeah. So answer to this will be B, nucleotide excision repair defect, NER, right? I think this question we can rule it out. ऐसे कोई question था क्या? किसी ने मुझसे ये पूछा? Yes. Was there any such question? So I'll just leave this question. Endometrial carcinoma, there was no, I think they will be taking somebody. Okay, this was not there. Leave this question. So there was a ovarian carcinoma ka gross, this one was there. Okay. So let me look at this next question. Identify the following structure. Was this there? Please tell me ureter wala question tha. Ureter, what was the question? Was there a identify ureter? Did you get this anywhere, Shagun or
yes sir
ureter
ureter
wala
का
tha na?
हाँ
Sir, transitional epithelium का
नम दिखा यूरेटर और ब्लैडर का वो कंफ्यूज हो रहे हैं, बोल रहे ट्रांजिशनल
हाँ,
एपिथेलियम
मुझे भी
दिखाई
कुछ
थी.
लोगों ने बोला ट्रांजिशनल एपिथेलियम की इमेज आई थी सर.
अच्छा. Not whole, just part image was there. Okay, ठीक है. इसको image को ना, let me just try to get what was the answer for this. So sir भी हटा ही लेते हैं. Transitional epithelium was there.
Yes,
Okay,
sir.
there was a transitional epithelium.
Done in
And
NICET.
what were the options? What were the options?
एक
Umbrella cells
ऑप्शन
were
तो
also seen.
एक ऑप्शन तो गॉल ब्लैडर पता था, गॉल ब्लैडर यूरेटर दो तो पता है.
Gallbladder, urinary bladder. दोनों
Sir,
थे क्या?
transitional epithelium was given. Urinary bladder was not in option. उन्होंने
Okay.
urothelium लिखा हुआ था ऑप्शन में.
Okay, longitudinal image was different. Okay, high resolution, मतलब high power में image था. Transmission. Okay, options given where ureter दिया था, transitional epithelium दिया था, trachea दिया था option में. अच्छा, trachea. अच्छा, anyone please tell me now. Trachea was there, then ureter, then transitional epithelium also. Okay, guys, please
Duodenum.
tell me now. It was the whole wall or only epithelium was given?
So now they are saying no transitional
Duodenum.
epithelium, duodenum was
Option
there.
duodenum. ठीक है, चलो तब तो ureter ही हो गया ना, transitional.
Ureter,
So
trachea, esophagus.
हाँ ठीक है, तो if it was a stratified one, then in this only one option, right? So that will be ureter, मतलब transitional epithelium. Okay. चलो, so answer will be B. I'll just add the image later. Next question, look at this. CD markers can be detected by which of the following test? So ELISA, Western blot, flow cytometry, and whatever was the option, fourth option, जो भी है, answer will be C here, right? तो किसी ने मुझे बोला IHC भी ऑप्शन था इसमें, इसीलिए मैं just confirming that. ठीक है. So what was the fourth option? Yeah. So I've just added that now. Okay, karyotype was also given. One more option. ठीक है. Chalo. So answer is flow cytometry in this. This one more. I am taking this last question, and then Dr. Shagun and Dr. Gaurav will be taking. अच्छा, cytogenetics दिखा था. ठीक है. Patient presents with bodily imbalance, vertigo, histological examination of tumor shows Antony and Antony B areas. यही लिखा था, है ना? यही लिखा था. Okay, so in this case answer will be schwannoma. ये तो straightforward था. ठीक है. Yeah. Okay. Okay. So now, okay, NGS भी कोई बोल रहा है, कोई बात नहीं, ठीक है. Flow cytometry is the answer. Now I will hand it over to Dr. Shagun. She will be taking few more questions whichever I have missed here, and then Dr. Gaurav is also there.
Okay, done. So I think my screen is visible to all. The screen is visible.
Yes, ma'am. Yes, ma'am. You can start, ma'am.
Okay. So most of the questions to discuss हो गए हैं. Dr. Gaurav, आप भी please बता दीजिएगा.
Sure, ma'am.
Sir,
Sure,
अभी.
you carry on, ma'am.
So this we have already discussed. Apoptosis and pyroptosis is going to be the answers. सर ने अभी डिस्कस कर ही लिया है. ये हमारा follicular lymphoma था. 1418 is going to be the answer, right? This अभी सर ने बताया. Antony A, Antony B areas, right? That is going to be a straightforward schwannoma. And गौरव सर इसको complete कर देते हैं एक बार.
Sure, ma'am.
कि एक question था. Tall man with visual problems. I think
Ectopia lentis was written. Yes, ma'am.
yes, Ectopia lentis, and which gene is most likely defective in. And this was a question of yes, our Marfan syndrome, जो भी FMG में भी आया था. And इसमें options बता देंगे सब लोग. Yes, students. Obviously, this is going to be your fibrillin 1 gene defect. But options. Okay, yes, call A2 in option. Okay, so this is call A2 in option. Fibrillin, yes, perfect. और दो option. किसी को रिकॉल हो रहे हो सर आपके पास? ओके, बायलैटरल सबलक्सेशन ऑफ लेंस वाज आल्सो देयर. ओके, लार्ज एक्सट्रीमिटीज. ओके ओके, ठीक है सर. आपको और दो ऑप्शंस आए तो बताना.
Sure, ma'am. वही वेट कर रहा मैम.
तब तक हम आगे चलते हैं.
Yes, ma'am. Sure, ma'am. मैं लिख लूंगा मैम.
डन.
Collagen.
कोलाजन.
A5, ma'am. A2 and A5. Other options were what? L-Pot syndrome, they're telling.
हाँ. Collagen 4-5.
कोलाजन 4. कॉल A4-5. ठीक है, डन. पैक 6. ओके, एक ऑप्शन हो गया पैक 6. ठीक है जी, चलिए. सर ने ऑलरेडी डिस्कस कर लिया ब्लीडिंग टेंडेंसीज के साथ. फैगट सेल यू आर सीइंग दैट यस, दिस इज गोइंग टू बी योर ट्रांसलोकेशन 1517 APML. डन. This also we have discussed testicular mass, homogeneous, non-hemorrhagic testicular tumor. This Friday appearance was given. Yes, this is going to be answer your seminoma. Okay. Next is going to be this question. Yes, we have discussed. This is going to be your hereditary spherocytosis, MCHC is increased, father having similar illness, autosomal dominant. ये भी हम discuss कर चुके हैं. Amyloid सुनते ही obviously the answer is going to be medullary carcinoma of thyroid. And this also, Gaurav sir, इसका क्या था अपना history?
हाँ, unilateral mass था. I think CA125 given more than 1000, ma'am. Just to add on.
Okay.
That's what I given. Guys, help me out. मुझे इतना ही था. Unilateral mass with CA125 more than 1000. Diagnosis serous adenocarcinoma. Something that you want to add on, guys?
हाँ जी, anybody? बच्चों लोग कुछ ऐड करना है इसमें. ओवेरियन मास है, मल्टीलोक्यूलेटेड है, यूनिलैटरल है, CA125 लेवल्स आर मोर देन 1000. मोस्ट लाइकली CA125 सुनते ही yes we know this is going to be serous adenocarcinoma. But anything else you want to add in the history or one more option? Okay, ascites more than. Okay,
Gross
there
image was given.
Gross image was given. ठीक है, image was given. Immature teratoma. ठीक है. Ascites given. Okay. Ascites was present. Picture gross. ठीक है. Okay, done. We'll add the image. चलिए. हाँ जी, ये हो चुका है डिस्कस. दिस इज गोइंग टू बी योर राइट वेंट्रिकुलर फेलियर. हाँ, एक ये क्वेश्चन था, इसके ऑप्शंस मेरे पास नहीं है. दैट देयर वाज अ मिडिल एज वुमन विद ड्राई आईज. गौरव सर, आपको मिला?
नहीं है, नो मैम.
Dry eyes, dry mouth, lab test reveals anti-Rho, anti-La, most likely underlying mechanism, lymphocytic infiltrates and destruction of salivary and lacrimal glands. Is there anything you want to add in this question? सर आप देखिएगा अगर इसमें कुछ ऐड
Sure,
होता है
ma'am.
तो.
I'll add on, ma'am. You can
है
continue
ना?
the next question, ma'am.
चलो.
कुछ होगा तो I'll add, ma'am.
हाँ, नेक्स्ट क्वेश्चन. हाँ जी, सीधा सीधा क्वेश्चन था. बच्चे लोग प्लीज बता दीजिए हिस्ट्री में, इफ यू वांट टू ऐड एनीथिंग मोर. 1 month हिस्ट्री ऑफ कॉफ, चेस्ट पेन, डिस्निया, लिम्फोडिनोपैथी, बायोप्सी पे. अब नाउ टेल मी, इट वाज ग्रैन्युलोमा विद स्टीलेट इंक्लूजन्स और स्टीलेट ग्रैन्युलोमा? आई थिंक इट वाज ग्रैन्युलोमा विद स्टीलेट इंक्लूजन्स.
हम जैसे सेकंड मलार रैश ऐड कर रहे हैं, इसमें कह रहे हैं क्या बच्चे?
मलार रैश किस में?
इस वाले में, पुराने वाले में, जॉग्रन सेंटर में कहाँ से आएगा ब्रो?
भाई बच्चे, क्वेश्चन ही गड़बड़ हो जाएगा.
दोनों ऑप्शन को एक SCL 70 पे क्वेश्चन आता है, आई थिंक, पर वो भी स्क्लेरोडर्मा पे था ना.
सिक्का, एंटी SSA, एंटी SSB, शर्मा टेस्ट पॉजिटिव. जॉग्रन, यस, शर्मा's टेस्ट पॉजिटिव.
तो जॉग्रन सेंटर पे क्वेश्चन आया एक. फिर ये मलार रैश क्यों कह रहे हैं सारे? Guys, there are two separate questions, right? One was antibody of scleroderma, SCL 70, then we have Sjogren syndrome, and one there was on SLE also. तीनों पे था क्वेश्चन क्या?
I think that they're confusing two
हाँ
questions.
मैम, they're confusing questions. चल आगे चलते हैं मैम.
हाँ जी, ये था granuloma with stellate inclusions, star-shaped inclusions, and the correct answer was sarcoidosis. What about the rest of the options? Anybody? It was granuloma. Any image was given or not?
Not at
First
all,
tell
ma'am.
me.
Image is not there, ma'am.
No, it was not there.
Image is not there, ma'am.
अच्छा, कह रहे हैं कि stellate inclusion था, giant cells थे. Okay. So ठीक है, अगर stellate inclusions हैं, granulomas हैं, giant cells हैं, so this is going to be sarcoidosis.
Yes,
with
ma'am.
no image. Okay. Most characteristic feature था question. Granuloma with stellate inclusion. ठीक है. Okay, done. It was. Okay, ये सर डिस्कस कर लिया है. Mitochondrial inheritance pedigree is Kern-Sir syndrome. And बच्चे लोग, एक there was a straightforward question that anti-mitochondrial antibody seen in PBC.
There was mention of the granulomas in the bile duct in this question.
Which? This one?
PBC वाले पे मैम.
क्या mention था?
Granulomatous destruction of bile duct.
Okay, ठीक है.
SCL 70 पे there's a separate question, ma'am. Specific antibody for SCL 70. SCL antibodies are seen in. I think diffuse scleroderma was an option. That was the correct answer.
अब बच्चे concentric concretions and stellate granuloma था या stellate inclusions था?
मैम, आई थिंक दे आर गेटिंग कंफ्यूज. स्टेलेट बॉडीज था, एस्टेरॉइड बॉडीज का दूसरे नाम को इन्होंने
Norm
सेलेट
को.
ग्रैनुलोमा मान लिया एग्जाम में.
Okay, okay,
देयर
okay.
वाज सेलेट बॉडीज बाबा. सेलेट बॉडीज वर अनदर नेम फॉर एस्टेरॉइड बॉडीज बिकॉज ऑफ स्टार शेप, राइट? दोनों सेलेट ग्रैनुलोमा मैम, आई हैव कंफर्म दैट.
Done. And ये आपका derma से overlap की, उसमें mention था question में that the patient has gluten sensitivity with increased IgA levels and image was given and you had to diagnose it was dermatitis herpetiformis. Okay, that was from my side, sir. I think एक
मैम हो गया मैम. आई थिंक देयर इज नथिंग टू ऐड ऑन मैम.
हो
दैट्स
गया.
ऑल आई हैव, सो वी कैन एंड अप मैम.
Okay, sir. संजीव सर.
डन करते हैं मैम.
So this
लाइक
was
मैम,
all.
फोकल नोडुल हाइपरप्लेसिया का एक बार आप बोल दो प्लीज.
Question sir क्या है?
बस कट सेक्शन था, राइट? हम सबने कंफर्म कर दिया वो. फोकल नोडुल हाइपरप्लेसिया पे देयर वाज ग्रॉस इमेज गिवन, सेंट्रल वाइट स्कार. इट वाज देयर. आई थिंक एवरीबॉडी इज कंफर्म दैट मैम. हाँ, रैथ के पाउच वाला मैम. सुप्रासेलर मास विद वेट कैरेटिन. गाइस, क्रेनियोफैरिंजियोमा पे था, राइट क्वेश्चन? Child suprasellar mass and there was wet keratin with machine oil like fluid था मैम.
ठीक है.
FNH की पिक्चर भी थी मैम.
ठीक है. Okay, focal nodular में gross image was given.
हाँ जी मैम.
Okay.
गाइस, क्रेनियोफैरिंजियोमा का इमेज नहीं थी, राइट? So did they show the HP image of this wet keratin or just theoretically it was written machine oil fluid wet keratin? No image, right? Yes, Rethke pouch was in the option. ठीक है मैम,
ठीक है जी,
ठीक है मैम. Thank you
चलिए,
guys. Thank you so much for your response.
थैंक यू सो मच गाइज, ऑल द बेस्ट.
All the best, guys. Thank you, ma'am.
चलो, थैंक यू सर, ओके,
Thank you,
बाय
ma'am. Bye
बाय.
bye.
Hi everyone, let me quick check that I'm visible. Hi everyone, I hope you're doing good. क्या कर रहे हो? जाके relax करो, क्यों attend कर रहे हो recall session? Well, if your choice is that you don't want to have the recall, it's a perfectly good choice and it's time to relax. So regarding ophthalmology, let's see. I have my job is to do the recall. मैं तो करना पड़ेगा मुझे. Hi, good evening, Subham Ghazal, everyone. So there were less number of questions. I don't know why 7 questions I've got till now. If you have more questions, just let me know. The purpose of this is just to know the correct question and the correct option. With the 7 questions were, I think, straightforward. I will tell you how as well. Yeah, hi. So the first question is to identify. I don't know there was any clinical question based on this, but this is to identify, and this was one of the repeat questions of the exam. There was some dandruff. I don't know dandruff material was given in the question. Some said dandruff material was given in the question or not. The image, of course, has some dandruff material on the lens. That is nothing but pseudo exfoliation material. That is the syndrome, pseudo exfoliation syndrome. Now, students said, sir, why cannot be intercapsular cataract or classification cataract? They can't show you intercapsular cataract because if there is an intercapsular cataract, you can't see behind that. That's why always they will show posterior capsular cataract. Before that, everything is clear. So tell me, old person tha, theek hai, very good. Old mein hota hai, it's the most common. It's seen in old only. It's the most common secondary glaucoma seen in old age. Very good. Old age tha. Just to identify, no dandruff material. Decreased vision was there. Okay, fine. Okay, decreased vision. Old patient with decreased vision was given. And I think the 4 options are the glaucoma flecken. Now, glaucoma flecken is seen in acute angle closure. I'll do it quickly because many recalls are there. Other signs should also have been there, like iris atrophy should be there. Pigment dispersion is pigments all over there's no dandruff material, white material in pigment dispersion. And I told the reason why it cannot be intercapsular falsification. No IP history, old person. Okay, fine, good. So I think that was a clear, this is a repeat question of 2022 or 2021. The image was asked. I always in the class, I tell a Rajkot student, I showed a video of if you have attended class, she answered dandruff material related to some advertisement. Similar question was this image question, first question. And again, directly is from the, I mean, pseudo exfoliation is a very important, most common secondary glaucoma. Alright. Okay, D option was not there, I'll check. Second question is a 10-year-old boy with the history was given high ass palate, joint heavy mobility, long finger toes, means they were giving marfanoid habitus, which can be seen, and eye examination image was not there, right? Just now a student told me image was not there. Now which protein this is can be seen in Marfan's syndrome, can be seen in homocystinuria, but in the question there is nothing for homocystinuria, cystathione, beta synthetase. It has to be fibrillin gene, that is FB1. Audio is okay, right? Audio is okay, just go rejoin it. It's okay. Okay, so that was a question, and this was a similar, exactly similar question with the image I gave you in TND as well, in which options are different, but fibrillin was the answer. Yeah, I'll go fast only. Now this question, I know the text was okay. 15-year-old girl was there, painless lesion was there, slowly growing was there, with the image was there. Since the past 1 decade was there, and options I've confirmed. Everyone is given the same options: lacrimal gland cyst, osteoma, dermoid cyst, hemangioma. The option is confusing between lacrimal glands and dermoid cyst. Some said lacrimal gland carcinoma. Now 15-year-old with lacrimal gland tumor or tumor was there, should not be the answer. Most common location of dermoid cyst is also supratemporal. and that is slowly growing, mostly in child. Limbal dermoid question was asked last time. Now it is dermoid cyst, orbital dermoid. Yeah, similar image, and similar image. Same image I told you in the workbook as well. Orbital dermoid related with this syndrome, golden heart syndrome. Okay, lacrimal gland tumor in a 15-year-old should not be the answer of this. Lacrimal gland swelling was there, slowly growing for 1 decade. That also doesn't go in favor of lacrimal gland. Swelling was near eyebrows. So this is eyebrow only. और क्या होता है? Eyebrow ही तो है और क्या? क्या आपके eyebrow से घुटनों में? Lacrimal gland mass. हाँ, so lacrimal gland mass also cannot be the answer in 15-year-old. Image of a girl. अब ये इसमें कैसे पता है? It was not a kid also. तो 15 साल को तो kid नहीं होगा ना, गर्ल. ऑफ कोर्स मेरे को क्या पता क्या इमेज आई थी. मेरे को जो इमेज सूटेबल लगा तो आप लोगों ने दिया मुझे, दैट वाज देयर. आई चेंज द इमेज. अब गर्ल थी नहीं थी इसमें मैं कैसे बताऊं? आंसर वही होगा. Now this is also a repeat question on 2022. Options were keratoglobus, keratoconus, walled limbal girdle. Fourth, I don't know if same option was given or not. This is intracorneal ring segments known as intacs. That is done for keratoconus to stabilize the cornea, made of PMMA. Yeah. So PMMA in stroma, intracorneal ring segments to stabilize the cornea, non-progressive keratoconus. So keratoconus was the answer of this question. I think the options were same, right? It's a previous year question, 2022 NEET exam. 2 questions direct same to same came. All right. Now what? I mean, this question, the wordings they played in the wordings. I don't know. I'll go one by one. Which is true statement they asked first for orbital cellulitis? Inflammation is in the anterior part of the septum. Now, if there is an orbital septum, the differentiation between preseptal and orbital cellulitis is that if it is before the septum, that is preseptal cellulitis. So inflammation in the anterior part should not be correct. Topical is not given. Broad spectrum antibiotic was in the question. Topical, some say topical, some said not. Topical is not given. It is given systemic, either oral or intravenous. Now, fourth option, clinical features of proptosis is there with decreased vision there, but normal eye movement should not be there. There is ophthalmoplegia. So that also is ruled out. So ruling out the other options, C options seems to be correct. That ethmoid sinus infection is involved in all ages. Anterior to the septum tha, limited by septum tha. Matlab preseptal. They were asking preseptal, that is not. Yeah. So C option must be the answer of this question. The most common cause, irrespective of the age, it's the most common cause of orbital cellulitis. And intravenous antimicrobial is given. Topic le tha na, they are good. Now this question, I hope I have got the images correct and the options correct. One image was given with a house and a dog, and these are 2 dissimilar images. If you dissimilar image, that is simultaneous macular perception or simultaneous fixation, and this is similar image. You fuse the 2 images, one with a star, one without a star, you fuse into one. So image 1 is of simultaneous perception, the image 2 is of fusion. There is nothing stereopsis. This is on synaptophore. Same image, similar image I gave you in the workbook. This is dissimilar image with a bird in a cage, and I always tell in the class, kya hai, gadha ghoda kya hai? Without a tail, with a carrot, with a tail, without a carrot, and they fuse into one. That's the second. That's the similar, not the same. Similar images were given over here. That is 1 and 2 is the answer. Simultaneous fixation and fusion. Yeah, I know this is correct image because I've asked many students. This is the correct image. Yeah, and there was a Fuchs endothelium dystrophy question of diagnosed patient of bullous keratopathy. Bullous keratopathy means the endothelium of the cornea is involved, and endothelium of the cornea is involved in Fuchs endothelium dystrophy. Even Gateta word is specific for Fuchs endothelium dystrophy. Cytomegalovirus, herpes, trachoma were the options I know, but answer should be Fuchs. That is the bilateral condition, asymmetric in one. So one stay has gone into bullous keratopathy, the other only into Gateta. That is Fuchs dystrophy, bullous keratopathy, Gateta word. All are keywords leading to endothelium dystrophy of the cornea. That is the Fuchs dystrophy, leading to stromal edema, epithelial edema, bullae in the epithelium, but problem lies in endothelium. Yeah. देखा, accurate question है, because I've been asking many students since 1:30. I think these are the 7 questions, and I think 7 out of 7 should be fair enough because they're not difficult questions. And if you have other questions, let me know. One question, they say prior derma, what to do ocular screening, give it to biochemistry. One say ankylosing spondylitis, give it to radiology question, radiology people, you know. And that X-ray was there, what to do next, MRI screening. One was vitamin deficiency, what to do ocular screening, but give it to them. 7 questions is okay. All right. I hope you have done well. Now relax. Just see the questions if you want to attend the questions of other specialties, and then relax. Thank you very much. Any questions extra, just message me. Thank you very much. Thanks for listening, and I hope you're doing well. You do well, and you'll enjoy this time. Okay, good. 7 out of 7 is excellent.
Hello everyone. How was biochemistry portion? I hope there were few challenges, but by and large it was easy. Everything was from notes only. Yes, how was biochemistry? Yes. ज्यादा डिफिकल्ट तो नहीं था बायोकेमिस्ट्री. Doable, yes, it was doable. All right. अच्छा, चलो let's see. अब पता चलेगा. Yes. हाँ, नोट से ही था. Yes, I know. Easy था. Type A, Type 2, Type B, 2A, 2B, hypercholesterolemia. All right. Achha, there was some question like this. Let's discuss question by question. Let's discuss question by question. Let's try to remember what were the other options. What were the other options? There was a question on vitamin B12 deficiency. Right? Anything else was given here? Directly it was mentioned कि vitamin B12 था. Directly कुछ ऐसा कुछ और भी mentioned था कि directly it was saying that it is B12 deficiency, or they have not mentioned this term. So you will have to let me know. This here. First tell me this question. We'll discuss question by question, otherwise everybody will get confused. So first let's all talk about this question only. So there was a question, as per my knowledge, that a patient with vitamin B12 deficiency was mentioned. उसमें clearly mentioned था vitamin B12 deficiency है. Methyl malonic acid is accumulating in this case. There is accumulation of methyl malonic acid. Which amino acid will be deficient? Which amino acid will be deficient? Yes, there will be accumulation of homocysteine. अगर vitamin B12 नहीं है तो homocysteine will accumulate. Yes, you are right. Homocysteine accumulate करेगा, but methionine form नहीं होगा, because this conversion of homocysteine to methionine requires an enzyme, that is homocysteine methyl transferase, and this transferase requires vitamin B12. It requires vitamin B12. So this here, agar vitamin B12 nahi hai, to methionine will not be formed. Yes, deficient. Answer is methionine. Answer is methionine. Acha, homocysteine was mentioned in the question. Okay, homocysteine was mentioned in the question. All right. Yes, this is transsulfuration pathway, the conversion of methionine to cysteine. Yes, all right, good. All right. I can't go directly with the answers because I don't know the questions. You will have to first tell me the questions. Acha, isi same question mein there was an option of glutathione. There was an option of glutathione. Okay. So this is what we already know, that vitamin B12 is required for the conversion of homocysteine to methionine, and if this B12 is not there, homocysteine accumulate करेगा, B12 methionine जो है वो absence of vitamin B12 में there will be deficiency. All right. 10 to 15 questions was asked. Okay, that's a good number of questions. I don't have that many questions, so I am just waiting for one or the other question. Glutathione was the question, अलग से question था या इसी में there was the option? Glutathione इसी का option था. All right. Non-alcoholic with cerebellar ataxia, nystagmus. All of us now on this question? Yes. Non-alcoholic with cerebellar ataxia, nystagmus, beriberi का manifestations था. Vitamin deficiency was asked. if it is this type of question, okay, features of heart failure was given. So we can say that it is wet beriberi. Yes, the answer is thymine, but I don't know what were the other options. You have to tell me the options, complete my question, and then I'll go to another question. Yes. यहाँ पे heart failure was there, zinc was there, selenium was there. Acha, so you might have confused heart failure with selenium also. Selenium will also cause heart failure. Alright, so polyneuropathy was mentioned in the same question as per your chat. I'm taking it from the chat box. Then selenium was there. Alright, thymine was there, B12 was there. So that completes the options. Selenium, I think most of you have marked thymine, right? It is wet beriberi. It is wet beriberi and it is a repeat question. Last year there was a question on thali, right? One side there was dal, there was rice, and B1 is present in rice. If we have a layer on the rice aileron layer and that layer is removed, the thymine gets removed. So that will be, so that is a repeat question. We will say that it is repeat only, right? क्योंकि है तो टॉपिक तो सेम ही है ना, आंसर इज ऑल्सो सेम. सो बट थोड़ा क्वेश्चन पूछने का तरीका इज डिफरेंट. बाय एंड लार्ज इट इज द सेम टॉपिक. नॉन अल्कोहलिक वाज मेंशन्ड. ओके, हाँ, तो बिना, इट्स नॉट ऑलवेज दैट अल्कोहलिज्म विल कॉज B1 deficiency. In alcoholics it causes cerebellar ataxia, it causes cerebral ataxia, nystagmus and all, right? That is that also is a feature in alcoholic, right? Dietary history of jawar roti was given. Jawar was given. All right. Non-alcoholic, non-diabetic. Point taken. So this here was non-diabetic. Neuropathy science was given. All right, good. Jowar and sorghum in diet was given. All right. So in selenium deficiency, there will not be a cerebellar ataxia. Right, you only see heart failure, and that is also a hypertrophic cardiomyopathy. Heart failure will set up quite late. So it is selenium is not here the answer. It has to be thymine. All right. So it has to be thymine depending upon what we have just seen. If question में cerebellar ataxia, nystagmus, polyneuropathy was mentioned. All right. Next. There was another, I think some of the questions, some of us are mixing two questions. There was patient was hypertensive and was on thiazide diuretic. Now this was a same question or it was a different question? Thiazide diuretic. Gait ataxia was given. Now depending upon what we see, all right, I don't know whether it was the same question or it was a different question. Beriberi, some of us are saying beriberi was mentioned, some of us are saying beriberi was not mentioned. There was stones mentioned in the question. So this we will have to see what was the exact question. This has been discussed under pharmacology. So let's now move to the next question. All right. So there was something related to selenium. Was it in the same question? All right. So according to our recall, we will say it was mentioned in the same question. The options was selenium, vitamin B12. There was an option of thymine. And there was one more option of zinc, right? So these were 4 options. All right. So there was a different question on selenium, yes or no. I'm still not getting the answer. Different question था कि नहीं था on selenium? No, this was in the same question. So this was not a different question. All right, I get that. All right. Achha, there was a question whether some of us are saying that it was alpha L iduronidase. Others are saying that it was the iduronate sulfatase. Now this you will have to tell me what was mentioned. Was it Hurler or was it Hunter? Hurler or Hunter? Hurler था या Hunter disease था? So let's all concentrate on the same question. Alpha L iduronidase was mentioned. Then it is Hurler disease. Was corneal clouding mentioned? No, then it is with corneal clouding, I guess. Because if it is Hurler disease, then corneal clouding is seen. Okay, yes, alpha L only. So it is Hurler disease only. We all have agreed that it was Hurler being asked. So see, irrespective of whether it was Hurler being asked or Hunter being asked, all right, according to our question, it was Hurler disease alpha L iduronidase deficiency. We agree corneal clouding was seen, but what will accumulate? दोनों में ही accumulating compound is same, and that is dermatin sulfate and heparin sulfate. So in both of them, the accumulating compound is same. So this is from the notes only. MPS 1, Hurler disease, MPS 2, Hunter disease, the accumulating compound is same. In the options, there was a sphingolipid also. So one of the options was sphingomyelin. Was it sphingomyelin? Sphingomyelin will not accumulate in any of the mucopolysaccharidoses. So sphingomyelin tha ki nahi tha, you have to confirm the same. Sphingomyelin does not accumulate in any of the mucopolysaccharidoses. Dermatin sulfate and heparin sulfate, ये तो था ही ना, dermatin sulfate and heparin sulfate. एक option ऐसा तो होगा ही. So that was the answer. Yes, ये तो वो topic था जो देख के जाना था एक दिन पहले. Yes, no, not sphingomyelin. So what was the option? Only sphingolipid was mentioned. Okay, I agree. So one of the options was, point taken, one of the options was sphingolipids, not sphingomyelin. All right. तो फिर option ये correct है. This dermatin was there. Dermatin and heparin. What was the other two options? We still have to go with the other two options. Let's say it is one of the options was this, dermatin sulfate and heparin sulfate. That is our answer. Any of the two is asked, irrespective of that, the accumulating compound was same. अच्छा, एक चीज और, there was a question on Netovix, yes or no. Netovix पे कोई question था, yes or no. Let's talk about Netovix. B option नहीं था. Okay, there was a option of sphingolipid. Keratin sulfate था एक option. Keratin sulfate था एक option. Remaining one option still we don't have. No, there was no question on Netovix. Okay. All right. So we will cross this. So there was no question on Netovix. All right. Keratin sulfate and chondroitin sulfate. So this is our option D. So we have got all the options. All right. And there was a question on hyperlipidemia, right? There was a question, yes, this is Tangier's disease, ABCA1 mutation, HDL is not getting formed. There is less of circulating HDL. Good cholesterol has decreased. Yes, good cholesterol was decreased. And what else was given in the question? So orange colored tonsils, that I know was given there. What else? I need to have what was the complete question so that we can discuss the answers, options and the answer. So I have to know the complete question. सिर्फ orange colored tonsil था, उसके अलावा क्या था? Xanthoma was given. What type of xanthoma? It was a long stem question. So probably that is the reason we are having difficulty in remembering. Okay. So there were 2 questions on hyperlipoproteinemia. One question, Tangier question, another question, atherosclerosis question. All right. So let's say that there were 2 questions, one on orange colored tonsils, another was having 2 different questions. Okay. It was a lengthy one. I agree. So this was having xanthoma tha isme, other question mein, and there was LDL level ko kya ho rakha hai isme? What was LDL level? MI was given. Okay, this is the other question we are talking about. Subcutaneous xanthoma was given. All right. Xanthoma was a different question. Yes, I agree. There were 2 questions. We all have agreed to this. There was an alboxanthoma. Okay. History of MI in father. What was the level of LDL in this question? LDL का level question 2 discuss कर रहे हैं. There were 2 questions on hyperlipoproteinemia. LDL was 480 milligram per deciliter according to one of us. There was a family history positive of MI. Family history positive था. Family history positive था. All right, we have different values. Another one of us is saying 300 and total cholesterol was 450 milligram per deciliter. So this here LDL was more. Alright, चलो अगर हम ये भी माने LDL still is higher side पे है. Basically LDL is on high side. Right, so this is type 2 hyperlipoproteinemia. Type 2A hyperlipoproteinemia. Options were 2A, 2B, 1 and 3. This is 2A hyperlipoproteinemia. Because father had MI, so this is a case of LDL receptor defect. So ये तो classical case of LDL receptor defect है. अच्छा, what was there in the Tangier's question? Now let's discuss the Tangier's question. We have got our hyperlipoproteinemia. We all have agreed there were two of the questions. One was having subcutaneous xanthoma, MI, and the values of LDL and total cholesterol is as this, right? We'll cancel this out. Not many of us has agreed to it. And there is MI, family history positive for MI. All right, this is type 2A. All right, orange colored tonsils, uske alawa kya diya tha? Tangiers was mentioned anywhere, yes or no? Was Tangier mentioned anywhere? Was it an image based question? Was the image given? Image tha. Tangier was very lengthy question. पहली लाइन से आंसर हो गया था. All right, good. So that makes us happy. Orange tonsils were mentioned. So what was the options? Options तो बताओ. No image was given. All right. Now, अब options क्या थी? Tangier was an option. Okay, then तो it is very clear cut. Okay. हाँ, हमने पूरा क्वेश्चन पढ़ा ही नहीं. हमने फर्स्ट लाइन देखा. फर्स्ट लाइन में ऑरेंज कलर टॉन्सिल्स वाज मेंशन, राइट? वो वैसे भी बायोकेमिस्ट्री तो याद रहती नहीं है. जहां थोड़ा बहुत याद था हमने टेंजियर मार्क किया, आगे चल पड़े. वी डू हैव नॉट सीन कंप्लीट क्वेश्चन. ऑलराइट, Yes, I agree. Both were different questions. One question on Tangier disease, another question on type 2, hyperlipoproteinemia. Yes, we saw orange tonsils and we marked Tangier's disease, ABCA1 mutation. Alright, there was some question on tyrosine deficiency and phenylalanine hydroxylase levels were normal. Tyrosine is deficient. Well, let's say, try to revise it. Phenylalanine jo hai, that is converted to tyrosine. The enzyme is phenylalanine alpha hydroxylase. ये enzyme को, it requires dihydrobiopterin converted to tetrahydrobiopterin. This enzyme will simultaneously do this. So we have to convert this back because it requires THB. Biopterin was there in the option, so it was alright. And as we always say, यहाँ पे dihydrobiopterin reductase is present. And this is, trust me, this is a repeat question. Last year, there was a question on dihydrobiopterin reductase. So this was a previous NEET question. And this year they have asked tyrosine deficiency है, phenylalanine hydroxylase normal है. ये नहीं बना, ये normal है, तो somewhere problem is either in the tetrahydrobiopterin or the reductase. So last year dihydrobiopterin reductase was asked, this year tetrahydrobiopterin is asked. What were other options in this? Alright, I get that one of the option must be THB. What was other options? I need other options also. Anything else? PLP sulfate was there in the option. Alright, pyridoxal phosphate. I think that is what you mean. PLP was there. What else? So coenzyme cofactor was asked in this reaction. So coenzyme was asked in this reaction. PLP के अलावा tetrahydrofolate was there in the option. Alright, good. Dihydrofolate reductase was option. Alright, THB was not given. Biopterin was given. Okay. THB is the active form of biopterin only. Tetrahydrofolate, and the fourth option is dihydrofolate reductase. Perfect. So let's all agree to this. There was a question which said tyrosine is deficient, phenylalanine hydroxylase is accumulating. Which of the following is deficient, right? Of the substrate accumulate in the hexosaminidase deficiency. Anything else was given in this question? कुछ और दिया था इसके अलावा? Any biopsy finding, any clinical features was given? Any biopsy finding was given? Or any clinical feature was given? And is the options like given were like this only? Okay, so let's say cherry red spot was mentioned. Okay, good. We said that cherry red spot was mentioned in the question. कोई biopsy finding दिया था? Was there any biopsy finding? No organomegaly. I suppose you want to say that there is no hepatosplenomegaly or no organomegaly. Directly enzyme was given, hexosaminidase was given. Some of us are saying cherry red spot was given. Some of us are saying that directly the enzyme was given. GM3 was not in the option. Okay. And we will say that sphingomyelin, alright, myelin दिया होगा और एक गैलेक्टोसेरिब्रोसाइड दिया था. गैलेक्टोसेरिब्रोसाइड दिया था. cerebroside was mentioned. Previous question ka answer is biopterin. Yes. Fourth option was sphingomyelin, and let's say C was galactocerebroside. Direct enzyme deficiency was given, so cherry red spot was not given, no biopsy was given. Alright, so this is here is GM2 gangliosidosis. Yes, in Tay-Sachs, hexosaminidase will be deficient and it will result in accumulation of GM2 ganglioside. Alright. Anything else you remember? Was there any question on enzymes? Competitive enzyme inhibition? Competitive, non-competitive enzyme inhibition? Some graph was given or something like that. Yeah, as an example it was given. Was there any question on competitive? Cherry red spot was given. Some of us are agreeing to it. Alright, ठीक है. Competitive, non-competitive पे कोई question नहीं था. Alright. Any question you can recollect on electron transport chain? Anything on ETC, enzyme inhibitors, कुछ पूछा हो, या cytochrome oxidase inhibitors, carbon monoxide, cyanide, anything you can remember from that? कुछ याद आ रहा हो? ETC से कुछ नहीं था. There was no question on electron transport chain. Okay. Was there any question regarding glycogen storage disease, von Gerk's disease? Probably can be a question, integrated question हो सकता है with some other department के साथ कुछ हो. There no Niemann-Pick is there on one question. There is somebody is saying there was a question on Niemann-Pick. No, okay. So there was. So Niemann-Pick पे कोई question नहीं. Glycogen storage diseases पे कोई question था. Was there a question on ketosis? Ketosis वाला question क्या है? Anybody who can recollect ketosis का question? See, there is one question on Niemann-Pick disease. And no question on glycogen storage disease, no ETC, no enzymes पे question. Alright, what was the question on Niemann-Pick disease? Ketosis पे क्या question था? Starvation था. Alright, some of us are saying there was a question on vitamin A deficiency. Vitamin A deficiency. Yes, brain uses ketone bodies after 2 to 3 days of starvation. Yes, brain uses ketone bodies. 5 days क्यों? 2 to 3 days of starvation. In the question it was mentioned miner trapped for 5 days and survived. So what is the source of energy? कुछ ऐसा था? Miner trapped था and for 5 days. And what is the source of energy? Something like that. Okay. So there was some question on starvation and the source of energy will be ketone bodies. High glucose maintained for long time. What will happen to insulin? Insulin will go down in this starvation case if we are talking about the same question, right? Achha, there was a question on phrynoderma. Again, it is a repeat question. Phrynoderma and phrynoderma. Again, this is a repeat question. There was a question in NEET previously also on vitamin A deficiency. On vitamin A deficiency. What was the question on vitamin A? Acha, what will be the next examination you will do? All right, so you'll go for ophthalm examination. Now what was exactly mentioned? Other options kya the that you will have to tell me? Brain nutrition, that we have already discussed. This will be ketone bodies. Ketone bodies is the source of energy. Ketone bodies is the source of energy through all the system of the. So let's discuss two questions one by one. We are discussing two questions one by one. Brain में क्या source of energy है and body में क्या source है. After 2 to 3 days of starvation, brain will start using ketone bodies like all the other tissues of the body, except RBC. RBC will continue on utilization of glucose. So I think brain was asked, so it is lipolysis is the source of energy because ketone bodies itself comes from lipolysis. So if the options was lipolysis, gluconeogenesis, I can see in the options gluconeogenesis was there in the option, right? So that is glycogenolysis was there in the option. So we can say that the answer is lipolysis. And there was another question on vitamin A, that is ophthalm examination. All right. And there was a question on vitamin C also. Vitamin C, prolyl hydroxylase. Good. Prolyl hydroxylase. Prolyl hydroxylation is required for collagen formation. All right. So these many questions were there from 10 to 15 questions were there from biochemistry. All right. So there was some question related to vitamin C also, and there was some question related to glutathione also. Riboflavin was there in the options. What was the question? Glutathione pe what was the question? Assessment के लिए, okay, vitamin B2 की assessment के लिए we go for glutathione reductase. And we always say that vitamin B1, B2 is asked, assessment is asked alternatively. So this time B2 was asked. All right, so that completes the questions on biochemistry. Thanks and relax now. You have had a very tough day today, all right? All right, thank you so much. Thank you so much.
Hi. Am I audible? Am I visible? If yes, just give me a thumbs up. I'm not going to take more than 5 minutes. We got 5 questions in anesthesia. All 5 of them were expected. Like I always told in the class, the most important topic these days is critical care. So we got 1 question on critical care. We got 1 question on CPR. We got 2 questions on complications and 1 question on airway. And all of this is something that I told you repeatedly are going to be asked, isn't it? So we are going to discuss the 5 questions. This is a immediate recall. This is only meant for you to feel better. I am very, very, very happy that you guys are sitting here in front of me after giving such an exam, and this feels wonderful. My best wishes to all of you. You have done good. You have done great. Just quickly go through this, switch off for tonight. Tomorrow, take a break for 3-4 days and then just relax. All right. Am I audible, visible? All right. So the first question was, in a patient with ARDS has a PaO2 FiO2 ratio less than 100 indicating severe ARDS, what is the next appropriate ventilatory strategy? And this is something that we have discussed in the class when I told you about the initial ventilator settings, and I gave you lung protective ventilation, which is done in ARDS and otherwise. And you can see in lung protective ventilation, the most standout feature was low tidal volume, and you will always give some PEEP. But if PaO2 FiO2 ratio is less than 100 indicating severe ARDS, then you will give low tidal volume and high PEEP. Low tidal volume, high PEEP. And this is the question that came last year. What is the function of PEEP? That is positive end expiratory pressure that causes alveolar recruitment, improves oxygenation without affecting tidal volume. All right. So the correct answer is low tidal volume, high PEEP. Low tidal volume, high PEEP. Yes, I understood your sentiments that you want this session to go very fast, but you have to let me at least speak something. Hai na? I understand you want it very fast, and at the beginning only I told you I'm going to take a total of 5 minutes. How much? Total of 5 minutes. If it was less than 100, it is severe ARDS. If it is about 100 to 200, it is moderate ARDS. If it is 200 to 400, it is mild ARDS. Only above 400, it is normal. So any which way, it indicates ARDS. There's just a way of telling you that the oxygenation is not appropriate to the FiO2 that you are giving. A 2-year-old child with a history of peanut ingestion presents with sudden unresponsiveness and choking. I think there was choking also, and choking. And this is something I repeatedly told you last year, entire year. Whenever I taught foreign body obstruction, I told you, last NEET we got a question, you are sitting in a restaurant, somebody chokes on food. What would be the next step in the management? You said, sir, I will give abdominal thrust called as Heimlich's maneuver. I told you, next year they are going to ask this question. I am sitting in a restaurant, somebody chokes on food, is non-responsive. They gave a 2-year-old which is treated as an adult for foreign body obstruction, peanut injection, so foreign body obstruction, unresponsiveness. So you will immediately start with CPR. Immediately start with CPR. No, it's stuck for me as well. It is stuck. Yeah. Am I audible, visible? Yeah. Is it complete? Yes, I told you everywhere. Absolutely. Every time, because that is how it works, right? After administration of neuromuscular blocker, the patient suddenly develops flushing of face and becomes hypotensive. I'm not really sure that they gave neuromuscular blocker. I think they gave a drug, an IV drug, and after which you got flushing of the face and patient is becoming hypotensive. Flushing of face is urticaria. And you know, in anesthesia, whenever you give a drug that causes urticaria, that means it releases histamine. And in the complications of bronchospasm, we have discussed every time the entire drugs in anesthesia that release histamine, which is thiopentone, scoline, Meva, Atra, DTC, morphine, and meperidine. And that is exactly what was asked. 4 neuromuscular blocking agents: ROC, VEX, Cis-Atra, and Atra. And of course, the correct answer is Atra, because Atra gives histamine release. No, I am very positive that unresponsiveness was given. Lot of students have told me that unresponsiveness was given. Patient with a history, 2-year-old child with a history of peanut ingestion presents to you with choking and unresponsiveness. Okay, so other option was pancuronium. But doesn't matter, pancuronium, rocuronium. Pancuronium is vagolytic. Okay. Yeah, but vagolytic will not cause hypotension, right? It will cause tachycardia and hypertension. Flushing it will not cause. Okay. Yes, unresponsive was given. I am 100% sure, because unresponsive I got from multiple sources which said with absolute certainty that unresponsiveness was there. No, the correct answer was start giving chest compressions. Start giving chest compressions. Jasdeep, I know that you feel that what you have marked would be correct, but trust me, it was unresponsive and the correct answer was, the idea of this recall is just to get you an idea what went right, what went wrong, so that you can have a rough idea of where you stand. Okay. A needle cricothyroidotomy is being performed as shown in the image, and they showed the image of a neck with needle cricothyroidotomy. Which of the following statement regarding this procedure is true? Which of the following statement regarding this procedure is true? Now this was the tricky one. It should be effective ventilation for 6 hours used to measure CVPs followed by track and work of breathing is more than face mask. And I know a lot of you got confused between these two, C and A, because you were damn sure that it is not used for CVP measurement because the needle was shown in the middle of the neck. So everybody knew this is not IJV. So they showed needle entry from the patient's head end and it was in the middle. So they know that it is not IJV. So this is out. Work of breathing will be more than face mask ventilation is out of question because highest dead space is with face mask ventilation. Maximum work of breathing is with face mask ventilation. We have often discussed this point. Now the question is, can it be used for effective ventilation up to 6 hours and should be followed by tracheostomy? And anybody who has attended my class, whenever I have taught them the concept of CICO, I told them, now that you are in soup, can't intubate, can't oxygenate, then your plan D will be emergency cricothyroidotomy, and this is always followed by tracheostomy because this is not an airway through which you can ventilate. There will not be effective exhalation of CO2. It is only meant to give passive oxygenation. In the meantime, somebody will get a tracheostomy done. So the correct answer is it should be followed by tracheostomy. It should be followed by tracheostomy. Okay. Yeah, okay. The wordings can be different, but ultimately it's the same gist. फर्क नहीं पड़ता ना whether it is an emergency room. You can have a CICO situation even in casualty. Can't you have a CICO situation? In fact, most of the CICO situations are in casualty only. Right? Difficult airway algorithm is not only restricted to what you see in anesthesia. Anywhere you are intubating. No, the image that was shown, I'm sorry, this image didn't come here. The image that was shown was needle cricothyroidotomy. A patient develops hyperthermia, generalized muscle rigidity and rising ATCO2, receiving scoline and sevoflurane. What is the drug of choice? Straightforward. We discuss it every year, and this is a question that comes also everywhere, isn't it? This is a question that comes also every year. It is in the management of malignant hyperthermia, and I told you in malignant hyperthermia they will always give you a trigger, volatile anesthetic agent and scoline, and they will always give you either hyperthermia, sudden rise in ETCO2 or muscle rigidity. Something they have to give you that makes you believe it is malignant hyperthermia. Yeah, so life-saving drug, dandrolin. In this case, treatment would be the life-saving drug. Parth is saying question 5 was not asked. Okay, life-saving drug. Okay, drug of choice or life-saving drug. Does it make a difference? If you are not going to treat malignant hyperthermia, it is going to be fatal, right? So life-saving drug is also dandrolin. Okay. All right. So this is it from my side. I hope you had a good time and my best wishes are with you. And I hope that you don't attend this type of recall session again in your life. Thank you so much and bye-bye.
Hello everyone. Yes, how are you people doing? Yeah, physiology questions were easy this time. Yes? Easy or difficult? What do you say? Easy, no? Right, easy, right? Yeah. Hello everyone. Yes, so easy. PSM difficult tha? PSM was difficult? Okay. Yes, very good evening, Chalo, fatafat, let's quickly discuss the physiology questions. There were not many questions, I could only gather around 7 questions, right? So we will discuss them quickly so that I think most of you are, Yes, I will teach faster than Dr. Anshu, right? Don't worry. Right. Okay, let's do it for the first one. Which of the following point in sarcomere length tension relationship curve represents the maximum active tension? Physio अच्छा था ना कस्तूरी? चलो good, thank you. Maximum active tension generated due to optimal overlap. Voice echo. Just give me a minute. Echo. Okay, I'll just get it done. Just give me a second. Yes, absolutely correct. It is point B. I'm getting this done. हेलो वॉइस देखो यार, वॉइस ठीक नहीं आ रही.
हल्का सा कम करनी है सामने से.
कहाँ से? करो यार, करो पहले करो. Yes, I'm showing you the graph. Point B shows what? Okay, I will do corrections. Thank you for pointing out because there was some ambiguity. Okay, I'll do like this. Point B corresponds to what? Okay, fine. Thank you so much. Thank you for, and please help me complete the questions. Right now, this is the picture which also have been given in the yes, Arju, I'm continuing in the B2B lectures. If you will recall, then remember at different lengths we have different relationship. This is, let's say, A, which is also A in the exam. This is B, which most of you are talking about. This is C, and this is D, right? Yes, answer is B, absolutely correct. But if they had asked what does point B represent, naturally it represents the point at which maximum active tension or total tension is generated. The reason is because this corresponds to, please see here, you have to identify the figure which is corresponding to maximum overlap. This should have been a very easy question for most of you. ये गलत नहीं होना चाहिए था ना. This you should not have done wrong. And I don't think I should be getting any wrong answer here. It was not like this, Dr. Introvert, then please let me know or help me out. I have given my WhatsApp Telegram number, right? Most of the students had sent me this kind of picture. If any other information was there, please, yes, send me again. Maximum overlap was shown as diagram A. Okay, then also it is fine. Let me change. If I, yes, rephrase this, then please see. Yes, if I rephrase this, yes, just see this. If I rephrase this, then I can make 4 figures. Yes, please listen to me carefully. This is now the A, right, as most of you are saying. If it was given like this, please understand you have to pick up the point at which there is maximum actin-myosin overlap. The number is not mentioned. It was like the DVT diagram. Okay, thank you, Gaurav. So, DVT picture, right? Please, just everybody see and let me know if it was the same picture. Yes, B is the answer. Arey Shreya Bhattacharya, B is maximum because at this point the sarcomere length is optimum 2 to 2.2 micron. At less length, less than 1.2 micron, there is some of the actins are like this, they are moving upon each other, right? B is the only answer. Let's move to question number 2. In a patient with pulmonary thromboembolism completely occluding the blood flow, at which point on the VQ line will this point occur? At which point on the VQ line will this point occur? Yes, quick. So somebody was saying it was only embolus, some students were saying yes, workbook photo tha, very good. Who said that? Metal X, very good, Metal X, absolutely correct. Workbook का photo था ना, तो you felt happy in the exam. ये वाला photo है देखो, exactly VQ line का same picture है जो class में I have been teaching you, telling you, and really after running after you, right? That's very good. Absolutely workbook का picture है, and this is the normal one. Let's recap. Normal one में alveolar O2 100, PCO2 is 40. Remember they had given you complete occlusion. Complete occlusion means now this is the alveolus, this is the pulmonary capillary, this is completely occluding. Yes, what will be the VQ ratio? Lowest point, very good. This is the VQ ratio of infinity, dead space, right? And they had just given 4 points as far as most of the students have been telling, A, B, C and something like this D, right? So please, if they had given it in the reverse way, then A would be the answer, as some of you have told me, like this. But had it been given in the fashion of A, B, C, D in the red letters, then D would be the answer. Get hold of the concept. Dead space means complete occlusion of the vessel, no blood flow is coming, only ventilation. Remember, wasted ventilation. Alveolar O2 here is 150, same as inspired air. Alveolar CO2 is only 0.3 millimeters of mercury, right? Let's move to question number 3. This I could only get some of the lines, but this is mainly an OBG question, so I'll leave it to Dr. Deepti. She must have discussed, and let's leave this aside. This is basically an easy question about menstrual cycle, that what will happen between 21 and 25 days, right? So estrogen and progesterone increases, LH and FSH decrease, right? Most of you would have done that correct as well. Let's move to question 4, that is physiology question, and again overlapping with pharmacology. Yes, Vinayak, absolutely correct. Himanshi said answer to D ho gaya na, I told you na. Had it been given in the red ones A, B, C, D, तो answer is D. And had it been given in the blue ones A, B, C, D, अगर ऐसे लिखा हुआ है, then the answer would be A. Now it all depends, है ना. Estrogen, progesterone is an OBG question. So red wala is the answer would be D, and blue wala would be A. It is the same. Abhishek Roy, thank you. If it is from top to bottom ABCD, तो D answer है. Thank you for pointing out that. If you can recall correctly, then we'll leave the other ones aside, है ना. So इसको छोड़ देते हैं. Then leave it aside. तब answer D है. Then the workbook picture absolutely correct. Let's move on to question number 3. इसका answer already have been discussed in OBG. This should be none other than estrogen and progesterone increase, LH and FSH decrease. चलिए, wonderful. Okay, Dr. Abhishek, thank you. Let's move on to question 4. Which of the following is the primary mechanism of action of hydrochlorothiazide or the thiazide diuretics? So you know thiazides are, yes, why do we give thiazides? Thiazides are given for idiopathic hypercalciuria because it increases calcium reabsorption in the DCT, right? In the DCT, leading to decrease in urinary calcium. This everyone knows, I think. Wonderful. Okay. Fibrilin question I think will be discussed in ophthalmology. I feel options were different. Well, yes, Dr. Putin, please then send me on my WhatsApp number. Person is climbing a high mountain for trekking, or basically he is doing trekking based on which physiological response to high altitude? Likely primary acid base abnormality. Okay, SK, send me the WhatsApp. I'll recorrect it for tomorrow's session, right? So today I could only gather these choices from you people. Yes, this is one of the easiest question. At high altitude, there is hypoxic hypoxia. There is increase in ventilation resulting in CO2 washout. वो वाला question भी है. Wait for a minute, Rishabh Mittal. I am discussing that as well. Cerebral edema वाला question भी I am just discussing. Just give me only 1 minute. That is also coming up. Okay, Akhil Reddy, I'll recorrect it. How chlorothiazide causes stones. Okay. High altitude cerebral edema is due to. I think Dr. Rishabh was telling us about this question. High altitude cerebral edema. Now please tell me, is it cerebral edema given in the question, or is it was pulmonary edema? What was given? Yes, can you recap? Is it pulmonary edema given or cerebral edema given? If it is cerebral edema, then please remember the answer is hypoxia causes increased vasodilation. Then answer would be low PO2 mediated vasodilation. Cerebral features were given, no edema. Okay. Vomiting, cerebral edema in options. Okay, fine. Okay, then let's wait for tomorrow. I'll correct it. Why, Dr. Introvert? Why low PO2 will cause vasodilation? Vasodilation will cause, rupture of the cerebral capillaries. They are so thin. So increased cerebral capillaries will rupture. Transudation of fluid will occur. This I don't need to tell you. And if pulmonary edema was not given, raise it out. So we don't need it, right? No, hydrogen ion causing vasodilation will not be the answer. That is wrong. because at high altitude hypoxia causes vasodilation everywhere, and too much of increase in hydrostatic pressure in cerebral capillaries, this will cause rupture of cerebral capillaries leading to transudation of fluid, that is cerebral edema, right? Yes, this I think you should have got correct also. Patient has the following values for Starling forces: capillary hydrostatic pressure 18, capillary oncotic 27, interstitial oncotic 7. Rohit Raman, yes, insulin valve question was also there, but I could not get the options correctly, but I will just discuss with you what will happen. Yes, I remember that. I will discuss it at the end, right? I have the fair amount of question here, not exact. Yes, please see this. Some of you are getting confused unnecessarily, although you know I have been telling you in the class that this question will definitely come on calculation based. Quickly recap. This is hydrostatic pressure in capillary, favors filtration. What is the value given? 18. Then I have oncotic in the capillary. Very good, -2 is the correct answer. That is a pulling pressure. This is given as how much? This is given as 27, right? 27. Then I have interstitial oncotic pressure, which is interstitial oncotic pressure is this one. What will it do? If I have more proteins in the interstitial fluid, it will also pull the fluid out, right? Pull the fluid out. And then they are asking you what is interstitial hydrostatic pressure. Interstitial hydrostatic pressure. This is what they are asking you. This is trying to push it back. Now I think all of you will be able to tell me the answer quickly. So net filtration pressure is given as 0. Net filtration pressure is given as 0 because some students were saying they had given no filtration across the arteriole. Some were saying it has given according to capillary. Okay, Akhil Reddy, I have taken that into account. So if I calculate this should be hydrostatic in the capillary plus oncotic in the interstitial minus oncotic in the capillary minus hydrostatic in the interstitial. Now let's put up the values. We are done with this. This is 18 plus oncotic in the interstitial 7, 25 minus 27 minus this. If you solve this for me, 25 minus 27, yes, so answer would be -2, right? Some students are saying +2. It is not +2, it is -2, right? It is -2. And finally, one insulin question which I could not get the options correctly, but insulin, remember, it is initially the pre-stored insulin is released. Initially, yes, please send me the exact question if you have. Initially, the pre-stored insulin is released. Later on, newly synthesized is released. Anubhav Sharma, तभी बोल रहा हूँ एग्जैक्ट क्वेश्चन भेज देना, राइट? सो इनिशियली प्री स्टोर्ड इंसुलिन इज रिलीज, रैपिड राइज, लेटर ऑन न्यूली सिंथेसाइज्ड इज रिलीज्ड. RKM ज्यादा हो गया, ठीक है, थोड़ा सा ज्यादा हो गया. सो समथिंग लाइक दिस, राइट? So this we will figure out tomorrow. I'll try to get the exact options for you all. So we are done with physiology, right? Not many questions, only 7 to 8 questions, and most of them were of easy and moderate level. None of them was difficult, right? Thiazide question, I have taken into account your option which you have given me in the chat. I will try to get more options by tomorrow and we'll do a good recall tomorrow, right? Yes, an iron gap question, medicine faculty will discuss. Okay, Pavan Gupta, this is a rough which I have written. I will give you the exact question tomorrow, right? Let me recap. Thank you so much. Okay, Manshi Sheth, I will take into account this question as well, right? So best wishes for the result, right? Take care. Thank you so much. Yes, thank you. Yes, yes, we will do complete one with the best options tomorrow, right? Tomorrow evening we'll do a better one with exact options. I'm trying to figure out more options with help of all of you. So kindly keep on sending me, all the options on my WhatsApp number, whatever you can recall, right? I hope I'm not asking for.
Hey everybody, good evening all of you.
A very good evening everyone.
Yeah, so we are visible, audible everybody. So how was your NEET PG pediatrics section today? So it's me and Dr. Ashutosh here. So we feel that I think previous year topics were definitely asked. What do you think, Dr. Ashutosh?
Yes sir, they were previous year topics, only one or the two topics might have been different and mainly it was a doable questions.
देखो B2B में हमने जितने भी टॉपिक्स की हमने डिस्कशंस की वही सारे टॉपिक्स जरूर आते हैं. So all of you remember that it is not about the previous year questions, it is about the topics. So guys, let us start with the first question, and so please let us know, you were the ones who gave this exam, so can you let us know, there was a pedigree of mitochondrial inheritance. Mother was having the disease and all the children of affected mother were affected and none of the children of affected father. So guys, were all of these four options, Prader-Willi, Williams, Keene-Sayre syndrome and achondroplasia? यही थी options. So of course, the answer of this question was Keene-Sayre syndrome. Keene-Sayre syndrome. This was the answer of this question. Okay, so all of you agree? Okay, done. So the second question, Dr. Ashutosh.
Yeah, second question, you had basically a 6-year-old child has fever and had seizure. What drug should be used? So if this was the question, they're asking you what the child is already having a seizure, but they're asking continuous seizure the child is having. So in that case, I think the answer should be the diazepam. It is basically the febrile seizure question, right? And it was the diazepam. Next one, sir.
Okay, so there was a question. See, we always discuss in all the DVTs that emergencies to zarur aati hi aati hai. So there was a child who had choked on a peanut and he was unresponsive. So see, more than 1 year, we do Heimlich maneuver. But if a patient is unresponsive at any point of time, हमने DVT में भी यही बात की, if any patient is unresponsive at any point of time, you will start CPR. So less than 1 year, we give 5 back blows and chest thrust. More than 1 year, we give Heimlich maneuver. But at any point of time, if he's unresponsive, so we give CPR. Over to you, Dr. Ashutosh.
Yeah, next one. It was a question, drug of choice for prophylaxis in the Neisseria meningitis, right? We basically can give rifampicin, we can give ciprofloxacin, we can give ceftriaxone. Ceftriaxone was not given in the choice, so the straightforward answer goes for the rifampicin here.
Yeah.
So next one.
Thank you. So now this was a tricky question, guys, because we all of us know that they ask about Hurler and Hunter. So they asked about a child who has clouded cornea and coarse facies. So can you tell me, all of you, can you tell me the exact statement? So question tha, so clouded cornea is seen in Hurler syndrome, autosomal recessive, and this is a table from OP Ghai current issue which shows that both Hurler and Hunter may dermatan sulfate and keratin sulfate is accumulated. Okay, so both Hurler and Hunter may dermatan and keratin sulfate. So yes, the answer of this question was dermatan and keratin sulfate. Okay, so both. So they are mucopolysaccharidosis where dermatan and keratin sulfates accumulate. Cool. Let's go further. And the next question, over to you.
Yeah, a new question. According to infant and young child feeding guideline, how much complementary feed should a 7-month-old be given? I think this is already a new question, unexpected question which came, right? And if you see, this is basically the IVCF guidelines, which says at 7 to 8 months, 3 times per day should be the frequency of the mashed foods. And you should gradually increase to 2/3 of a 250 ml katori bowl. So basically, this was the question. So if we say here, so the right answer should be here 3 times per day. That should be the right answer here. Yes, sir. Next question, please.
Thank you. So they're saying that in Hurler, they mentioned the enzyme alpha L-iduronidase. So, okay, I will correct that. So they had written that this child has a deficiency of alpha L-iduronidase. Okay. So, of course, this is Hurler of alpha L-iduronidase. Okay. So it was Hurler syndrome. Let's go further and let us talk about, of course, every exam of yours has a question on diaphragmatic hernia. So can you tell me what was the age of this child, everybody? So from our feedback, we got that this child was within 24 hours of life and there was an X-ray of left typical congenital diaphragmatic hernia and an apparent dextrocardia. So all of you, do you agree with me? Okay, so it was diaphragmatic hernia.
Yeah, a straightforward question from Asthma. This is the benralizumab is basically anti-interleukin 5 receptor, or you can say interleukin 5 receptor blocker. We are giving in severe persistent asthma, which is not responding to oral steroids. We are adding the biological therapies there. So straightforward question. Next one, sir, please.
Yeah. So I have been telling you, all of you, in every DVT, in every grand test, every CBT, last year मैंने सब में एक क्वेश्चन डायबिटिक कीटोएसिडोसिस पे डाला. So guys, can you tell me in your exam, was this patient having ketosis? And what was the age of this child? So ये बताइए कि what was the age of this child and was he having ketosis? See, I always discuss with you in all forums that for diabetes, ketoacidosis in the emergency, we give them a bolus first. So first step is to do volume repletion. Okay. And then after 1 hour of volume repletion, we start insulin infusion. You should monitor potassium. See, 3% saline is only given in symptomatic hyponatremia. So 3% saline is only given if someone has symptoms. Okay. Someone is saying sodium was 122. But देखो ऐसा है कि this patient should have symptoms of cerebral edema. So if you have a patient of diabetic ketoacidosis with symptoms and cerebral edema, then we will go for. Okay, very good. We have got someone saying that this patient was looking dehydrated. Remember, all diabetic ketoacidosis patients are dehydrated. Moreover, a student in the chat box is saying his BP was 80/50. So ये और बताता है हमें कि we have to give him normal saline bolus and insulin and 3% saline. Since what was the symptom? So can anyone tell me? Someone is saying patient was symptomatic. See, by symptom we mean he should have cerebral symptoms. He should have features of cerebral edema, signs of raised intracranial tension. ऐसे symptoms होने चाहिए. Okay. So 3% saline का indication अभी नहीं. Okay. So these are the best options, and all of you please always look at the diabetic ketoacidosis protocols. Students are saying potassium was also given. What about all of you bicarbonate? Let us know whether bicarbonate was given or not. Okay. Tell me, bicarb was there or not? Long stem question था. Last में लिखा था glucose. Okay. Seizures were there. All of you please एक बार सोच लो इस बारे में. Okay. But still the first step will be insulin to give a normal saline bolus, and then only go for, only if needed, 3% saline. That's not the usual case.
Again, the next one, what should be thought of in recurrent meningococcal meningitis? Now, out of this, if it is a C5 to C9 defect, in the late complement protein defect, the chances of Neisseria infections are increased. So you should think of C5 to C9 defect, particularly if C3 complement was given, then it should have been the pneumococcal. So C5 to C9, the answer is recurrent meningococcal meningitis. Next one, sir.
Thank you. Somebody is saying in the last question, the bicarbonate was 10. So I'll just add here that
But
bicarbonate.
one was saying bicarbonate was not there.
Okay, so someone is saying it was not there. So
Yeah.
guys, you decide, okay, bicarb was there or not. But still, we will go for the protocol as per the diabetic ketoacidosis or hyperglycemic coma. Okay. Okay, so let's go to the next question. And this was a very interesting question. We always talk about congenital hypothyroidism. NEET PG 22 में भी question आया था on technetium nuclear scan. Now this patient has a normal ultrasound neck. So if ultrasound neck is normal, so agenesis तो बिल्कुल नहीं है. Okay. Now remember that in our India, we all of us follow the Indian Society of Pediatric and Adolescent Endocrine. DVT maybe we talked about this. So now here you can see that if there is no uptake on the scan and ultrasound shows a gland, it can be maternal thyroid antibody or iodine uptake defect. Okay, so no uptake, but ultrasound gland, normal gland, iodine uptake defect. So going back to the question, the answer of this question was iodine uptake defect. All of you agree with me? Iodine uptake. It is not dyshomogenesis, Dr. Fatima, because what will you see in dyshomogenesis? यहाँ ध्यान से देखो. On the right side, in dyshomogenesis, ultrasound will show enlarged thyroid. Okay, so in dyshomogenesis, enlarged thyroid is seen. But in that question, normal size gland was seen. So answer was iodine uptake defect. So this is an excellent algorithm which will help you later also. Dr. Ashutosh.
Yeah, this was a question. 8-year-old patient comes with chronic kidney disease and bowing of limbs. Calcium was given 7.9, phosphorus 6.9, alkaline phosphatase was high, but we have a doubt here. Was the PTH given normal here? If you can please comment upon whether the PTH was normal or whether the PTH was increased. So based on this, if you can comment upon.
What was the PTH, everybody, in this question?
If you comment upon. Rohit, thyroid dysgenesis could not be there in the previous question. As the sir already said, thyroid gland is visible there. Thyroid gland is present.
PTH was normal. Okay.
PTH was high, PTH was high, PTH was normal.
Someone is saying raised. See, normally PTH is up to 70 picogram per ml. Okay. So all of you should know normal PTH levels are up to 70 picograms per ml.
Yeah.
Yeah, over to you.
Yeah, so in this question, in chronic kidney disease, as the calcium is low also, so we'll not start with first vitamin D. We'll first go for the calcium and simultaneously we'll go for the phosphate binders. So the right answer here comes to the choice number A here, right? Next one, sir, please.
Thank you. So now there was a question on a mother has a lymph node swelling and she had toxoplasmosis 5 years back and her IgG is positive. So this is a past infection. There is no evidence of any acute infection. So all of you remember risk of anomalies is very less and we'll just reassure this mother and continue the pregnancy. It looks like a chronic, she has had a previous infection. So there is no risk of anomalies here and there is no need for any amniotic fluid sampling here. This is not an acute infection, so we'll not treat also. Okay, we'll just do reassurance. So that was all about pediatrics.
So that was all the questions we got. If you have got any other questions you feel like, please you can share to sir or to me, to any one of us, right? Hope you got all the results, what you all deserve and what you all for waiting for. Yes, sir, please.
Thank you guys and see you on the other side when you will be a consultant in our hospital and we'll see you there.
Thank you all. So we take leave. Bye.
My hello to all of you. Hello. Good evening. Can you hear me? Am I audible to all of you? Shall we begin? Good evening. So there were 6 questions that have been recalled according to the students. Can we have the screen share, please? I'm just waiting for the screen share. I think the slides are not visible yet. You want explanations in detail? 6 questions. Have you seen those 6 questions which I've just shared? Better. Please put it on a slideshow. Yes, thank you so much. Yes. So there were 6 questions that you could recall. So all the questions were clinical. No one-liner today. Is my voice clear? Arju Rahim, voice cutting. Is my voice clear now? Ruchita, Shubham Bansal, can you all hear me? I am Dr. Sachin with Psychiatric Recall Questions discussion with you on this DAMS Delhi platform. Is my voice audible? Can we go ahead? Please give me a signal that you can hear me. All fine now. Thank you so much. So these were the 6 questions that I could recall. 4 out of 6 were solvable from DVT on main notes and 2 questions were solvable from main notes. So total 6, all 6 were solvable, not at all difficult questions. You have 100% strike rate, so you can easily check the answers from your notes. Question number 1. A 21-year-old female presents to the emergency department with complaint of amnesia of the events for the last 2 weeks. After witnessing his father's sudden death due to RTA, was RTA mentioned? Road traffic accident mentioned? Was RTA mentioned? Road traffic accident mentioned? Yes. Was there a RTA mentioned? Yes. So RTA means minor trauma or major trauma? Major trauma. Murder, suicide, rape, robbery, accident, war veterans, etc. etc. Major trauma. After witnessing a major trauma, what are the 2 things that you can have? Either acute stress or PTSD. What are the 2 things you can have? Either acute stress or PTSD. Could you figure out this answer? Could you figure out this answer? Was this taught to you in the main class? Yes. Was this taught to you in the DVT class? Yes. क्या आपको इतना पता चल गया था that it is a major trauma? Were you able to figure out that this is a major trauma? RTA was mentioned. RTA was mentioned. Road traffic accident was mentioned. Okay. Then flashback. Was flashback mentioned? Was flashback mentioned? Can you see this slide from DVT page number 955? Can you see this slide? Previous slide, please. Question 1, previous slide, please. Can you see this slide? Previous slide, please. Question number 1. She is having flashback, but can I have previous slide, Abbasji, please? He's streaming it live. Previous slide. Question 1, explanation slide. Previous slide. Yes. Please, this slide, please. Could you understand that flashback was given and the duration was less than 1 month? Could you understand that the flashback was given and the duration was less than 1 month? Just tell me, any confusion in this question? Any confusion in this question? Any change of language required? Somebody message in the chat that you are not explaining the answer. That's why I was telling. Okay, if you don't want explanation, I will not tell. Fine. Was the duration less than 1 month? Answer is acute stress disorder. Somebody is asking in the chat, why not PTSD? So duration less than 1 month means acute stress disorder. Duration more than 1 month is PTSD. Okay. PTSD. Okay, we'll go fast. Next question, please. See, this session is for you. If you want fast, I'll give fast. If you want slow, I'll give slow. A patient's friend means Mr. K as being rigid, overly focused on rules and others, and a perfectionist, rules and order. But Mr. K denies it. He often submits work late because he insists on making it perfect and strongly in moral principle, which is the most likely personality disorder. Was this question like this? Any changes recommended? Any changes recommended? First of all, check. Check the language of the question. Any changes recommended? Any changes recommended? Were you able to solve this? OCPD. Was option OCPD or was option anancastic personality? Was option OCPD or was option anancastic? Can I have the next slide? Was this question solvable? Perfectionist. DVT page number 961. Did I tell you that if at all a question comes on personality disorder, the keywords will be mentioned? The keywords will be mentioned. Was the keyword mentioned? Perfectionist. Could you solve it? Thumbs up. Thumbs up if you could solve it. Okay. Next question, please. 35-year-old man, social worker, wandering in the another city by a social worker. He appears confused about the identity, cannot recall how he arrived here, which was 110 kilometer away from his home. Was 110 kilometer mentioned? Just tell me yes or no. Was the distance mentioned 110 kilometer? Was the distance mentioned 110 kilometer? New place, new life. Can somebody confirm, was the distance mentioned? Do you know that last week in FMG they also asked 100 kilometer away, 100 kilometer away. At that time also the answer was dissociative fugue. 110 kilometer means travel. Travel means fugue. Do you know how to differentiate amnesia from fugue? If it is only loss of memory, then it is amnesia. If it is loss of memory plus travel plus new identity is fugue. Next slide, please. Could you see this table? Next slide, please. Do you remember seeing this table from DVT? Do you remember seeing this table from DVT notes? Memory loss plus travel. Okay. Okay. Distance mentioned. History of earthquake also mentioned. Okay. History of earthquake. Okay. Earthquake I'll add. Travel after an earthquake. Okay. Earthquake is the new word that I'll add in the question number 3. Thank you so much for your input. Next question. Question number 4. Known history of mental illness presents after murdering another individual. Having paranoid delusion, the person was plotting against him. Even if he has a paranoid delusion, as per McNaughton rule, diminished criminal responsibility because he did all under the influence of delusion, under the influence of mental illness. Next best step. Will you call him guilty? Will you call him guilty? No. Will you refer the patient to psychiatry for evaluation? Yes. Was there refer to psychiatry mentioned? Was there refer to psychiatry mentioned? Yes. On evaluation, claimed to have paranoid delusion. Send him for consultation to a psychiatrist. Send him to a psychiatrist. Was it mentioned? Somebody saying no question like this. Was there a question like this? It is mixed of psychiatry and forensic. Was there a question like this? Refer to psychiatrist was mentioned. So refer the patient to psychiatry for comprehensive mental health evaluation. Were you able to answer this question in the exam? Were you able to answer this question in the exam? Okay. Okay, good. Next question. Question number 5. A young man presents to a psychiatry OPD reporting that whenever he sits down, he hears birds flapping their wings. He believes this is a sign from God directing him to move in a specific direction to stay safe. Birds flapping their wing. So a new meaning given to a normal perception. Birds are flapping, but I heard signs from the God. Bird chirping is a way the God communicates with him. Bird flapping, bird chirping. Is the question language recalled here correct? Is the question language recalled here correct? God gave signs. Is the question language recalled? Were you able to answer it as delusional perception? Were you able to answer it as delusional perception? Were you able to answer? Next slide, please. Do you know it is the first rank symptom of schizophrenia? Next slide, please. Do you know it is a first rank symptom when we are getting new meaning to a normal perception? Next slide, please. Next slide, please. Delusional perception. Next slide. It is not visual hallucination. It is not delusional idea. Okay, it is delusional perception, giving a new false meaning. Do you remember? Do you remember this statement? Workbook chapter number 2, page number 19. Do you remember this statement? Okay, last question. Question number 6. Did I tell you extrapyramidal side effect is a very important topic? Extrapyramidal side effect. Either dystonia will be asked or tardive dyskinesia will be asked. In DBT, did I make some movements with my mouth? Some students have made a video also of it. Orofacial dyskinesia, coriform tick-like movement. You might not be able to see it right now on the screen. What are we dealing with? Past 2 years antipsychotic, tardive dyskinesia. And what is the drug for tardive dyskinesia? Next slide, please. Did you see this table in DBT? Tardive dyskinesia, valbenazine. Come on, write your correct in psychiatry. 4 by 6, Abhishek Roy. Dr. Ashti Goswami, 5 by 6. Om Barwa, 6 by 6. Dr. Introvert, 6 by 6. Come on, everyone who is attending. Everyone who is attending, write your score, please. Do you think it was answerable paper? Do you think it was difficult paper? Yes. 4 questions were from grand test. So any question, any doubts, anything that you want to ask me? Any questions, any doubts, any question that you want to ask me? Thank you so much. So here we close the recall session. Here we close the recall session of psychiatry. Thank you so much. We close the recall session of psychiatry. Thank you so much.
So, hello everybody. So, welcome. Yes, good evening, good evening. Yeah. So, we have got Arvind sir and Rahul Nikumbe also with us. So, you have to help us with each one of the options if you have, so that we can make the best recall rather than only speculate. So, first one, we'll start with cardiology. Arvind sir is also here. So prophylaxis for atrial fibrillation. What were the choices? Just type them for me. Yeah, very quickly. We will not repeat. Whatever questions हो गया उसको हम आगे चलते जाएंगे. So just help me. Prophylaxis for atrial fibrillation था और क्या choices थे आपके पास? So verapamil was there. Okay. Adenosine. AFib with stroke भी है. Yes. Question was all except cardioversion. Okay. All except था. Okay. Okay. PSVT. Okay. Chalo. So ventricular rate was normal. So patient had stable vital. Prophylaxis of PSVT पूछा था. Okay. So prophylaxis of PSVT में हमें क्या देना है? Verapamil. है ना? So verapamil. Okay. So चलिए. Okay. Fine. Done in pharma. Tell me about this. So diffuse scleroderma पे क्या question था? Rheumatology questions. Yeah. Okay, I understood. ठीक है, वो करेंगे एक एक करके. Just you follow the questions जो मैं आपके सामने रख रहा हूँ. So try to help me fill those. Then we will take it forward. Okay, चलो done. CCB is correct. Okay, let's take it forward. What was the question on system is diffuse scleroderma? Okay, calcinosis क्या question क्या था? ओके एट्रियल फिब्रिलेशन क्वेश्चन अलग है. ठीक है, उस के पास आएंगे हम. कैल्सिनोसिस ILD. ओके. Most characteristic is anti-SCL 70. Okay. Myositis. Specific to diffuse. Okay. Hallmark finding. Yes, correct hai. So correct hai. ILD calcinosis. Calcinosis, of course, part of the CREST syndrome or the limited form. Okay. ILD can occur in both. Okay. SCL 70 was not given. Okay. तो क्या था? Most characteristic for closely associated clinical feature, not antibody. Okay. इसे हटा दो. Okay. और क्या था? Gastric कुछ ऑप्शन था. ये okay. SCL 70. Okay. Anti-HCL SCL 70 was positive. Okay. So though this is not there for sure. Okay. 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 ठीक है. Fine. So let us come back to that. Okay. Pseudo gout पे क्या question था? Okay. So SCL70 defines, yes, SCL70 is specific for the diffuse form of systemic sclerosis. It is specific for diffuse form of systemic sclerosis. ठीक है? Raynaud's phenomena was, Raynaud's also was there. ठीक है ना? Raynaud's is there. Raynaud's can occur in both. Limited also and this also. Yeah, ठीक है. Okay. ये था पॉजिटिव रोम्बॉइड. ओके ओके फाइन, ये तो डन हो गया. पॉजिटिव बाई रेफ्रिजरेंस. ओके विथ रोम्बॉइड शेप्ड क्रिस्टल. ओके, इसके साथ जो भी होगा डजेंट मैटर, ये करेक्ट ऑप्शन था. ओके डन. ग्रुप 3 एंटी अरिथमिक ड्रग. ओके, ग्रुप 3 एंटी अरिथमिक ड्रग क्या था? ओके ठीक है, समझ गया मैं. तो ये दिस फाइंडिंग वाज गिवन, the finding was given, this became the question and you are asked that what is the correct answer. So यहाँ पर आपने मार्क किया pseudo gout. ओके ओके ठीक है, वो तो डन हो गया. ओके, मैकेनिज्म ऑफ एक्शन एमियोडारोन. ओके डन. ओके सो इसमें तो ये देखा आपने, पॉजिटिव रेफ्रिजरेंस प्लस रोम्बॉइड शेप क्रिस्टल वाज स्यूडो गाउट. सो ये भी आपने देख लिया दैट एमियोडारोन group 3 antiarrhythmic drug. Mechanism of action already you have discussed in pharmacology, so let us not go to that. For ankylosing spondylitis MRI already Sumer sir has discussed, so that also we will not waste time on. Okay, so anemia in CKD. So please, this question help me. Anemia in CKD may whether to give iron, so that depends on transfer in saturation. So if the transfer in saturation or iron study कुछ दिया हुआ था, normocytic दिया हुआ था, क्या दिया था? Okay, was anything given to you? तो अगर transfer in saturation more than 20% है, तो then we give erythropoietin. Less than 20% है, तो we can give start with iron therapy. Okay. Okay, okay. Nothing given. No iron study was not given. Okay. So parenteral iron was there. Saturation was high. Okay. Yes. Yeah. So yeah, if nothing was given, so did they give at least MCV or something? MCV दिया था, HB around 7. So did they mention about filgastrim? तो ये आपका एंटीकोएगुलेशन के लिए है, उसको तो छोड़ ही देना. Yeah, that is okay. Fine. So this you wanted to mark the erythropoietin was the correct answer. Okay, chalo. So what about the systemic sclerosis question? Anna, so we have not got the clear recall. So let us not speculate. Let us come back with that correct answer. That SCL70 signifies that it is a diffuse form of systemic sclerosis. So MCV 110 दिया था. MCV 110 देंगे तो then that will become megaloblastic ना. Okay, ठीक है, चलो we'll come to that. Okay, fine. No, MCV 110 is different question. Okay, done. चलो कोई बात नहीं. So cardiac failure with vitamin deficiency, I think B1 was there. Okay, then erythropoietin is the correct answer. Without MCV, erythropoietin is the correct answer. Since nothing is mentioned, we can go with that. Okay, so erythropoietin, darbepoetin, correct answer. Okay, very covered, that we will go. Yeah, So coming to this question, Dr. Rahul, you can take the lead. Atrial fibrillation with stroke within 2 hours. Give me more of this. Yeah, done in biochem. Yeah. So ये tell me, acute stroke क्या लिखा था ये? Atrial fibrillation with stroke था. Okay, left-sided weakness. No hemorrhage on CT. So what to give? Tenecteplase, thrombolysis, RTPA, aphasia. Okay, 76-year-old. Okay, ECG atrial fibrillation was given. Okay. Came within 4 hours. Okay, बोलिए. Okay. यार 2 hours ही majority आ रहे हैं 2 hours. No ECG. Got. Okay. Yeah. So Dr. Rahul, क्या choose करना है best? You take over this. Verapamil was one option. Yeah. Hypertension, that is anyway relative contraindication. So weakness after hemorrhage is ruled out. Patient has come within the window period. Yes. So, yeah, Dr. Rahul. Yeah.
Arterial thrombus check and anticoagulant. Two things we will go. But age, window period, atrial fibrillation was not there.
Atrial fibrillation was there. Atrial fibrillation with stroke. They came within 2 hour window period. Left-sided weakness, aphasia with no hemorrhage on CT.
Anticoagulant.
So, kitna the severity of weakness, BP exactly not mentioned. So, RTPA versus anticoagulant, क्या choose करना?
We'll go with the thrombolytic therapy because the patient present within the window period and anticoagulant will be given later on. TE will be done later on for the thrombus thing. So other investigation are routine after giving the thrombolytic therapy. So answer is straightforward. Thrombolysis will be done.
Okay. ओके चलिए तो वो आ गया एब्सेंट ए वेव वाज देयर कोई क्वेश्चन था क्या एब्सेंट ए वेव का
I think the question about this was कि patient is a case of rheumatic heart disease with atrial fibrillation. All the following can be seen except. So now the students can give the input. What I have received is कि mid diastolic murmur with presystolic accentuation. Absent A wave in the opening snap, absent A wave. And raised JVP.
हाई रिस्क ऑफ स्ट्रोक, बच्चे और भी कंफ्यूज कर रहे हैं.
Maybe they can be two different questions.
Two different questions होगा, that
Yeah,
might
yeah.
be. With palpitation, tender hepatomegaly, which will not be seen.
Seen, yeah. So irregular heart rate is atrial fibrillation, and tender hepatomegaly will be a possibility here, and absent A wave seen in atrial fibrillation, but pre-systolic accentuation will not be seen if there is a atrial fibrillation. So I think that will be the correct answer, which is not seen. MDM with pre-systolic accentuation, not seen in AF.
ओके, यस. तो स्ट्रोक तो हो सकता है, रेस्ट इज ओके. ओके, चलिए सर. सो फिर एक सीएनएस में ओके. व्हाट अबाउट, एक क्वेश्चन था प्रोफाइलैक्सिस ऑफ माइग्रेन. ठीक है, डन. वो तो दो डिफरेंट क्वेश्चन है, ये क्वेश्चन आ गया. आरएचडी विद एफिप का तो हो गया. और प्रोफाइलैक्सिस फॉर माइग्रेन. ओके. प्रोफाइलैक्सिस ऑफ माइग्रेन इन अ पेशेंट ऑफ कोरोनरी आर्टरी डिजीज, ऐसा क्वेश्चन था क्या?
Patient on triptans, but again had symptoms.
अच्छा, कोरोनरी डिजीज इन फैमिली, prophylaxis for migraine, what should be given? So there was a family history of coronary disease. Topiramate, verapamil, beta blocker, propranolol दिया था शायद. Valproate. Rizatriptan was last option. वो तो prophylactic है समझो. Sorry, acute attack. So best answer, sir, propranolol रखेंगे.
With beta blocker, yeah, propranolol will be the best answer. That will cover both migraine as well as if there is a family history of CAD.
ठीक है सर, ओके. फिर एक ग्रोथ हार्मोन सप्रेशन टेस्ट. ठीक है, जो भी ट्रिप्टान दिया होगा, आई डोंट थिंक दैट हैज गॉट इंपॉर्टेंस हियर.
Yeah.
Okay, that was the correct one. Propranolol, ergotamine, rizatriptan, टोपिरामेट था ही नहीं. हाँ, चलिए. ओके ओके ओके. GH change with OGT, oral glucose tolerance test. Okay, best test in acromegaly. ये क्वेश्चन था और आंसर ग्रोथ हार्मोन सप्रेशन टेस्ट था.
Yeah, so that's a straightforward answer, na? Growth hormone suppression with OGT.
ओके ओके, ठीक है, फाइन. सो ये तो, इसमें और ऑप्शंस कौन से थे? IGF लेवल था और क्या था? ओके, कंफर्मेटरी टेस्ट फॉर गोल्ड स्टैंडर्ड फॉर एक्रोमेगाली, आंसर इज ग्रोथ हार्मोन सप्रेशन टेस्ट. IGF-1 था, दैट इज नॉट द ड्रग ऑफ बेस्ट टेस्ट तो नहीं है. GH सप्रेशन इज द बेस्ट टेस्ट. और क्या ऑप्शंस थे इसमें? Okay, confirmatory test was asked. What were the other options? IGF-1 with glucose tolerance, GH suppression test, okay. IGF-1 with oral glucose tolerance test, okay. Only IGF-1, okay. With or without OGT, okay. Yeah. Best test was asked. Blood GH level, okay. ठीक है, चलिए नेक्स्ट वन. ये तो क्लियर था. आई थिंक फीमेल विथ हाइपर पिगमेंटेशन, फीमेल पर्सन विथ हाइपर पिगमेंटेशन था. एडिसन्स.
So I think mechanism of hyperpigmentation was asked. It is due to ACTH or cortisol. So I think it was because of ACTH.
Yes, sir. ACTH.
ACTH, yeah.
ACTH stimulates melanocytes.
Okay, hyperpigmentation in addition, which is due, the hyperpigmentation is due to. Okay, chali.
Okay. So
Okay,
we
done.
move to the next one.
Yeah, sodium correction, osmotic disequilibrium syndrome. I think MRI was the answer.
Yeah, MRI
Osmotic.
was the answer for pontine melanolysis. That's the investigation of choice.
One more question from Edison's. क्या था? वन मोर क्वेश्चन फ्रॉम एडिसन्स. हाइपोनेट्रीमिया. ओके, ये तो इसमें कोई डाउट नहीं है, ये तो एमआरआई है. इसमें ऑप्शंस देखेंगे बाद में. वन मोर क्वेश्चन इन एडिसन्स वाज व्हाट वर द फाइंडिंग एक्सेप्ट लिखा था. क्या है? हाइपोनेट्रीमिया, हाइपरकलीमिया. थर्ड वाज मेटाबॉलिक एसिडोसिस. ओके. Yes, confirmatory test was GH suppression, Dr. Abhishek. हाँ ना, वो करेक्ट वही था. इसमें क्या थोड़ा सा रिकॉल करिए. एडिसन्स में व्हाट वाज इट? फाइंडिंग था, एक्सेप्शन था. एडिसन्स में व्हाट वाज द क्वेश्चन? देयर वाज hyponatremia, hyperkalemia.
Findings were given and diagnosis was asked. So I think these are all the manifestations of Addison's.
Yes, sir.
ठीक है. Yeah. So that means कि options were the question and answer was Addison's.
ओके, ठीक है. और एक और रूमेट का क्वेश्चन और एक था कि एंटी-सीसीपी विथ जॉइंट पेन. ओके, सो डायग्नोसिस में उनका डाउट था एडिसन्स वर्सेस कॉन्स. ओके, चलो. ओके, व्हाट विल बी सीन? ओके, फीमेल, व्हाट विल बी सीन? पेनिस फॉर्मेशन.
Other option was osteophytes, crystals, joint widening with penis. Okay. ठीक. So I think this is straightforward on rheumatoid arthritis.
एक तो पैथोलॉजी क्वेश्चन था हिस्टो, वो तो अलग था ना क्वेश्चन, हिस्टोपैथोलॉजी फाइंडिंग्स
I think that will must be separate.
सेपरेट था, पैनेस
Separate.
ऑस्टियोफाइट अलग था। चल बच्चे सब मिक्स कर रहे हैं, कोई बात नहीं। साइनोवियल इन्वॉल्वमेंट, साइनोवियल हाइपरट्रॉफी, तो अर्ली फाइंडिंग पूछा था। अर्ली फाइंडिंग देयर विल बी साइनोवियल हाइपरट्रॉफी इज द फर्स्ट वन, मतलब प्राइमरी साइट यही होना चाहिए अगर दिया होगा तो। ओके What IV fluid causes metabolic acidosis in large volume?
So the options are, I think, dextrose, RL, normal saline, dextrose with normal saline, fluid causing metabolic acidosis.
ठीक है, तो वो करेक्ट ही है। तो साइनोवियल इन्फ्लेमेशन, पैनस फॉर्मेशन वाज देयर, दैट इज ओके। मेटाबॉलिक एसिडोसिस में
One MCQ on gloves and stocking neuropathy.
अच्छा, डेक्सट्रोज के दो डिफरेंट परसेंट है, 5%, 10% शायद दिया हुआ था। ओके हाँ,
ठीक है, still the
डेक्सट्रोज 10।
answer will be saline, normal saline.
Okay, so answer normal saline. Okay, we'll come to respiratory because वो ABG questions इनको याद है। What causes hypochloremic acidosis? Okay, normal saline answer, तो we'll stick to that. ABG के questions दो आए थे, एक तो NN गैप था आई थिंक। चलो लिखते जाता हूँ, डायबिटिक न्यूरोपैथी, क्या था ये क्वेश्चन? DM पेशेंट विथ रिफ्लेक्स ए रिफ्लेक्सिया। नहीं, क्या था? डिस्टल ग्लव एंड स्टॉकिंग। चलो विल कम बैक टू दैट ना। राहुल कुछ मिला तो बताना, और तो ठीक है, दैट ग्लव एंड स्टॉकिंग पैटर्न विल कम टू। तो ये बस बताते जाना कि क्या था एबीजी क्वेश्चन, इसमें जस्ट यू हैव टू कैलकुलेट एनआईएन गैप वाज द क्वेश्चन।
So they are giving it as anion gap 30 or acute metabolic acidosis. I think both were different questions, sir. One question, most of the people are saying that anion gap was 30, high anion gap.
Chronic respiratory acidosis with 30 anion gap.
Both are different questions, sir, because respiratory acidosis and anion gap may be different. And metabolic acidosis with 30 anion gap.
Okay, but इसमें भी अच्छा, the figures were given, was it?
Yeah, yes, sir. I think that might be the question, sir. They must have given some metabolic acidosis with minus base excess, and they must have asked to calculate anion gap. Maybe it was in high anion gap. It was metabolic acidosis with high anion gap. On calculation, anion gap was 30. And another question was straightforward respiratory acidosis. One question was there on respiratory acidosis.
Yeah. This was 30. And there was another question of ABG with respiratory acidosis.
Acidosis. So one is hagma and other must be respiratory acidosis.
The chronic respiratory acidosis.
Acidosis. Okay. Many direct questions from respiratory medicine apart from ABG. Students, one question sir has already given. Any others on pneumonia or asthma, COPD? From asthma, I got one question, sir. And they asked on tuberculosis, rifampicin resistant TB, what is the treatment? What was the option? Now it is BPAL-M regimen, rifampicin resistant TB. In our country, it is BPAL-M regimen. BPAL-M regimen. And in asthma, they have asked anti-IL-5 receptor blockers, sir.
Benralizumab.
Benralizumab.
That they covered in pharma. Yeah.
Yes, sir. And one question was there, bronchoalveolar lavage was showing septate with acute angle branching. So that is aspergillosis. That must have been covered in microbiology. Aspergillus, microbiological diagnosis in bronchoalveolar lavage.
सार्कोइडोसिस का क्या था ऑप्शन था सार्कोइडोसिस क्वेश्चन मिलियरी टीबी माइक्रोबायोलॉजी कवर्ड ठीक है इसको तो माइक्रोबायोलॉजी विल कीप इट अवे
यस सर
दैट फार्माकोलॉजी कवर्ड ओके so what was asthma with nighttime events increasing nocturnal asthma asthma was increasing
patient is on SABA and still patient SABA and SAMA. Nighttime episodes were seen. What is next treatment? Most probably patient. Okay, was the question. I think it is old guidelines SABA and SAMA again. Now it is low dose inhaled corticosteroid with LABA, that is formoterol. Because if patient takes steroid, maybe those nighttime symptoms, the inflammation might be controlled. So any question, if they give SABA, now it is not SABA, it is combination. Low dose inhaled corticosteroid with formoterol. That might be the answer, sir. Okay. So was there that in the option, students? Yes, add
so
LABA and ICS. Yes, ICS with LABA combination. Yes, now it is ICS with LABA for all practical purposes. And that LABA is formoterol. Okay, ICS with formoterol. Okay, sir, this was given, sir. ICS with formoterol was given in the option. So that might be the right answer. Pulmonary embolism, again, they have a CTPA. One question, it seems, sir. I don't know whether it was covered in radiology or not. One student has put this pulmonary embolism, CTPA question.
Okay.
So we got two ABG questions, one question on TB, two questions on asthma, and one pulmonary embolism question. And in TB, miliary was asked. Miliary was asked. One question, I think. Miliary TB. Okay. Yes, sir. I think those are the questions. D-dimer was also asked. Okay.
So rest एक और क्या था GIT liver questions ARDS with less than 100 p-pen tidal volume.
Okay, low tidal volume was low tidal volume given and high PEEP to moderate to high PEEP should be there in that patient. Okay, they are mentioning that patient was unstable, so appropriate diagnosis was asked. Was 2D echo there in the option, Dr. Dhruv Pandya? Because if unstable patient, it will be difficult to shift to CTPA. So if 2D echo is showing right ventricular hypokinesia, that McConnell sign or increased pressures in the right ventricle, you can consider and go for thrombolysis if patient is unstable. Okay, 2D echo was not there.
Okay, rifampicin resistant में miliary TB was given.
Okay.
Okay, no echocardiography.
No echo.
ARDS with less than 100 PEEP and tidal volume, what should you set? So was option high PEEP with low tidal volume?
If it is there, that will be options answer, I suppose. Okay, ARDS with, okay, that comes under severe ARDS. Tidal volume will be the same. PEEP you can increase.
Okay, any nephrology, GIT, liver questions? Nephro, liver, GIT.
GIT, one topic they have given, PBC, primary biliary cirrhosis. So, can anyone recall what was the question? Was it diagnosis based or treatment based or antibodies? Okay, PBC was diagnosis was asked. AMA antibody, straightforward question. Female AMA positive diagnosis was asked. All right. So that's straightforward stat question.
और क्या था ANA positive malar rash?
That must be a separate question.
Okay, in the history, ANA was negative. In history of ANA was negative. Okay, no SLE question. No, sir, it's an option. Okay. Okay, go on, go on. Any more questions from GI? Liver, hepatitis, chronic hepatitis, inflammatory bowel disease. So Dr. Rohit covered, RA covered. Thiazide question. So if you can recall.
I think CNS right-sided weakness we have already discussed.
Yes.
Neuro low. Okay, so there was a question HIV with TB. So ART followed by ATT, ATT followed by ART was that was the some separate question.
What was asked in Sjogren's syndrome? Lymphocytic infiltration of gland. Mechanism of thiazide stone.
I think that must have been discussed in pharma. Thiazide causing stone, mechanism of action.
Okay, that was discussed in pharma already. So please go on. Celiac dermatitis herpetiformis also that done in derma. So please go on. PSVT treatment is done. Okay, go on. All done. Okay. Sicca most dreaded complication was asked. Okay, yes, SCL 70 done, additions done.
I think most of the questions we have done, and I think we'll wait for further correct recalls in the Telegram group channel.
Yes, yes.
Yeah.
Okay.
Perfect.
Sir, I think we should stop the meeting. Then we can, next person can take over. Next department. Yes. Okay. Chalo, we'll get back with more clear recall and correct questions as and when we get them. Okay.
Okay, sir. Thank you, sir. Good night, sir.
Okay, so hello everyone. I hope I'm audible and visible. Can I get a quick thumbs up from all of you if my audio video is all going smooth? Let me check. Let me also check if I am visible. Yes, so I think I'm all audible and visible. So good evening, all my dear students, and welcome in this dermatology recall session. So first of all, congratulations to all of you that your exam got over. After a long delay, and after all these date change, at least now we are standing at a place where we can say that yes, it is all done. Whatever is the result, don't worry about it now, because we have given our best to it and it is over. Okay, so I think that is something which everybody want, that a very quick decision. Yes, I can understand that you want it quick so that we can discuss all the other subject also. So without wasting time, I'm starting with the first question, and this was the first question. Now please remember, bacho, they are all recall questions, so the image can be different, the question may be different. So I'm very sorry about that if I'm not able to get the exact image, because they're all recall, and I've just asking the students and asking them to share the question. So this was the first question which I got from the student. The question was, a patient presents with a plaque on the face with central clearing and the atrophy as shown. The chest x-ray reveal apical calcification. What is the next step to confirm the diagnosis? I think this is a very simple question. If you see the image also, you can see the atrophy at one part, you can see clearing at the other part. This is very classical of lupus vulgaris, bacho. Now in this question, a lot of students, they got confused and they marked Montague's test as the next test to confirm. Please remember, we do not use Montague's test to confirm. Ideally, the best answer should be skin biopsy, but that is not given in that question. Okay, if skin biopsy or histopathological examination would be one of the option, I would have gone and marked that option, but that is not given, and that is why my next best possibility or the option will be PCR for this question. So the answer should be option number 4, bacho. So that is the first question we got. I think this is easy for all of you. Yes. So this is the question, which is the lupus vulgaris, which is the cutaneous tuberculosis. And the next step which I would like to do in this patient will definitely, to confirm the diagnosis, the appropriate test should be the PCR test. Coming to the next question, again, I think this is something which is very interesting and easy for all of us. A woman who presents with pruritic rash on the elbow, buttock with recent diagnosis of gluten sensitive enteropathy, or some student said that celiac disease was given, some student have told that celiac sprue was given, but something they have given in the question to make it very clear and easy for us to understand that this is definitely a question of dermatitis herpetiformis. And the question says that IgA deposition on the tip of the dermal papilla. What is this appearance known as? If anybody can tell me. This is very classical picket fence appearance, which is seen because of deposition of IgA on the tip of dermal papilla in the patient of dermatitis herpetiformis. So bacho, in this question, if you will ask me what is the correct answer, I will mark the answer as option number 1, dermatitis herpetiformis. That is the correct answer. Very easy question, I guess. Okay, so yes, the previous question was not easy, but I think the concept or the topic, it is from the PYT. I think this is again something which was frequently asked, and this was asked this time also. Coming to the next question, this was again a little confusing question, and I'm getting the mixed opinions about the options, about the question. A hypopigmented patch on the face of a newborn. Bacho, something which you have to understand here is they're writing that the patient is a newborn, means it is not someone who has acquired the disease, and that is why anything which is acquired should not be the answer here. Now there is a white which is white on the wood lamp. Some people say that it was written dull white. So dull white on wood lamp, diascopy was inconclusive or diascopy was negative. What is the diagnosis here? Please remember, bacho, if this is the question, the answer should be nevus depigmentosus. Now, why not vitiligo? Some students have told me that vitiligo may you told ma'am that it is white in color. Yes, first of all, it is ivory white, means the white becomes more prominent in vitiligo. Second, in a newborn, vitiligo is usually not present because vitiligo is an acquired autoimmune condition which usually present after some time. So if it is a newborn, then it should be nevus depigmentosus. Why it is not nevus anemicus? Because nevus anemicus also present with white patch or hypopigmented patch on a newborn. It is because of the finding of diascopy. I'm saying that this is not nevus anemicus. So the correct answer will be the nevus depigmentosus. Even if it is not face, now some students are saying that ma'am यहाँ पर face नहीं था. Even if the face is not given, if they have given trunk, the answer will remain same. It is nevus depigmentosus. And actually speaking, the nevus depigmentosus is very common on the trunk, like chest and the back. So if it is trunk, it is more in favor of nevus depigmentosus then. So I think this question is again a very easy question. Nothing for us to think about it. So it is present since birth. Yes, if it is not newborn, chalo theek hai, I'll take it that it is not newborn, but a student told me that it was written that it is present since birth. If it is since birth also, then again it is same thing. It cannot be vitiligo. Vitiligo cannot occur since birth. So I hope that is clear, bacho. So if it is not newborn, even if it is since birth written here, the answer will remain same. It is nevus depigmentosus. It is chalky white that was given. Again, I will say that it is nevus depigmentosus only. Coming to the next question, a patient presented with, now here I don't know what exactly was the question, but that is what I got from my student, that a patient present with the swelling over the foot, multiple discharging sinus and black granule. Now, bacho, please remember, if such triad is given, swelling, tumor, discharging sinus, and the color of grain is black in color, this is very classical of which condition? Mycetoma. And because they are writing the granules are black, I will mark this condition as a patient of eumycetoma. You all know that eumycetoma is because of fungus. And if it is because of fungus, remember, bacho, what will you see when you do a KOH mount? You will see septate hyphae. Now, I have no idea what exactly they have given, whether they have given a picture or not. So students are saying that yes, ma'am, there was a picture given. Again, even if the picture is attached, it is more easier for us because this classical triad is very, very classical of the mycetoma with black color granule, which is a fungal mycetoma. And if these were the option, I don't know what exactly was asked, but if they are asking you the KOH finding, this should be the better option among these four. So okay, so diagnosis of mycetoma was already made. The options were wrong. Okay, so that is possible. If the options, because I don't know what were the options given to you. If they are asking you the KOH mount, then septate hyphae should be the better answer because eumycetoma is because of the fungus. They have given a picture. So here I think a picture is missing. So, okay. Okay, so septate hyphae will be the correct answer. Great, great. This is the next question. A patient with oral lesions with symptoms worsening on the spicy food. What is the trigger? Please remember, bacho, I am not sure of the exact image, but if you see that image, you can see a violaceous. Student told me that a clear-cut violaceous oral mucosal lesion was visible, and they have given that the symptoms were getting worsen up on eating the spicy food. Okay. Eating the spicy food burning sensation, and a violaceous plaque, very characteristic of lichen planus. Now, what are the drugs which trigger lichen planus? If you remember, we have discussed the drugs like thiazide diuretics, like antimalarials, like antihypertensive, beta blocker. They are all the triggers. So accordingly, this should be the answer. If the options are these four, then according to me, the beta blocker becomes the correct answer. Okay. So yes, so if it is bluish black also, please remember bluish is or purplish is a very classical, bluish black purple color is very classical of lichen planus. So I think the answer, they want you to diagnose this as a oral lichen planus patient, and in oral lichen planus the trigger is the drug which is a trigger is beta blocker. So the answer should be option number 2. Next question is, a patient presented with history of freckle, marked photosensitivity, basal cell carcinoma, and there is an exacerbation of the lesion by sun exposure. See, please remember, there are some xenodermatosis which, like xenodermatosis are those conditions where because of some gene defect, patient develops the skin lesions. One of them which presents with freckling on the face, photosensitivity, and more risk of skin cancers, that is a condition known as xeroderma pigmentosa. Xeroderma pigmentosa is बच्चों nucleotide excision repair defect. See, I'll tell you what happen is, whenever you are exposed to sunlight, there is some defects which happens in the DNA of the keratinocytes. But in our body, we have some reparative mechanism. One of the reparative mechanism is nucleotide excision repair. When this repair mechanism is defective, these defects will keep collecting. This nucleotide excision repair defects will keep collecting. They will not get improved, and the patient develops photosensitivity. The correct answer of this should be option number 2, that is nucleotide excision repair. Students are saying that, ma'am, 2 basal cell carcinomas were given in the question. Yes, so I think this was the answer. I think whether they have given 2 or 3, even they can develop squamous cell carcinoma, they can even develop malignant melanoma. Still the answer remains same because the diagnosis is xeroderma pigmentosa. Coming to the next question, an adult patient with painful vesicular lesions in the mouth, Zangsmere show multinucleated giant cell. This question they have directly taken from the FMGE and they have given it to you. And we have also discussed multiple times. Please remember, multinucleated giant cell plus painful grouped vesicles, very, very classical feature of herpes simplex. If it is oral cavity, then it is herpes simplex virus 1. If it is genital, then it is herpes simplex virus 2. So for this question, I think the correct answer should be option number 4. Painful vesicle, Zangsmere, don't get confused. It cannot be, the answer should be herpes simplex virus. Okay? Next, a patient presented with following feature. Now, I didn't get any exact question, but everybody was saying that there was a question from the phrynoderma. I hope this was the question. Only 2 options which I got. If this was the image given, this is a patient of phrynoderma, which can be because of vitamin A, which can be because of essential fatty acid deficiency, bachon. So I don't know what was the other option given. The correct answer for this particular, if they have given vitamin A as the option, that becomes the correct answer. If they have given essential fatty acid, then that becomes the answer, because here the diagnosis is phrynoderma. Okay, phrynoderma. Do we had any, or was there any question related to okay, ocular examination? They have asked what should be the next thing to do. If they're asking you in this patient, what is the next thing you have to do? Yes, obviously phrynoderma, rule out the possibility of vitamin A deficiency, and in that case you have to do the ocular examination. Okay. Okay. So I think if they have asked what should be done next, the answer should be ocular examination, because in a patient of vitamin A deficiency, you get xerophthalmia, there is conjunctival xerosis, there is bitot spot, patient complains of delayed dark adaptation as well as night blindness. So, chalo. So I think that these are some of the questions, and if I ask, somebody was asking how many questions, so I got 9 questions from dermatology, 9 or 8 questions from dermatology. I don't know whether we have any more questions or not. Some students are saying, ma'am, HSV wala question nahi tha, there was no question of herpes simplex virus ka. Okay, So if there is no question of multinucleated giant cell, then I don't know what was the exact question which we got. Oral ulcer with lymphadenopathy was given. Zinc smear was not given. Anyways, see, if these are all recall questions, if you know the question, please put it on the chat section so that I can just frame the question and I can give you the correct or almost relatable question in the exam. Okay, or in the tomorrow's dermatology discussion. So, chalo. Okay, so thank you all of you, and in the tomorrow's dermatology discussion. So, chalo. Okay, so thank you all of you. And have a nice day. Take rest, go to sleep. Bye bye.
Good evening, doctors.
So, chalo. Okay, so thank you all of you.
Good evening, doctors. Can you hear me? Guys, please do let me know.
Have a nice day. Take rest, go to sleep. Bye bye.
Good evening, doctors.
So, chalo. Okay, so thank you all of you.
Good evening, doctors. Can you hear me? Guys, please do let me know.
Have a nice day. Take rest, go to sleep. Bye bye.
Good evening, doctors.
So, chalo. Okay, so thank you all of you.
Good evening, doctors. Can you hear me? Guys, please do let me
Have a nice day. Take rest, go to sleep. Bye bye.
Good evening, doctors.
So, chalo. Okay, so thank
Yeah. Guys, all right, people. Let's have a quick recap of physio questions and then
Yes, sir.
Sir, I think ma'am voice is still getting heard, sir. Should I continue or what?
You can continue, sir. Continue.
Sure.
Now, okay.
No, okay. All right, sir. Yeah. Guys, I'm really sorry that there was some technical glitch. Anyway, I'll try to make it as quick as possible. We'll finish these sessions, people. Good. Now, let's move on to the very first question. Yeah, we have a question here. Yeah. Anyway, people, I'm sorry that we have some technical glitches. Let me not make much time. You guys must be very tight, so let's finish this as quick as possible. So we have the first question, which speaks about a patient with certain clinical history. Given the diagnosis is pulmonary embolism, you are supposed to identify the correct point of V/Q ratio in the given picture. Now here it's a question about pulmonary embolism, and when it comes to the correct point on this picture, it's going to be option D. So that's I hope you guys must be clear, and since it has already been done, there is no point in repeating that over and over again. So let's move to the second question. Hormonal levels in day 21 of menstrual cycle. It's going to be day 21 of menstrual cycle, guys. So by the 21st day, it would have been 6 days post ovulation or 7 days post ovulation. So the level of FSH and LH will be very low, and FSH LH will be very low, and estrogen and progesterone level will be slightly high. So the right answer for this question is going to be option C. There is going to be low FSH and LH. It's going to be day 21, and Going to the third question, across a capillary there is no fluid movement, pressure values are given below. Fine. Capillary hydrostatic pressure is 25 millimeters of mercury, and the right answer for the question, I hope you guys could able to pick up. Capillary hydrostatic pressure, it is going to be 25, and interstitial fluid hydrostatic pressure is going to be 23. Interstitial fluid oncotic pressure is going to be 0. Capillary oncotic pressure is going to be +2. So here the right answer is going to be +2 here. So I hope this question also would have been done already, and that's been done. Mr. Dr. Rocky, I'm not wasting time. I'm sorry, I've been asked to do this, so let's finish this point. In prolactinoma, the action of prolactin in causing amenorrhea, the right answer for this question is going to be, down regulation of, gonadotrophin releasing hormone. Sorry for this one. It's going to be decreasing gonadotrophin releasing hormone, and that's the right answer for this question. Moving on to patient presents with right-sided muscle weakness. Absent ankle jerk, where would be the lesion at? Since it's been already done, you guys must be aware of this. I don't know whether the question would have been asked about stock and glove sensory neuropathy, history of diabetes, whatever it is, guys. The right answer for this question is going to be, I'm not very sure about the option D, but still, right answer for the option D is going to be peripheral nerves. The damage must either be to peripheral nerves, or the damage at least must have been done to dorsal root ganglia. So either of these two words must be seen in your option, and whatever your option is, if you could able to recall, please do let me know as well. So it's going to be either peripheral nerve or dorsal root ganglion. Either one of this would be the right answer for the question, guys. Moving on to amiodarone, and acting on which phase of cardiac myocyte action potential? It's obvious, it's going to be phase 3 of cardiac myocyte action potential. Surgeon, if you could able to recollect the question and let me know, it would be of great help. So I'd appreciate your effort, doctor. Thank you very much. Identify the marked segment in the given picture. It's going to be the optimal length. So A is the right answer for this question. It's going to be optimal length, where the tension generation is going to be maximum. Shivakumar, right corticospinal tract at anterior horn. All right. If it is right corticospinal tract at anterior horn, there is a small point you got to be clear about. If it is going to be corticospinal tract, still it will be considered as upper motor neuron lesion, and the reflex will be exaggerated. So the absent ankle reflex is very clear that this cannot be an upper motor neuron lesion. This has to be a lower motor neuron lesion. So when it comes to the reflex arc, dorsal root ganglion is the point where the pseudo-unipolar neuron that receives the afferents from muscle spindle is located. So either the damage has to be dorsal root ganglion or some peripheral nerves, and if not, it's going to be, as you guys were saying, anterior gray horn, which is a clear-cut area where there is going to be location of lower motor neuron cell bodies are located. So anterior gray horn would be the best answer if that has been given. Alright, posterior limb of ventral capsule, no way. Still it is going to be upper motor neuron lesion. So the question of -2 and +2 is going to be a little bit of confusing. All right, so fine, people just be very clear here. Your question is asking about a movement of fluid across a capillary into the interstitial space, and one point is very clear, that there is no fluid movement. That is all. All right, that's point number 1. There is no fluid movement. And when it comes to the movement of fluid, it is governed by 2 sets of factors. Number 1, forces that favors filtration. Number 2, it is going to be forces that opposes filtration. When it comes to forces that favors filtration, you do have these forces, that is capillary hydrostatic pressure and interstitial fluid oncotic pressure. So hydrostatic pressure pushes the fluid out of the vessel. Oncotic pressure in the interstitial space pulls the fluid out of the vessel. So the net value is going to be 25 plus 0, 25. The forces that opposes filtration, that's going to be interstitial fluid hydrostatic pressure with the value of 23. And the question is about what is capillary oncotic pressure. What should be the capillary oncotic pressure? That should stop the fluid from moving out of the capillary. So if there is no movement seen, the forces on both sides has to be equal. So the forces favoring filtration also 25, opposing filtration also 25. So hydrostatic pressure plus oncotic pressure, 25 plus 0, it is going to be 25. You have 23 interstitial fluid hydrostatic pressure. What should be the capillary oncotic pressure? It should get the value to 25. So it's going to be 23 plus 2. It's going to be plus 2, guys. That is the right answer for this question. It is plus 2. And corticospinal tract and anterior spinal level, anterior horn cell is the answer. Perfect. So we covered that question as well. Anterior gray horn is the right answer. What type of neuropathy will DM have? Distal symmetrical glove and stalking type? Something else. All right. This is very perfect. Distal symmetrical glove and stalking type is the right answer for that question, guys. Anterior horn cell. Interstitial hydrostatic pressure was asked. Yeah, that was the other kind of question, guys. Some students were saying whether, the question was asked about capillary oncotic pressure. Some students were saying whether question is about interstitial fluid oncotic pressure. Whatever the question is, this is the way you got to calculate the answer. And if you could able to substitute factors favoring filtration and factors opposing filtration, whatever the question is, you could able to get the answer, guys. So let's keep moving on. Something that's already been done. So let's not waste time over and over again. Now this is a question you got to be pretty sure about. Which hormone is responsible for hyperpigmentation in Addison's disease? Guys, if your question included this one option, alpha melanocyte stimulating hormone, the answer has to be alpha melanocyte stimulating hormone. There is no second out. If the option do not involve alpha melanocyte stimulating hormone and the next best choice is going to be ACTH, that's very clear, guys. All right, fine. So anterior gray lesion in spinal cord, you're still there. Fine. Let's keep moving on. If the question is about hormone responsible for hyperpigmentation in Addison's disease, two choices has to be considered. Choice number one is going to be the best answer is alpha MSH. If it is given, go for it. If it is not given, go for ACTH. That is how you got to pick up. Tejas, all right, ACTH. Are you having this one choice? Did you saw alpha melanocyte stimulating hormone in the option? Yes or no, guys? Did you saw alpha MSH? No. If there is no alpha MSH, then answer is going to be ACTH. Perfect. Good. If you don't see alpha MSH, then answer is ACTH, guys. No doubt about it. Yeah. And moving on to clinical history, patient who underwent ileal surgery, it's obviously going to be B12 deficiency. And with B12 deficiency, there is going to be subacute combined cord degeneration, and that's the answer. I think this also would be clear. No aldosterone was no Rohan. This has got nothing to do with aldosterone. This is clearly two choices. It has to be the best choice. Alpha melanocyte stimulating hormone. Second best choice, it is going to be adenocorticotrophic hormone. Just two words. That is all. That is two words. If you don't see alpha MSH, then the answer is ACTH. Plain and simple. Plain and simple. The last question. Subject reaches high altitude suddenly. What changes would be expected? And the answer is going to be hypoxia induced rise in cerebral blood flow. That is all, guys. That is all. Megaloblastic anemia. Yes. Megaloblastic anemia also because of B12 deficiency. If you have megaloblastic anemia, well and good. And I don't think both words would be given as an answer. All right. Either the question must be speaking about megaloblastic anemia or it has to be subacute combined cord degeneration. If whatever option was given, you got to go for that because ileal surgery will be compromising B12 absorption. Now, most of you were confused about +2 or -2. Guys, let me finish with that one question. Let's be clear in this one option. Now, whatever the question is, whatever the options are, you just got to be clear with one way. Number one, forces favoring filtration, you cluster it into one side. Forces opposing filtration, you cluster it into other side. Now, what are the forces that favors filtration? You have capillary hydrostatic pressure, number one. Number two, interstitial fluid oncotic pressure, number two. These two forces favor filtration, so you added. Number two, forces opposing filtration. What are they? Interstitial fluid hydrostatic pressure, 23. Capillary oncotic pressure, +2. So you add these two forces, 23 + 2, it is going to be 25. So favoring filtration 25, opposing filtration 25, both the forces becomes equal. As a consequence, there will be no net fluid movement. Plain and simple. All right. So if you don't see net fluid movement, it means that the forces favoring filtration and opposing filtration are one and the same. If you are adding this force that opposes filtration, you cannot have -2 because 23 - 2 will become 21. If the net force becomes 21, there will be a fluid movement. All right. So we differ in the answer because of one reason, that we have got two different sets of values from our students. That's the only reason, guys. But this is the way you got to solve the question. I hope you would have had the better experience because you have solved the question right in the exam. We are just getting the question and repeating it to you. So whichever way you could able to solve the question with this one formula. This could be done, guys. All right. So values have got an exchange. Exactly, Tejas value have got an exchange. All right, fine. Interstitial was 27. Maybe if interstitial happens to be 27, yeah, then it must be -2. This could have been the answer. I repeat this. If the interstitial pressure was given as 27, then you could have got -2 as the answer. If it is given as 23, then +2 would be answer. So be clear, 23 + 2, 27 -2. So depending on the word, you will go for either +2 or -2, guys. Good. And Murli, sir, option had cerebral vasodilatation, vasoconstriction in high altitude. All right. The answer is cerebral vasodilatation, Murli. The pulmonary vasculature will go for constriction. There will be pulmonary vasoconstriction. If it is cerebral vessels, it would go for dilatation. All right. So that's the difference between pulmonary vessels and cerebral vessels. If the question is clearly cerebral, then there would be cerebral vasodilatation. Good. And if there is a cerebral vasodilatation, you will expect an increase in cerebral blood flow. That is all. Good. So they ask interstitial pressure. Anyway, guys. Anyway, so this is the way the question has to be solved, and that completes physiology. Let's not take much of the time for other faculty. So I'll close the session now, and the other faculty will be bringing up the next session, guys. So that's the end. Thank you very much, people.
All right, so hi friends. All right, so hi friends, this is Dr. Kashish and Dr. Siddharth here. Dr. Siddharth, is it audible? Is it audible? All right, so friends, we are now discussing. Okay, so video and audio is fine. Guys, we are now discussing the questions, NEET PG recall, right? So guys, in this, what we are doing is, me and Dr. Siddharth, we both are here. Me and Dr. Siddharth, we both are here. So guys, in this, the question was there. There was one question. So Dr. Siddharth is here. Hello, Dr. Siddharth. Hello.
Kashish, hi, good evening. Can you hear me?
Yeah, audible, totally audible.
Yes. I'm just asking permission for sharing the screen. Just a second, please. Yes, I think the screen is visible now.
Yes, visible.
Okay, chalo, let's start.
Okay, first question to you.
Okay, so guys, the first question was a very good question from epidemiology. They have actually put up two group over here where they were saying that one group will get a PHC care and one will get a interventional care. So it is a interventional study. So इसमें case control cross sectional का कोई scene नहीं था. So the confusion was between two options, quasi and cluster. Now, why is it as a cluster? Because they are talking about the entire unit, जैसे गांव, the entire village was being taken. So it becomes a cluster randomized over here. Second question, Dr. Kashish.
Now, so guys, in this question, what they are asking is, in this question, they are telling you that there is a mother where the viral load is more than 1,000. So guys, whenever there is the viral load is more than 1,000, it is a high risk case. Whenever there is a high risk case, either we go for whenever there is a high risk case, we go for zidovudine plus nevirapine. So two drugs are given in case of high risk. Now, it depends upon the duration. If exclusive breastfeeding, either you can go for exclusive breastfeeding or exclusive replacement feeding. So if exclusive breastfeeding, then zidovudine and nevirapine for 12 weeks. And if exclusive replacement feeding, then zidovudine and nevirapine for 6 weeks. So if this was the option, zidovudine plus nevirapine for 12 weeks plus exclusive breastfeeding, this is the best answer here.
Going to the next question. In Chittor district of Andhra Pradesh, a person was found to have a knee deformity involving outward deviation of both the knees. He was found to have osteoporosis. Which of the following intervention will not be helpful for him? Now see, technically we know with fluoride we see osteosclerosis most commonly, but porosis can also be seen. But more than that, this was just a common sense based question. Changing the water source, yes, we do advise for that. Fluoride supplementation, no, because यहाँ पे Andhra Pradesh, Telangana, it is always associated with Nalgonda. You are talking about excessive fluoride, so बिल्कुल भी fluoride supplementation नहीं करना है. Next question.
So guys, in this question, they're asking about what to do for the defluoridation. Guys, for Nalgonda technique, two things are added, lime and alum. Two things are added, lime and alum, right? So the best answer here is lime and alum. For Nalgonda technique, this is for defluoridation, lime and alum is added. Next question.
Now, this was a bread butter question. Comparing the mean between two different groups, they were independent. Name the test. It was an unpaired t-test. So because I had mentioned the mean, you would not think of a chi-square. Because it was two groups, you do not think of an ANOVA. Because it was independent group, it was unpaired. Next question, Dr. Kashish.
Now, guys, in this question, they're asking about, they have given you one population. So 70 lakh population is given, and they are telling you that 30% belongs to the urban area, urban slum area. So how many UPHC? So guys, for every 50,000 population, there is one UPHC. So calculating 30% of the total population, on the basis of that, we can go for one UPHC for every 10,000 one UPHC for every 10,000 population. Here the best answer after calculation will be 42%.
ये वैसे Dr. Kashish was probably one of the अच्छा वाला question where probably they had to use calculators.
This is one question which we always talk about. They will not directly ask now, tell the population of UPHC. This is like they want to, and this is analytical question, what I feel. Totally analytical question. A simple fact is being asked to just to test the analytical mind.
Exactly. Next question. It was not an image-based question, but we have seen this in DVT also. No siphon tube. If you remember, I always put my hand like this and water surface and I say Anopheles ka maximum water surface. Yes. So it is a larva lying parallel to the surface. It was Anopheles. Next question.
Guys, in this question, so many versions of this question are coming, but what we came to know is that there was a person who died within 7 days of hospital. So here the death happened in hospital. So guys, whenever we collect a data from the hospital, this is basically passive surveillance. Active is when we go house to house, and sentinel is when we do it for missed cases in the sentinel sites. Now, one option, syndromic surveillance, many students were talking about. I don't think syndromic surveillance fit here. The best answer here is passive surveillance.
Okay. Recommended cholesterol level to prevent coronary artery disease is 100 per 1000 kilocalorie. It was a fact. And if you remember, we always say कि boss, in case of coronary artery disease, पूरा अंडा येलो के साथ मत देना क्योंकि उसमें 250 milligrams of cholesterol हो जाता है. So we always say कि it's better to remove it and to ensure that the lowest cholesterol level. So even if you did not know the answer, by looking into the option, you would set minimum cholesterol. So option 1 would have been selected even if you did not know the guideline. Next question.
Guys, this is something which in my B2B class and my face-to-face class, the same example we discussed. There is one lady, right? And the breast cancer case was there here probably. So what is happening? This is a clear-cut case of lead time bias. Lead time bias says there is a false perception of prolonged survival because of screening. So right, so here the correct answer is lead time bias.
Now, VVM standard question that they had given some images. You know that if the inner square is lighter than the outer circle, we use it. So जो भी आपका combination दिया था, you should have been able to select the code. So whatever is the image, the answer would be according to that. Next question.
Guys, census, there are two methods to conduct a census. Number one is de jure. De jure method says, suppose a person from Bihar or suppose a person from Haryana came to Delhi for some work, right? He is studying over there. Now the census is happening. That person who belongs to Haryana, right now at the time of census, he is in Delhi, right? He is in Delhi. So that person is calculated. So de jure means as per rule. So that person residence is of Haryana. Now that person is in Delhi. So while census, that person will be calculated in Haryana. This is de jure. Now de facto means where the person stayed at the time of census. The person from Haryana at the time of census was in Delhi, so that person will be calculated as a part of Delhi in the census. In India we follow de jure, so here the correct answer is based on the residence. De jure and de facto, they both are different based on the residence. Next question please.
Okay, just to add a point over here, this was the only bouncer question if you ask me for students, because de facto method has been stopped in India in the year 1941. So we do not expect that itna punana cheez koi पूछे. Probably it's just a bouncer. So do not panic
completely.
even if you didn't get it. Okay, what is used to measure the degree of objective and target achievement and assess the quality of result? Now, again, there are some students, they said a bigger story was framed. So if you can tell us those words, we'll be more than happy. So basically, they're trying to evaluate that how good you have attained your objective, your targets, and ultimately how good the quality of the program has been achieved. So it was a direct definition being asked with a practical use. Next question.
Guys, a recent leak. So here the question is saying that a recent leak of factors fumes has been noted. What advice would you give? So I think this was regarding evacuate with waiting proper orders. So we are not very sure about the options. Can you please recall here? Can you please recall here?
Is guys, anyone with question 14 ka option, anyone would like to help us out? Because there was one option, evacuate without waiting for proper orders. So out of these three, we are looking into that, but actually it should have been evacuate with waiting for proper orders. So if anyone can help us with the option, we'll be more than grateful for the same.
Okay, without proper orders. Talk to a friend on phone.
वो तो कभी होगा ही नहीं.
Okay guys, we have noted your feedback here, and we are going to do tomorrow or maybe day after tomorrow. So we'll be coming back again with all the questions and with their proper options.
Okay.
Okay, thank you everyone. We have noted the options. Thank you so much.
Yeah, question 15. Arrange the following in the correct order. ये standard question है. अब NEET has made it a habit to ask a sequence. So in the randomized control trial, randomization हमेशा पहले होता है. We know it. Even if you did not know manipulation, उसके लिए मत परेशान होना. आपको पता है, in case of randomization, we have a temporality. So exposure पहले, fed disease. So there is a follow-up. And after the follow-up, once the data is there, the statistical assessment will be done. So the best sequence, if you could see, is आपको A पता है, C और D का पता है. So automatically it would be option number 2. That was ABCD. ठीक है? So randomization, manipulation, follow-up, and statistical assessment. Over to you. Next question.
Guys, this question, now what is happening here, I'll tell you. Guys, in this question, what is happening? Earlier, it was WIFs. Earlier, it was WIF, right? That time, the iron folic acid was 100 mg. After that, there came, so the part of WIFs was also giving albendazole. It was also the part of WIFs. But now the Anemia Mukt Bharat came, and in the Anemia Mukt Bharat, the dose is 60 mg. I think this is the problem, because WIFs now is a part of Anemia Mukt Bharat, and now Anemia Mukt Bharat, under Anemia Mukt Bharat, we are giving 60 mg IFA, 60 mg iron, right?
Absolutely correct, Dr. Kashish. Over here, guys, again, let us make it very clear. If you look into the guidelines of WIFs, it will show 100. It is because of older one. What sir is telling, what I have also told, it is very clear now it is 60. The guidelines are 10 years old. After that, there has been a change in it. Okay? Next question, infectivity to maximum infectiousness. If you remember exact image, we say that there are 4 definitions starting from the word exposure. So maximum infectiousness was generation time. Next question.
Now, guys, this question, there are many versions of this question coming. And whatever the version we came to know, that a 6-year-old boy is having some kind of bowing of leg, which is showing some vitamin D or calcium deficiency. So, guys, see, in this, the options, midday meal is there. In this, Anemia Mukt Bharat is there. So, first of all, the question will depend upon the age group, what the age group they have given. If the child is less than 6 years, then definitely we are going to rule midday meal, because that is for a school child. Anemia Mukt Bharat here is totally the option is ruled out, because this is for iron deficiency, and nowhere they are talking about iron deficiency. There are 6 interventions there, under which no one is about the part, right? So, first of all, I would like to confirm the age. Was it the 6-year or the elder age group? Because if it is the elder, then I'll right. So, because it is less than, so midday meal is totally ruled out, because midday meal is not only also specific for this one, right? 3 years was given. So, I think here the best answer should be ICDS. What do you say, Siddharth sir?
Yes, absolutely right. Because students have actually confirmed that less than 6 years tha. So there
Yeah,
is no
students
doubt
are
कि ये
saying in chat
ICDS
that
होगी.
it was 3 year. Students are confirming that it was 3 year.
ओके तब तो आईसीडीएस है, तब उसमें कोई भी
ICDS
डाउट
जाना
नहीं है.
चाहिए.
ठीक है, चलो ग्रेट. ओके, इन केस ऑफ एचआईवी टीबी को इन्फेक्शन हाउ विल यू ट्रीट, स्टैंडर्ड क्वेश्चन है ये. आपको कशिश सर ने भी पढ़ाया है, मैंने भी पढ़ाया है, वर्कबुक का है, डीवीटी में है, हर जगह बताया है. वी स्टार्ट विथ एंटी ट्यूबरकुलर थेरापी फर्स्ट, फॉलोड बाय एआरटी आफ्टर 2 वीक्स. अगर एआरटी पहले कर दिया तो इम्यून रिकॉन्स्टिट्यूशन सिंड्रोम होगा, टीबी की फ्लेयरिंग होगी. एज सिंपल एज दैट. So guys, were able to get 19 questions, out of which personally if you ask me, every student should have got 18 correct. ठीक है, अगर 19 में 19 है, you are done. Awesome. 18 है तो boss, you have absolutely nailed it in PSM. Yes, so do not worry, relax. अभी कम से कम 7 days, just do not think anything else. Over to you, Kashish sir.
Yes, sir, I totally agree with you. And here I just want to add something, that the question changes as per the history changes. So we will be coming with a final version of these NEET PG questions. So we will be coming tomorrow or maybe tomorrow. So I think yes, the paper was good, and the analytical part was also there. So I hope everyone did it well.
Chalo, bye bye guys. See you over to the
Bye-bye.
next teacher of the next subject. Bye bye.
Very good evening, all my students. Is audio video fine? Can you update in the chat box? Is audio video fine? Can we start with the session? So first of all yes, Dr. Reddy, good evening, very good evening. Can you update the feedback review for ENT? How was the ENT segment? There were 10 to 11 MCQs, and I feel all the questions we have covered in the classroom we have discussed in ENT segment. Yes, very good evening, everyone. Can you update? Is audio video fine? Can we start with the session? Every student should first tell me how was the ENT segment, what the feedback I'm getting from. I will share my all the screenshots where we have discussed all these topics in the class itself. We have completed all the important topics, and after this session, after this recall session of NEET, you should go on the YouTube, and 3 days back when we were doing revision program for our students, you just watch that video again. In the beginning, I highlight 1.3 mandatory topics. If you remember, on the 30th of July, when we conducted the revision session 4 days back, I highlight point epistaxis, angiofibroma, MCQ mandatory PTA, pure tone audiometry. If you watch that video, the first 1 minute, I'm telling you 3 MCQs out of 10, I'm giving you epistaxis, angiofibroma, and pure tone audiometry. And they have given all the important points on these topics. They have discussed all the important concepts on this topic. So let's discuss. Yes, the first MCQ was a slide given to you. Long history, but I cannot, in the short span, we can't recollect the whole complete history. But what the message I was getting from the student, they have given a history, the patient with a history of fall. Yes, thanks for all the compliments. Listen carefully. They have given a history of fall, history of trauma, and then they ask you, they have given you some X-ray nasal bone, lateral view, where they have shown you the fracture. So what the concept we made in the classroom, if you remember, if I want to reduce the septum, I use Ash forceps, and if I want to reduce the lateral wall, I will use Welsham forceps. Is it clear? So out of 4 options, what the message I'm getting from the student, one option was Lux forceps, that is Welsham forceps is the right answer in this MCQ. Is it clear? Is MCQ on trauma, very important topic. So Welsham forceps is for the lateral wall, Ash forceps is for the septum. Any change in the options, kindly update. Any change in the option, beta? Any change in the option, please kindly update that. So first MCQ, the answer of nasal bone fracture, it was Welsham, always reduce immediately. If edema, reduce after 5 days, and if patient coming after 3 weeks, we go for closed reduction or open reduction. After 3 weeks, open reduction. Before 3 weeks, that is closed reduction. Is it clear? Is it clear, beta? Is this concept very good? All the options same, no change expected. So 3 or 4 important concepts: septum, Ash forceps, lateral wall, Welsham, and there was one 3 weeks concept we should learn for trauma. Why I'm sharing these things? For the upcoming INICET Central Institute. Always remember this point, clear? So it is always reduce the fracture. They can show you the slide and they can ask you when you should reduce. You should reduce immediately. If edema is there, go for anti-inflammatory and reduce after 5 days. And if patient come within 3 weeks, close after 3 weeks, that is open. Simple concept. Then they have given a typical history. This MCQ taken, you can say examiner have taken from TND. I have repeated multiple times. Long history, but on histopath. If you remember, every student should update in the chat box, beta, did these words rollover phenomena, ice cone appearance, Antony word mention, go for vestibular schwannoma. Yes, so answer was vestibular schwannoma. 3 keywords, beta. ये बातें आपको एग्जाम में याद आई नहीं आई? Thumbs up in the chat box. If they mention recruitment phenomena, fluctuating deafness, menials. If they mention rollover phenomena, ice cone appearance, Antony A, Antony B, that is CP angle tumor, vestibular schwannomas covered in our classroom. We have made a nice concise table on otosclerosis, Meniere's acoustic neuroma. I will not waste much of the time, but now I'm just sharing all the important recall MCQs. Later on, we'll be coming with a detailed discussion. No worries with IceCon. I was expecting either IceCon happiness or Entry. If you remember my lines, मैंने कहा था आपको last NEET otosclerosis was MCQ. This NEET will be either Meniere or acoustic neuroma. My favorite question, if you people open my workbook of ENT where I have shown you 2 images and I ask my student in the classroom to make a treatment. If all the students who have attended my lecture, you must recollect the trauma, the perforation, history of ear discharge. In the upper part, unsafe ear. In the lower part was safe ear. Always remember this golden rule. Yes, I feel. Yes, this question direct from your workbook. If the image is given, if the trauma is in the lower part, part tensa, safe ear. That is tubotympanic. If disease in the upper part, it is atticoantral. Is it clear? MRI should be the diagnosis if examiner give you a perforation in the upper part. Is it clear? This is in the lower part. Patient is having ear discharge, hearing loss, foul smelling, and all those words which go in the favor of unsafe ear, atticoantral, were not there in the MCQ. Only image based. Therefore, we will be going more in the favor of safe ear, tubotympanic ear. So, beta, what is the treatment for tubotympanic ear? Let's rule out the choices. Atticotomy was the option. Again, we are going when the unsafe ear or ear mastoid involvement is there. Explorative tympanotomy, beta. This is done for conductive deafness. Like I can't make a diagnosis of conductive deafness on audiometry or radiology investigation. We go for explorative tympanotomy. Common sense, beta. I always say in my lecture, think like a 10th standard student. Already perforation is there. So why I will open the tympanic membrane? So this option is again is still a direct. You can rule out. This cannot be a right choice. So answer should be myringoplasty. I hope you are getting the concept. Is it clear? Question number 4. Identify the structure on the barium swallow. And if you remember in the classroom, we have discussed one lateral view of neck where I made you revise hyoid bone, thyroid, cricoid. Then we have discussed vallicula, pre-epiglottic space, and the pyriform. Always remember what is the golden rule in this MCQ. If the arrow was, I hope the MCQ was same slide, they have given you some white arrow at the lower. What the feedback I got from most of the students, arrow was on the lower part. Is it clear? Is the same image, beta? Can you confirm in the chat box? If the white arrow was in the upper part, that is here vallicula. If the arrow was in the lower part, it must be pyriform sinus. Integrated MCQ of ENT with radiology. So the right answer of that MCQ was here pyriform fossa. Is it clear? One MCQ, question number 5, direct taken from our workbook, page number 215, patient with resistant epistaxis. They have given you a long history, hypertensive patient, old patient, ऐसा history दिया हुआ था, and bleeding could not be controlled by external carotid artery ligation. They have given you, they have changed the MCQ. Bleeding did not respond to the initial methods. What is the possible source of bleeding or which artery we ligate? So I highlight even in the revision program कि बेटा epistaxis में या तो Trotter's method पूछेंगे या आपसे पूछेंगे what is Telespa. This statement I have repeated multiple times in my lecture. That is your sphenopalatine artery MCQ. Is it clear? Answer will be B option. Yes, beta. I know the history, long history was given. Hypertensive patient, diabetic patient, and then complaining of epistaxis, not responding to the initial. What are the next options? You know, this was a direct hit, or you can say most often repeated MCQ. और आपको मेरी बात याद आई होगी, मैंने आपको क्लास में बोला था लास्ट ईयर पॉल ने पूछा था, इस बार एपिस्टेक्सिस पूछेंगे. They have asked you sphenopalatine artery. Is it clear? I'm going in a very fast mode so that we can crack all the subjects, all the 19 subjects recall. So all the final discussion of all these MCQs, dissection of choices, art of attempting MCQs for your juniors who are appearing for the next exam, definitely will update shortly. Question number 6, nasal mass, my favorite question. Second decade patient, they have mentioned that mass was pressing on the posterior wall of maxillary sinus. What is the diagnosis? They have shown you some image like this. Second decade, it is going in the favor of angiofibroma. ये तो आना ही आना है ना बेटा, ये तो हम गलत नहीं कर सकते. Polyps, they are pearly white, they are not reddish, so option A rule out. It model polyps, it should be 30-40-year-old, bilateral, so it was predicted as a straightforward rhinosporiosis. 50-year-old patient from southern part of the country, typical history of taking bath in the ponds. ऐसी हिस्ट्री होती तो बेटा हम क्या टिक कर देते, राइनोस्पोरोसिस. एंड थैंक्स फॉर ऑल द मैसेजेस आई एम गेटिंग सिंस आफ्टरनून की. ऑल द MCQs were from the class notes. They were straightforward. In ENT they have not asked you any difficult question beta. Direct hit were there, clearly given in the patient. It was here angiofibroma. Is it clear? If they give you bathing, history of taking bath in the ponds, we'll go for rhinosporiosis. Now there was a lengthy MCQ where they have given you the whole page of audiometry. The students were giving the message, the whole page of audiometry was given. There was some blue color, red color graph. Red color graph were within 25. Blue color graph, one was beyond 25, one was within 25. More than 10 times I made you in the revise in the class itself. If they show you a big airborne gap, red for right, blue for left is left conductive deafness. They have on the lower part of that audiometry page, they have given you Rini's negative on the left side, Weber is lateralized to left side. Everything is going in the favor of left conductive deafness. Direct hit, easy question beta. And if you remember, we have done 5 levels, level 5 MCQs in the classroom. So this was a level 1 easiest question where they have shown you airborne gap. But I know there was no history of any taking bath in the ponds, but I am giving you the words which should be used to rule out rhinosporiosis. So question number 7 was direct hit, very simple, straightforward question. Yes. Then audiometry, they have asked you a very simple question. Enlarged orange color tonsil, PYQ. Last time when they have asked you, they have shown you the image of tonsil, orange color tonsil, but this year they have asked you straightforward one liner that is going in the favor of Danger's disease. Option C. Now one student is saying even posterior wall of maxillary anterior was given. Absolutely. Angiofibroma, they have given you the posterior wall is pressing the posterior wall of maxillary is pressurized. Definitely this finding was there. Question number 9, ENT with PEDS, already discussed in the PEDS. History of peanut child was a PYQ of your FMG question bank, but is a simple MCQ direct hit. Back slap. How to rule back slap was the right answer, option C. How to rule out other option we'll discuss later on in the detailed discussion, but now I am highlighting, just I am confirming the option, any change in the option. One of the students is saying independent mammary perforation, patient was having 30 decibel hearing loss. Dr. Santosh, 30 decibel, size of the perforation is directly proportional to the decibel loss if ossicles are intact. ये हमने क्लास में पढ़ा था. If you remember, we have learned perforation, the range of loss is 10 to 40 decibel. If you remember, 10 to 40 decibel is your hearing loss in perforation. From central perforation to total to subtotal perforation. Even if it is 30 decibel, it is going in the favor of it. Clear? I will discuss the question number 9 if any change in the history. I will definitely discuss with the PEDS faculty. Yes, definitely. But we will update you if there is any change in the MCQ. If examiner, definitely I will just mark this question. Any change in this question, we will update you shortly. Is it clear? Coming to the next one, which of the following is most appropriate true statement? Now I want your help in this question number 10. Everybody should tell me any change in the choices. Dr. Vicky is saying in the right side 15 decibel hearing loss in the image. But 15, that's I highlight now. Vicky, I highlight this point. Okay, right side finding were given normal. Left side was conductive deafness. No worries, beta. Question number 9 we'll discuss if any change in the choices, any change in the history. will update you. Question number 10. Any change in the option beta? They have given you a MCQ on orbital complication. I think orbital cellulitis was mentioned. Which of the following is the true statement? So if you remember in the workbook, I highlight mucocele, pyocele, osteomyelitis and fistula. They are common in which sinus? Frontal. And orbital complication are common in your ethmoid sinusitis. Ethmoid sinusitis. Is it clear? So ethmoidal sinusitis is most commonly associated, is true statement. Topical antibiotics cannot be the treatment of choice beta. It cannot be the treatment. It is an emergency. We will not go with the topical antibiotics. Only anterior wall. If you remember my words, if there is a orbital complication, not only the anterior wall, then all the other structures will be involved, I can rule out. They have mentioned something normal ocular movement. Again, is a false statement. Is it clear? So answer should be option B in this MCQ. Is it clear? Question number 11 we have discussed multiple times in the T&D test and discussion segment. Why? Because it is a PYQ from your NEET examination 2023. They have given a long history of CA larynx, change in voice, difficulty in swallowing. Patient was diagnosed with some malignancy and surgical management was done. So it was direct hit from your last year NEET examination, last year NEET examination. They have shown you a permanent tracheostomy. So you tell me beta what we have learned in the classroom. In partial laryngectomies, there is no tracheostomy formation. So if they have shown you some permanent tracheostomy tube stroma on the anterior wall, diagnosis will be going in the favor of total laryngectomy. Is it clear? If you remember the line diagram, on the anterior wall we put the tracheostomy tube, on the posterior wall we put tracheoesophageal prosthesis. Again, expected MCQ, CA larynx. Is it clear? So these were the important ENT related questions. With one query, question number 9 we'll discuss, we'll update you. Any queries beta, feel free. And I want to share you one strong message beta. This is a high time now. Just relax, watch this recall session, and next upcoming days don't do over dissection of the MCQs. Spend the time with your parents and just try your best to enjoy this period. It is difficult to say, but try, and best wishes beta. And we are so confident that all the students who have taken dedicated efforts, they will definitely crack this examination. Okay. Thanks a lot. The next faculty will be joining shortly. Okay. Thank you.